And what they did is what's called value-based purchasing. They're rolling it out into all of these organizations. Value-based purchasing means that if you do provide value for the patient, then we will give you more money. If you do not provide value for your patient, we're going to take away money. We're going to take away money from non-value providing providers and give it to the ones that actually provide value. So it's a zero-sum game for them. They don't spend any money, but it incentivizes other organizations to actually do so. And they provide us the tools to be able to do what we need to do. And each of these tools are just wonderful, and it's discipline neutral, meaning that each discipline should be able to work towards the better patient outcomes. If only we use these tools the right way, and if only we have the common goal of doing it, you'll be able to provide these patient outcomes. And this is evidence-based. They already did the statistics for you. You just have to follow them. And go back and look at these rules. Some rules may look silly, yes, but it does provide better patient outcomes. And once you see the purpose behind these rules, then you're going to realize, like, oh, if only I did this, then yes, it will provide better patient outcomes.
Thank you, Dr. Conrad. He's even ahead of time. I love that. So the next one that we are going to go into is redirecting the staff from the margin to the mission, and also staff safety. And who I have covering this topic is April Dickerson.
Thank you. So my recommendation is to do something unexpected in order to take care of those silos. Often we do allow our margin of profit to drive us into which direction we need to go. This organization or this program is not working, so we're going to get rid of that and we're going to move on to something else that's maybe more profitable. However, I find in my organization it's more important to find that 17-mile wide gap where services aren't being paid for and people are falling through those huge cracks in the system, and then do something unexpected. Go and help anyways. Do it because you can. Find another way to make it happen. Find a grant. Find a way you can pull a person and work towards that. So by doing something unreasonable and unexpected that's completely mission focused, rather than worrying how much money am I going to make off of that, then those around you and the individuals that are supporting you are going to see that. They're going to see that we put people in the courthouses even though we weren't being paid for it, because it was the right thing to do and it supported the people that our mission finds important. And so rather than having the government spend money to put somebody in prison, isolate that person, get them even further away from their life skills, we chose as an organization to say, no, we're not going to continue to allow that. We're going to put somebody in there, and we're going to put somebody in there as many days of the week as we possibly can. And that funnels people to our organization through court-order treatment of anger management and other life skills that they need. So those individuals, rather than now spending time in jail for 30 days of doing a lewd act on the corner, they're now getting 30 days of treatment that they need. And rather than setting them back, making them lose their job, maybe losing custody, behind in your child support payments and other situations, instead, they're getting the help that they actually need. And by doing that, you get the attention of the people that are funding you. So yes, we made an unreasonable expectation for our staff. We jumped ahead of where our funding was. However, the rewards come at the end when you're willing to make that sacrifice and say, nope, this is an important enough mission. We're going to go ahead and move forward. And I realize for for-profits as well, it's a concern. It's always about margin, and I'd love to say that if nonprofits have a different situation. We don't. We still have to pay the payroll. We still have to keep our lights on. Our budgets still have to balance in some way or another. And so if it's possible in the nonprofit world, it should be possible in the for-profit world. And when you see people make those unreasonable steps, for example, we're going to make insulin extremely expensive. It is not good news that goes out there. However, when you have an organization or a product that goes out there that does amazing things and you go ahead and say, I'm going to make that unreasonable step, and it might be big and scary, your publicity is going to be so much better, and your cooperation is going to be so much better, and that patient care is going to be so much better. And if we all focused on taking care of one another and those that we've been charged to take care with, rather than, I wonder if I can get an extra $1 million in my checking account this year, we would have a much better society all the way around. And so it's making sure that we are taking control of our budget and knowing where we are, but leaving some room for doing the things that are actually important. The things that are already being paid for, they already are known, and those are already being taken care of. And I'm pretty sure in every single person's organization, you have a 17-mile wide something happening where you need to make that unreasonable step that's unexpected and show others, hey, this is possible. You know, you don't get along with our organization, we don't get along with you. Okay, well, I'm gonna start sending referrals to you. I'm gonna give you something so that you can see the value in this relationship and how we can support each other. I know that there are people in this courthouse that need support, so we're gonna send somebody there. I know that the youth are falling through the cracks when they turn 18, they're ending up homeless versus in services that are available to them. So we're gonna start offering a free youth service to make sure that they know that those resources are available. All of those things are unreasonable, unexpected, and not paid for. But it's the right thing to do, and at the end, we do make a profit off of it, because that 17-year-old who didn't know that resources were available and would have ended up in situations of drug use, prostitution, living in homelessness, instead they're now a member in housing, doing well and going to school or earning their GED. And you can't tell me that the lost in funding of the 3 hours we spent with that person isn't worth all of the outcome that comes at the end. So you just have to be able to find the way to make that unexpected step and kind of just do it because it's the right thing to do.
Thank you. Very well said. Changing gears, communication and trust. Michelle DiStefano.
Thank you. Yeah, I'm going to piggyback on some of the quality outcomes, and what Dr. Conrad was talking about at the beginning, is that communication is really the essence of having great patient outcomes. And first and foremost, when you're leading in healthcare organizations today, they are so complex. But two major strategies to try to enhance this communication: you do need to have a unified vision, and then you also need to have shared accountabilities. And being someone that has had over 30 plus years of executive leadership experience, clear up to chief nursing officer, I want to tell you about a story that totally impacted me for the rest of my nursing career. This is when I first started out being a nurse executive. How many of you have heard of the Josie story out of Johns Hopkins? Josie King? Okay. Well, this is a story that I was actually brought into a news conference about when I was taking advanced nursing classes in Baltimore, Maryland. And Josie was an 18-month-old who, unfortunately, was in a new home in Baltimore. And she inadvertently, as little children get into things and accidents happen, she turned on the bath water in her own house. Her mother was home, but there was 3 other younger children there as well, three other children. And the water was so hot that she ended up having 3rd-degree burns all over her. And in this story, she ends up going into Johns Hopkins, and they successfully did skin grafts. Now, what happened is that at some point, because she wasn't able to have an IV line, they did have to put a central line into her to administer some medication and to make sure she was having nutrients in her. What Josie's mother, Sorrel King, saw was that there was some deterioration in status in her daughter, and she wasn't quite being able to pinpoint this. So she did try to talk to the nurses, and she tried to talk to the physicians. And what they were really focused on was vital signs. And so they weren't quite listening to the mother who knew her child in and out, right? What ended up happening 2 days prior to Josie's discharge, Josie ended up in sepsis due to central line infection that should never have occurred because that was an iatrogenic effect, a hospital-acquired condition. So what happened was the hospital administration team had to go and report this death, and they kept close to the King family and talked about the root cause analysis that they were performing, and they kept in touch with them every week. I can't even imagine being this mother. First of all, the accident at home, and now this has happened. When the settlement occurred, what the King family did was they gave money to Johns Hopkins Hospital to give back to the community so this would never happen again, so that they could impart and put into place safety measures. And their leadership acted on this. This was in 2001. This was way before value-based purchasing. And so the leadership took heart to this. They created central line carts for physicians that were standardized, because what they had found in the root cause analysis, there was probably some problem with aseptic technique, and to having to go get the supplies in this corner and that corner, it wasn't standardized. They developed checklists on each unit, and they also empowered nursing staff to call out, or any staff, call out if they saw a physician, doesn't matter of rank, serial number. If they saw something that was happening that was unsafe, they could stop the procedure and call it out. Now, this took a lot of culture change, but it ended up impacting Johns Hopkins. To this day, they tell this story in their orientation. This is leadership, and unfortunately, you see this happening in many organizations where something bad has to happen before the good comes out of it. But now they have been known now for their culture of safety. I'm going to tell you about another story where I was a chief nursing officer, and it was a very severe, very high acuity transplant hospital. And we had a lot of accountability issues when our first C-suite came into play, but we really took this whole culture of accountability and culture of safety with communication to heart. And the one thing that we wanted was to have excellence in our outcomes. What we implemented, and it was very impactful to me, as I said, this Josie story continued to daunt me for the rest of my career. We created huddles on each unit in the morning shift with all of our nurses and leaders, and then every department, whether you're respiratory, case management, whatever it was, we had morning huddles, and we also had then at the 7 p.m. Huddles. We talked about our outcomes every day, what were our falls on that unit, what were our wins, what were our collapses, what were our CODIs. We had whiteboards that anyone could pass by to know what our status was in all of our outcomes. And then after that huddle, we all went down to the C-suite, which I was a part of. Every department head and everyone came in to report out on anything that we were concerned about for that day, that week, any hot spots. It was a stand-up meeting where everyone communicated so that all of us were aware what was happening in our organization, and we had the pulse of the organization. We actually saw the culture shift, that when I would walk onto a unit after keeping such transparent data as a chief nurse, when I first walked onto the units, when I first started, people kind of ran into their assigned rooms and take care of patients because I don't think they wanted to see me. But as the culture changed, they would actually come up to me. I felt like I was a priest in a confessional when they came up to me and said, "Oh my goodness, Michelle, we found out that we had a CODI last night." This was the change of culture. So communication, transparency, a unified vision of patient-centeredness is really what we have to really consider as we continue to move forward to keep our patients and families safe. Thank you.
Thank you, Michelle. The next section is going to be, there's actually two sections that are going to be covered in this. Whole person care, and the patient needs to be involved in the care. So they're kind of lumped together. So covering this section will be Heather Stokes.
I think this is crucial to healthcare, right? The patient, the client, the member, they have to have a voice. They have to have a voice, and they have to be empowered to get well. If they are just treated and named based on diagnosis and overlooked as a human being, they're not really seen as a whole person, and then you start missing some steps, right? And so ideally, you have somebody meeting with them from the very beginning upon admission, getting to know who they are, and then seeing what they want in their life and treatment. So I work in the addiction field, and having a voice is crucial,
but they don't know how to have a voice, right? They're usually coming in with their blinders on and their earmuffs on because they've always been told what to do and this is how to do it. And they're not willing to really truly participate. So my job is to remove those blinders, remove those earmuffs, and allow them to speak, and for me to really listen and hear them. Not one program fits all, and so we have to communicate with other organizations to see what is a good fit for them, right? They have to be involved in their treatment to get, I guess a lot of people say, the buy-in, right? What are the benefits and what are they going to get out of it, right? Not just this is what you have to do. It's critical for the patient outcomes. It's critical for that communication. And the mission, profit or nonprofit, has to be the heart. It has to be the lead. And for whole patient care, that's the ultimate goal, right? And breaking the silos in the departments, breaking the silos amongst organizations for true whole patient care to improve quality of life, to improve outcomes. So I'm going to share a story that happened at our facility, and it was it's heartbreaking, but also very empowering and beautiful. We had a client come in, and he spent about I would say 6 to 7 days in detox, really, really sick from alcohol and other substances. And his body was just shutting down. He was having issues with his liver, with his kidneys, and thankfully our medical director, he's been practicing medicine for over 40 years, internal medicine, nephrology, and now addiction medicine. And so he really wants to treat the whole person. He runs extensive tests to figure out what's really going on. About 2 weeks into treatment, some of his symptoms were persisting. And he met with the doctor, and he was like, I've had these symptoms for quite some time. Everywhere I've been, they just, say it's part of the detox, it's part of this, it's maybe a UTI, something. But no workup was done. And these are, other treatment centers that might not have that medical support. So he said, well, I'm going to run extensive labs if you don't mind. So he did. And his suspicions were true, he had to, unfortunately, diagnose the gentleman with prostate cancer. Because he went the extra step to take those tests and sit down with the client, he was in a safe environment receiving this dreadful news. He was also able to meet with our clinical director and our recovery team so we can get, it was like a team intervention and how to best care for this individual. So the clinical team was able to, they were prepared to meet with this individual to sit down and start processing this heavy news. Not only was his body breaking down from the alcohol and other substances, his family had left. Now he has cancer. So we came together and we developed a plan. We built it into his treatment plan. We made our discharge coordinator and our case managers came together, and the recovery coaches, and we called MD Anderson. We helped him make appointments, get him scheduled, and then we gathered a group. So it was the clinical director, it was the recovery coach. He chose 2 peers that he was really close to for additional support, and a few other staff members. And we drove him to MD Anderson. We held his hand, walked him through the doors so he knew he wasn't alone. And we sat right there, and we had a mini process group with him to process the feelings that he was feeling, so it would empower him to feel safe. It would empower him to be able to continue this journey, that he knows that he's not alone. And we continued that follow-up. We continued that support throughout his treatment. And then upon discharge, he was smiling. He was sober. He was feeling better. Yes, he had cancer still, but he was feeling better, and he was empowered to, and he had a glimpse of hope. He knew that he continued this journey. And so he went to his cancer treatments. That makes a world of difference. He was still sober when we called and followed up. Yes, he was fighting the fight, but he was still sober, and he knew where he could go for support. So with discharge planning, it's crucial to be able to reach out to other organizations to help the client or the patient put together the pieces, because you think of the diagnosis or being in the ER, that's a traumatic event. Their brain is not functioning rationally all the time when you're suffering from trauma, right? And so they're not able to, most of the time they don't even hear the physician or the nurse that is discharging. And so taking that extra step, you may not be paid for it necessarily, right? But it's going to improve patient outcomes. And we were laughing the other day because it's like, well, JCO says, right? And it's more than just the statistics. It's more than just the number. It's the patient's life. It can be the difference of life or death. Follow-up calls are important, right? Making sure that they continue with the care, connecting the dots, connecting the pieces for that individual, because that individual is human and he's worth it, she's worth it, worth true care, and that I think that's the ultimate goal of healthcare in general and overall. So I probably could talk for hours, but I'll stop it there.
Thanks, Heather. The next section is human touch, patient-centeredness, and that will be covered by Kiera Howard.
Hello. So I'm actually going to just start off with a brief story about myself. So Zaya Consulting Group actually started off as a customer experience consultancy. Right around 2020, middle of the pandemic, I actually had a revision to my bariatric surgery. 2 weeks after having said surgery, I reached out to the doctor and I told him, like, something's not right. I'm not feeling well. I can't keep anything down. Needless to say, long story short, I ended up going to a local emergency room and no one would touch me because I just had surgery 2 weeks ago. So I go back down to the hospital. The doctor never checks the surgery, comes to a conclusion that it's a gallbladder issue, something like that. Needless to say, I had an ulcer that formed at the incision site. It went undiagnosed for about 6 months, about the fall-ish, to the entire summer. I was admitted to the hospital, had to get a PICC line, had to do all of these things because no one listened to me. So as we were saying, the patient voice is extremely important. And I live in Pennsylvania, so this was at the University of Pennsylvania. And, surgeons are very very confident about what they're doing. It never even occurred for him to check his surgery because he was very confident in what he was doing and didn't think that it was anything wrong. It was through that journey and being in the hospital, coming from corporate and being in customer service, listening and talking to the nurses and trying to see where the gap is, why isn't my message being conveyed the way that it needs to be. When the doctors were coming in and communicating with me, they were using jargon that I wasn't aware of, and I'm not a brilliant person, but I'm not a stupid person either. So for instance, the doctor comes in and she talks to me and she keeps using the word acute. Now, I'm thinking geometry, right? Acute is a small angle. And I'm like, well, why do you keep referring to my issue as acute? And then she explains to me what acute means. So Zaya is pretty much focused on underserved communities for that part in itself. The fact that there are a lot of people that are going to the doctor that don't speak the language. In the doctor's offices, the hospitals, the practice managers, all of that is culture, right? So it needs to be in the culture to take care of the whole patient. It needs to be in the culture to not only take care of the whole patient, but to also take care of the people taking care of the patient. So Zaya takes care of, our focus, our advocacy is not only for patient experience, but for the employee's experience as well. To be able to bridge the gap, to be able to advocate for both sides because both sides go hand in hand. So our tagline is restoring the human touch to service. And I think that we forget that this is service. It's grueling sometimes. It's frustrating. It's a lot of different things that encompass patient care, and we can't take any shortcuts when it comes to it. Throughout the conference, even on the panel, trust. Whether we were talking about silos or we were talking about AI or technology, trust is a major point. Relationship building, like relationship. You can't push for your employees to have a relationship or build rapport with patients if you're not building relationship with your employees. So being able to look at your staff and being able to see where you can cultivate talent, where you can engage them, where you can kind of have them go through a little journey of this is where I started, but this is where I am, and being able to support them through the process. The trickle-down effect is that human touch that they will give to the patient, that they will pass on to the patient, that is severely needed, especially in underserved communities, because no one's listening to them, right? And they are suffering from the fact that they don't know what they don't know. They don't know the questions to ask. They don't have the avenues or the resources that might be outside of inner city hospitals, outside of inner city clinics. So it comes down to the practitioner, it comes back down to the practice, the organization, the hospital, to kind of build these skill set, but these soft skills. We also have a new generation of leaders emerging, right? And we need to push communicating, right? Effective communication, not having meetings, but having meetings about things that are tangible, things that we can, basically scale in real time, so that people can actually see, okay, when I put in this is what I'm getting out of it, and how that is going to affect not only the patient's journey, but what the employee feels like, the empowerment that they get from being able to feel like they're actually helping something, that they're actually moving the ball in the right direction. So relationship, trust, and trust is, is a time thing, right? It's not something that's going to be immediate. It's going to be when I come into my appointments, are you listening to me? Do you remember what we spoke about the last time? Or am I just a number? Do you equate my face with my issue? In my instance, the one surgery that I had, or the one issue that I had with the ulcer, actually led to 3 additional abdominal surgeries. So that same surgeon who discounted me the first time when I had the ulcer issue gave me a cell phone number by the time I had the second surgery. And the third surgery I actually just had, and these were all emergency surgeries, was back in April. So the trust and the relationship, that was something that gradually built over time. And I feel like we all kind of, not we all, but sometimes the expectation, and even from the patient perspective, I tell my husband all the time, like, doctors are just people, right? So, they're not going to just like, poof, you're cured. So it has to be the due diligence on both sides, right? There has to be the due diligence for the practitioner and the support staff to be invested in the patient. It needs to be the due diligence of the practice to invest in their people. And I stress your people, right? We need to humanize the entire process. Technology is great. I was talking to someone when I first got here, and there were about 20 people checking in at 2 o'clock in the morning on Sunday when I arrived. And we're staying at Harrah's. There's about 10 kiosks out there where you can self-check in, and nobody's using them. Everybody stood in line because they wanted to speak to a person. Maybe they had an additional question. Maybe they felt that the kiosk was going to eat their credit card, or whatever the case may be. But there is still a part of us that yearns for that human connection, and being able to share our experiences with each other helps to humanize the process, and makes it not so much a process, but a journey. And if healthcare is anything, it's definitely a journey, and it needs to be patient-centric, it needs to be heart-centered, and it needs to be cultivation of talent, especially, like I said, with this new generation of leaders that are coming in, being able to stress the importance of being able to have that interpersonal communication, that dynamic of team building, accountability, like Michelle said, and empowerment. I feel like, especially coming from a corporate setting, and I was very shocked to see, coming from a corporate setting, how much healthcare is very much run like a corporation. I didn't think that that would be the case, but it very much is. So
Kira,
being able
I
to,
don't mean to cut you off, but we want to have some time for the questions.
I missed the time tab. But
So thank you,
all of that
Kira.
to say, put your people first, right? People.
So at this point in time, as some of the things that we've talked about here on the panel, none of these are pie in the sky. None of them are unachievable. They're all attainable, but they have to be led by leadership in order to be able to facilitate these things. The definition of it is sanity, doing the same thing over and over again, expecting different results. At this point in time, I want to open the floor, the mic in the center, for anyone who has any questions for any of the panelists. Feel free. Don't everybody jump up at once.
I love your approach, solutions. I have been waiting for this panel all week. One of the things is the silos between groups and organizations. So I work with transportation companies, truck drivers. So you all can tell them whatever they need to do, but then I have to help them translate it into how they make it work in a truck, how they make it work on the road. And there's such a breakdown in the silos between businesses, the silos between people in the real world, people in the hospital, and they labeled as non-compliant when they don't show up. Well, they can't show up because their job requires that they're on the road for 4 weeks at a time. And so when they tell you I can't make that follow-up appointment in 2 weeks, we have to listen when they tell you I can't make that appointment in 2 weeks because my job is not here. My job is on the road. So what are some ideas that you guys have of how we break those barriers to help them be successful on your end, but also successful with their job that they have to do that's not in one place? Thanks.
That's a very good question. You know, a lot of things came out of the pandemic, right, COVID. But one of the things that I'm seeing now is that we're staying with telemedicine. And I just had this experience too. I had to go back for a follow-up, and I was actually given a 5 o'clock call from my doctor. I think this is where we need to instate and really talk to our patients about what is the best way to communicate and what is the time that you have now, and be, as we said, the patient-centric approach. We're far from there yet. But I was so grateful to just sit in my home and have a conversation with my physician after I already got through the patient portal, my lab results. Of course, I'm a nurse. I can translate that. I'm married to a doctor. Yeah, we all know, you know. But all he had to do was talk to me, and it was a 10-minute conversation. So I think the more that we think of this technology, and we really want to hear from, I just don't want to read lab values across, from an email, but I want to have conversation. But I don't have to drive into the doctor's office anymore. And so I think as we continue to bring this about and what some of the positive learnings from the pandemic did for us, we need to start thinking of new processes. That was a very good question.
Yes, sir.
I'm Tom O'Brien. I've been a physician for 37 years. Been a hospitalist director for a number of years and infectious diseases as well. So I've seen hospitals change a lot over a long period of time. And this is less of a question and more of an observation. Hearing each of you, all 5 of you, cover your topic, it struck me that covered a different component of patient safety culture. And just very briefly, patient safety culture grew out of the 1997 To Err Is Human initiative. And what it established is that hospitals traditionally operated by a very authoritarian top-down model. Leadership is here and you are here, and all the information and orders flowed in one direction downward. And you will do what we tell you the way we want you to, and if you do not, you will be punished or fired. And that model really results in stress and unhappiness among employees, which then in turn leads to inefficiency, fear, anxiety. Problems are covered up, mistakes are kept hidden, patient safety suffers. So patient safety culture is more about horizontal type of leadership, staff autonomy, and staff having a voice and an active part in the management. And when you have all that, then stress is less, trust is built, and all of the things that you've all covered. There's more trust, your staffing becomes easier due to less turnover, patient communication, certainly, and just even data like where calling patients 2 to 3 days later and having a follow-up within 2 weeks of discharge goes a long way in preventing readmissions, and as well as a more holistic, like more longitudinal model as well, transitioning from hospital to home or extended care. So I think what all of you had said makes perfect sense, and I think that if the solutions is going to be in patient safety data.
I'm sorry, that's actually all the time that we have for this session, but anyone who has any remaining questions, please approach our wonderful panelists outside the session, out in the hallway. Thank you to everyone. A heartfelt thank you for your insight and your knowledge. You're really wonderful. Truly. Thank you so much. Now, we have to move forward. Next, I would like to invite our esteemed keynote speaker, Wills Nikwain Gamphon, to the stage, President and CEO of Wound Masters Incorporated. Wills leads Wound Masters, which is a mobile practice delivering care to those unable to visit hospitals. His commitment to aiding those suffering from chronic wounds has seen Wound Masters grow exponentially, successfully treating thousands of patients over the past decade. Please join me as I welcome Wills to share his views and the expertise on the topic living and managing wounds.
Good morning, everybody. So my goal this morning is going to be to raise awareness for people and families that are managing wounds. In fact, there are 6.7 million Americans suffering with wounds. These are the ones that are diagnosed, 6.7 million Americans. And in the UK, there are 3.8 million people who suffer from wounds. So hopefully this morning, by the time I will be able to run through this, we shall be able to handle basic wounds that happen in our families and are not diagnosed by physicians. So we are at Wound Masters Medical Group in California and Wound Masters Mobile Physician in Arizona. How we started, why wound care, and the concept of mobile wound. I'm going to just tell you a short story of what happened. My mother lived for 87 years with a heart condition called atrial fibrillation. So when I finished college, I asked my mom, I had lost my dad, so I asked Mom, what next? So Mom wanted me to come to America and study something that will help her heal her heart. When patients live with atrial fibrillation, basically you have to be on blood thinner and some heart, medications. My mother lives for 87 years with none of those. So when I finished college, Mom said, please, my son, go out there and help me when you come back. So she found a scholarship. I came to America. The goal was to come in and study about, cardiology and a few more things that could go back to Africa. I come from West Africa. So when I finished school, I had known about the treatment that my mom needed, and so I picked up a job in medicine reconciliation. I wanted a quick job so I could get her some money, get medication, take back home, so my mother could live longer. So I picked up this job in medicine consultation. Basically, what I was doing was I go home, take care of patients, reconcile, because there's a lot of polypharmacy right now going on. So patients don't want to go to the hospital. That's the first thing I noticed. A lot of patients don't want to go to the hospital. Of course, they feel that going to the hospital, they are abandoned by their families. So I go home, take care of these patients, reconcile their medications. Every time, by the time I'm leaving, they'll call me, hey, don't come back. My legs are swollen. I don't know what this is. So I will just think about maybe increasing the dose of their water pill, and I'll go home. Other patients will say, I have this rash on my back. I don't know what is happening. They call it rash. So I kept on getting this, and I will refer some of them to the hospital. They don't want to go to the hospital. So after a few months, I decided to go visit my mom. I'd worked for a couple of months. So I called Mom. I told Mom, I'm coming home, and I'm bringing some medication. In 2 weeks, my mother developed a stroke. The following week, she lost a lot of weight, and before I even got my ticket, my mom died. So I traveled home, and by the time we're getting ready to, prepare her for funeral services, I noticed that my mom had a big hole on her bottom, and that was a wound. So when I came back to America, I started paying a lot of attention to those patients who had been telling me about rashes on their back and the lower legs and stuff like that. So Wound Masters was on behalf of my mom, and I do this with passion. I have passion treating patients with wounds. Any patient that I see, I'm treating the patient thinking of my mother. Now, that is how we started. Now, what are the benefits? Some of the benefits of doing this. Basically what we do, we hire a lot of physicians. Right now we're in California and Arizona. We zone the physicians. They come to we train them. We train them with the same passion that I developed, with treating patients with wounds. So we train them and we zone them. We put them in areas all around California and Arizona. When patients develop wounds, we have a marketing team that goes out there and look for patients with home health and hospices that need wound care. So these physicians, they commit to patients' home, do debridement, and do treatment for the wounds. And we've been doing that. We've healed thousands of patients with diabetic wounds and pressure ulcers. So basically what we're doing is bringing the hospital to the patient's home. So today I wanted us to, by the time, I want to raise some awareness so that by the time we have family members that have wounds, we should be comfortable handling those. So I'm going to be looking at two kinds of wounds. There are tons of wounds: pressure ulcers, diabetic wounds, arterial wounds, malignant wounds. But I wanted to take a look at two main kinds of wounds. Like I said, the population of patients in America living with wounds is over 6.7 million. That's about 2.5% of the population of America. So majority of these patients they're older generations. Now, how do these wounds happen? Wounds generally happen on areas that are in contact with hard surfaces, the bed, the chair, anywhere where the patient is in contact. Those areas are known as pressure points. So it could be the back of the head, could be on the shoulders, could be on the hips, could be on the bottom, heels. Those areas that are in contact with the bed or bony prominences, those are the areas that wound will happen. So if we are living with our family members that have wounds, it is important that we start monitoring them and seeing how they lay in bed, how they're eating. A couple of things will cause those wounds. And we have a lot of risk factors that we can be looking at. Patients that are advanced age, older folks, there are a lot of things that happen when we get old. We don't eat enough, we don't drink enough, and so the muscle mass generally thins up when we get old. we become anemic. Patients that have anemia will also have a high risk of developing wounds. If patient becomes contracted, contraction simply means that the patient has limited positions to move. Contracture is a big thing in developing wounds because patients cannot reposition properly well. Patients with decreased mental status, Alzheimer's, dementia, sometimes they forget themselves and they're able to lay the whole night without having that feeling that that part of the body is in pain. Other risk factors will be patients that have developed pressure ulcers in the past. If you have developed pressure ulcers in the past, it is possible that you can develop more wounds as you age. Patients with limited mobility. If patient is not able to move properly well, it's a high risk that can develop wounds. Patients that have spinal cord injury, they're paralyzed, it's a risk factor. Patients that have, they're losing weight rapidly. If you lose weight rapidly, it's a very high risk that, of course, if you're losing weight, you're not eating properly well, it's a high risk that you can develop wounds. Now, other things that are risk factors for developing wounds is urinary incontinence or fecal incontinence. Feces, urine has a very high pH, sometimes 6 to 6.7. When it gets in contact with the skin or with an open skin, it would basically just eat up the skin. And another factor is fragile skin and friction. Shearing, moving the patient with very thin skin is a high risk that the patient can develop wounds and the body opens up. So what are the early ways to intervene? If you find a patient or your family members that has that the body becomes red or has a high risk of developing wounds, how do we intervene? First thing to do is to put the patient on some form of cushioning. You know, patient laying in bed for too long. There are several forms of cushioning that are available now on the market. Gel cushioning, hospital bed generally. Some mattresses, they're known as group 1, group 2, group 3. These are all mattresses that will offload the patient because pressure ulcers are caused by weight, pressure, contact between the body and the bed. So we're trying to offload them by providing those foams and those mattresses that will take off pressure from the patient. Now, it's important too that we know how to stage wounds because wound staging equates how you deal with the treatment. So there are 4 categories of wounds or staging pressure ulcers. The stage 1, the stage 2, stage 3, and stage 4. In stage 1, it's just the skin being red. It's full thickness. There's nothing lost. Maybe patient is incontinent, spent the whole night not changed, or maybe in contact with feces or urine, the skin becomes red. That is stage 1. In stage 2, there is partial thickness loss. The epithelial tissue is lost. Because when the skin becomes moist over a long period of time, overnight, you might have that epithelial tissue that is taken off. And that is stage 2. Stage 1 and stage 2 pressure ulcers can be treated at home by everybody. How can we do that? We can intervene by offloading, making sure that patient is being repositioned every 2 hours. Make sure that you're moving the patient. If it's laying on the right side, make sure you keep moving every 2 hours. We can also treat this by exposing to air. Air heals a lot. You know, when patient is exposed to air for a couple of minutes and the skin was completely red like it's seen in stage 1, it heals normally. Another way is to control incontinence. Make sure that the patient doesn't stay overnight in contact with urine and feces. And the third and final way is to use what is called skin barrier cream. We have camoceptin, we have A&D, and a couple of them. So stage 1 and stage 2 could be managed by anybody. But when the wound gets into stage 3 simply means that some tissue of the skin is lost and we're getting into the subcutaneous part of the body. When wounds get to this level, they will need some intervention by a wound specialist. This is stage 3 in subcutaneous. Stage 4 means that the bone could be exposed, that the muscle could be exposed, and that the tendon could be exposed. With stage 3 and stage 4, we need some specialty to get in there and take care of the patient. So how do we take care of this? Surgical debridement is what we do at the bedside. We will debride the wound, take off the necrotic tissue, take off the slough, and make sure that we apply the agent that will be able to heal the patient. But the patient has to be offloaded rapidly. Secondly, we make sure, because when the body is exposed, there's a high risk that it becomes infected with bacteria. So infection control is very, very important. We do this at bedside. And then we also make sure that we apply agents that will either take off the drainage, because when wounds are healing, they're either draining or some of them could be dry. So we heal wounds by balancing moisture, applying agent that will either take off the drainage, either by using wound wax, by using alginate. There are a couple of wound care products now on the market that we can be able to use. So that's how we take care of stage 3 and stage 4. Now, some wounds that have not been debrided, covered completely with necrotic tissue, are known as unstageable wounds. These wounds when we visit the patient, we need to see how deep they are. So these ones are called unstageable wounds. Either it's covered by necrotic tissue or they're covered by sloughy tissue. So wound care is very, very common. It could be done at home. We advise that stage 1 and stage 2 could be managed by family members, but when it complicates, it is important that they call the specialist in to take care of them. So, what about diabetic wounds? Diabetic wounds basically are wounds that are caused by high sugar in the body. Now, high sugar, when patients are suffering from diabetes, it's either because the insulin is unable to be controlled, or he doesn't produce enough insulin. Long-term diabetes causes peripheral neuropathy, which means that the patient begins to lose sensation in the lower extremity. When you lose feelings, most often diabetic wounds happen in the lower legs, those on the plantar surface of your feet. There is one of my friend who called last week, and the dad had been coming back home with a long nail that got into the shoe, and every time he gets up in the morning, they see a lot of blood in the shoe, in the shoe, and they were not aware that he had a nail. So later on, 2 weeks after, he went to the hospital, and they had to amputate. This is because when patients have diabetes, long-term, they have what is called diabetic neuropathy. And most of the diabetic wounds happen through trauma, patient not having the feeling, and the wounds happening, and before you know it, the wounds are either at the point where they have to amputate. Now, treatment of these wounds, like I said, is through debridement. Most of these wounds, long-term diabetic wounds, might cause arterial wounds too. Arterial wounds complicating to gangrene, and gangrene equates amputation. So early debridement and placing the patient on antibiotics to control infection may be able to save the patient's limbs. Another way of controlling this is to have the patient on early amputation. Early amputation saves a lot of patients with diabetic wounds. So most of the ways we intervene is to control infection, make sure that we debride the wound properly well to healthy bleeding tissues. We advise the primary care to put the patient on some form of diabetic shoes to offload, because patients sometimes they develop these wounds unconsciously without knowing. And early amputation, like I said, and reconstruction of the blood vessels. So, diabetic wounds, I thought I should talk about diabetic wounds and pressure ulcer, but there are many other kinds of wounds, like malignant wounds that we encounter in the field, arterial wounds, venous ulcers mostly happen for patients that are retaining fluid in the lower legs. And treatment of venous ulcer will be to do some form of multi-compression dressing to address the veins that are unable to have a venal return to, and then putting the patient on a water pill. So I guess this is what I had for my discussion this morning. But basically, we do more than just what we had this morning, because we have providers, doctors that are specialized in wound care, and they move around. Educating the family is a very, very important thing. Talking to the family about repositioning, helping the patient control their diabetes, making sure the patient is feeding properly well, making sure that friction is reduced when you move the patient. It's very, very important. Patient education for wound care is really big. So thank you so much, and hopefully it gave some help to those who are having family members with wounds. Thank you.
Okay, a special thank you to Mr. Wills, who just gave a wonderful presentation on wound healing. And moving on to our next session. In a world increasingly marked by fast food culture, understanding how to construct healthy eating habits is crucial. Our next session, a panel discussion on the topic, Building Healthy Eating Habits, the Importance of Food Environments, will have us dwelling on this subject. So join me in inviting our moderator for this session, Tanya Jolliffe, founder, provider, certified integrative mental health professional, registered dietitian, nutritionist, and licensed dietitian at the LIT Wellness Solutions, and our panelists, Joe Villegas, founder and CEO of Paragon Wellbeing, Dekat Shakar, CEO and founder of Bodyholic, Raheel Sadiq, motivational speaker, and Dr. Stephanie Bathurst, clinical sexologist, therapist, and healer at Bathurst Family Therapy, LLC. Please welcome them to the stage. And if I mispronounced any names, please take some time to claim your noun.
You're doing a fine job. All right. Well, here to talk about food, which following that last with the pictures, I'm glad we kind of transitioned a little bit. So the topic about importance of environments, it's a broader topic. So we're going to break it down, but we're first going to take a moment to introduce ourselves, kind of let everybody know who we are, what we do, in case they haven't seen us in one of the other presentations that we've done. I am the founder of LIT Wellness Solutions, and I am a non-diet registered dietitian, focusing on the mental health and the whole person. I wrote a journaling program, the Mindful Me Journey, and it's a tool not just for me, but for any practitioner who is trying to help their clients put language behind the emotions, feelings, what they do with food, and why they do it. And that's my big contribution to the world, is to help other clinicians be able to help that language of, you know, what am I doing and why am I a binge eater? Well, you have to understand what do you do and why you do it. You want to tell us just a little bit about you and what you do?
Thank you. I'm Dee Katz-Shachar, and I am the CEO and founder of a small company called Bodyholic, which is an international and global fitness and health community. So on bodyholic.fit, there's the workouts. But on the podcast, which I feel is the crucial appendix, that's where I try to bring cutting-edge research down a notch so that we can all understand it, because I have that mission of making information accessible to absolutely everyone. And a lot of it is surrounding nutrition, so I'm very happy to be here today.
Go ahead.
Hi, I'm Dr. Stephanie Bathurst.
It's on.
Hello.
Just hold a little closer.
Sorry. Hi, I'm Dr. Stephanie Bathurst. I'm the founder of Bathurst Family Therapy. I'm a clinical sexologist, relationship therapist, holistic healer. I'm also a Pilates instructor, so we provide pelvic floor conditioning programming. We integrate food as medicine for some of our holistic treatment protocols for clients experiencing mood disruption, low libido or libido dysfunctions, and other presenting issues that impair their quality of life. I also provide education and guidance for herbal supplementation and sourcing.
Morning, I'm Joe Villegas, the founder and CEO of Paragon Wellbeing. We're a health and wellness coaching company primarily focused on employee wellness programs for small and mid-sized companies. The bulk of our programs focus on a holistic approach to wellness, everything from nutrition, physical health, mental health, and well-being, which is obviously a very important topic in the workforce today. But all of our programs are rooted in healthy behavior change and building healthy habits. So very excited to be on the panel with these folks today covering that topic.
Great.
Morning. How's everybody doing? I do want to apologize in advance. A lot of people did ask me when I arrived. I am sorry to break it to you. I am not Dwayne "The Rock" Johnson, so I do apologize to a lot of you. But all jokes aside, my name is Raheel Sadiq. I am a motivational speaker just outside of the Washington, D.C. region. I recently lost 190 pounds. A lot of weight, I know. And I've been booking speaking engagements on multiple platforms and very excited to be here on this amazing panel to talk about this very important discussion about building better eating habits, because obviously I didn't have the best eating habits, losing as much weight as I did, but excited to be here and can't wait to get this kicked off.
Great. Well, before we jump into talking about environments, which is availability, quality, safety, affordability, and all those things, we have to first, I think, identify, because we're each professionals trying to help people develop nutritional health. Let's talk about what to us nutritional health even means, because I think what's the goal we're striving for? Let's identify what that goal is from our each perspectives.
I feel that the basics is known to most of us, and you know, getting the adequate nutrition that we need on a daily basis. My point of view is a little bit more, I guess, focused on populations. And when I think about food health, I think about healthy food being accessible and getting rid of the food deserts. So that's kind of my approach. And there's a lot of strategies, but we can cover that another time. But so I'm kind of looking at groups and communities. That's my point of view.
Great.
Thank you.
Great. Dr. Stephanie?
Sure. When I'm thinking of food health, I think about a healthy body and how that's defined. And I think a healthy body is comprised of what that somatically feels like, right? So less of body form, which I think has been historically what we've focused on, the weight component of health. And I can understand why we as a field have focused on that more, because it's more easily objective, right? Objectively measured. We're wanting to veer away from that and more toward more healthier expressions of what it means to have a healthy body. So having a healthy body means a brain that is clear and active so that you can think clearly and articulate well in your Monday morning meeting, being able to climb a set of stairs. Wow, that was loud, sorry. So that your knees aren't burning or your lungs aren't burning, being able to have an active libido so that you can feel securely attached to your romantic partner, right? These are all closely objectively, expressions of health that can be measured. And I think our focus should be more on that, and food can be an expression or a way in which we can get people there.
Great. Joe?
So in our context, we talk about food health for the individual in terms of their relationship to food, right? So what we're really aiming for is not perfect, right? Because no one can really attain perfect, but is going for better. So being able to choose better options most of the time, but still be able to have fun, right? Food can be very comforting. It's how we connect and show care and love, at least in my family we do for sure. But in the long term, it's helping folks to make those better decisions over time and empowering them despite their situation, the food environment that they're in, to make those healthy choices.
Food. I love food too. But you know, it's crazy. You know, my entire life, I was actually pretty much born obese from birth all the way up until I was 27 years old. I was 405 pounds, and I had some horrible eating habits. And during those times, I was actually bullied a lot. I was made fun of a lot. And at that moments, and during those moments, a lot of times, what I would do is I would actually, because I was bullied so much, I would actually starve myself all day, and then I would eat probably at the end of the night all by myself, like thousands of calories, just pumping them in. And over time, the weight just kept piling on, the calories, and it just was, that was my relationship. I turned to food as a coping mechanism, and I had to really learn the hard way when I got to that, you know, the top of the mountain at 405 pounds, that, you know, food can be used as fuel. It can be used as a tool. It doesn't have to be just a coping mechanism when you are depressed. It's just a matter of having that plan, that structure, that outline. And thankfully, I was able to accomplish that, you know, for the last 13 years of my training regimen and my process. And, you know, just blessed to be down, you know, this 190 pounds. And now, anytime I have food, I really try to enjoy it. I really try to make that relationship better, you know, instead of just hiding from my problems and using it as a coping mechanism. So, yeah, for sure.
Well, you guys have tapped into some of the things that we want to dive into, because one of the biggest things is we have lived in a diet culture. We have lived in a diet culture that is focused on how you look, not how you feel, focused on what products or services, not on the health side of it. And we are moving to a culture of wellness, and so much has been echoed in the last 3 days about people wanting to look at the whole person. So when we talk about environments, we have to talk about and Dee, you kind of set it off, so let's start. Availability. You know, we assume everybody has availability. That's a wrong assumption. And so what they do have available is not always high quality. So when we want to talk about not just feeding yourself, we want people to think about feeding themselves with nutrient-rich foods. So let's talk about availability as we go through, and that nutrient-rich versus just calories.
I'm going to start off by saying something, and I hope it doesn't come off as judgmental, because it's really not. It's actually out of concern. I come from Israel, and in Israel there are food deserts, and they're a huge concern for me. And it's very hard to get to those specific communities. They're very closed. But in general, healthy, nutritious food is available. And when I came here, okay, I'm really sorry. This is not judgmental at all, but I was actually a little upset to see that even here in where I'm staying, things that I would normally eat are completely unavailable to me. So I'm making my way through it, but I'm feeling discomfort. And I'm bringing this forth because what I'm saying is it's really not accessible to many, many, many people. And I also lived in the States for a while, and I know that there are chains, grocery stores that are extremely expensive, and they have lots of nutritious foods. And then there's the places like 7-Eleven and convenience stores that are cheaper and very available, and they're, you've got them in every gas station, and that's an easy place to get food, get the calories your brain is telling you that you need, so it's available, and I'm going to go get it. And I think for the most part in the States, that actually might be the case. And I'm not sure, but I think that might be the case. And I think it is crucial, crucial, crucial to make healthy food the easy option. And that already goes way up. I'm not saying that anybody's at fault for choosing that food. That the food that I'd like you to choose isn't available. So going way up and starting to implement strategies in order to make it available is the key. And also, it doesn't mean raising. I personally don't believe that it means raising taxes on sugary drinks, because that's kind of punishing the taxpayer, but rather incentivizing establishments of grocery stores and farmers and bringing them to a point where they want to get to those areas, whether it's urban or rural, get to those areas and sell those nutritious foods.
Great. Dr. Stephanie, you're in Hawaii. You've got fresh everywhere, right?
Fresh everywhere.
But is it always accessible to everybody?
Yeah.
That's great.
I mean, yeah, you do still have McDonald's and everything, right? Like, you still have your fast foods that you can get, and people still enjoy them. And I think you can't talk about availability without talking about education. Because if you don't have the foundation of information to be able to appreciate the difference of nutrient-deficient preserved foods versus nutrient-dense fresh foods, you can't make smart decisions for yourself and your body to feel the impact in the quality of life and quality of relationship that those decisions will have, right? If you don't have the understanding that 80% of your serotonin is actually created in your gut and highly, highly depends on the food intake that you choose, if you don't know that.
That conversation and education about the second brain, right?
Right.
That's a whole new concept
Right.
for a lot of people.
Absolutely.
Definitely.
Right.
Yeah.
So yeah, I mean, I think education is key to being able to make conscious and appropriate choices for your own body.
Definitely. Joe?
Yeah, just to echo what Dr. Stephanie said, I really think when you're trying to solve a problem, it begins with awareness, right? And building education and given the food of what's available, but it's helping people understand what is available to them and then what to do with that. So if it's not the most nutrient-dense foods, that's okay, but giving them a set of like heuristics of like rules they can follow to make the best choices possible for what's available. I think that's probably
Definitely.
a great place to start.
Man, those are tough to follow. But for me, I think personally, growing up, so having a Pakistani descent, I grew up with a lot of great food. My mom was an amazing cook. And having, obviously her and family, close friends, I would constantly being around those foods. And even though it was great, it was, high carbs, oily, high saturated fat, and constant on it, but I just didn't care because the weight just kept piling on, and I was using it as a coping mechanism. So I think, talking about availability, I think the bottom line is you need to tell yourself the truth. If you know you're in a position where you have easy access to a McDonald's, to a Burger King, to a Pizza Hut, I mean, I used to pound those down all the time, late at night by myself, because I was so ashamed to eat in front of anybody and everybody that it was easy. It's easy to go pay $10 at McDonald's versus to go to Trader Joe's and Whole Foods, which costs $4 for a lettuce and $4 for a cucumber. It's easy. And I feel like if you want successful results in health and fitness with diet, you need to tell yourself the truth that these bad foods are going to damage me, right? So make sure you have that discipline, have that structure, tell yourself the truth. And secondly, you have to find a plan, find a way to make sure that you don't use that food to cope with whatever you're going through. Don't find the easy way out. Make that plan to understand, you know what? I don't want this large pizza. I know now if I go have a large pizza, I just destroyed 2 hours of my workout. I know I need to save my calories for later. And even though it does taste amazing, trust me, I love pizza. I'm from New York. Joe's from Jersey, so he'll tell you pizza is a part of my blood. I now know when I have pizza now, I try to make it as a treat for myself. I don't have it every single day or every other night that I used to before. So I think that's the bottom line for me is just tell yourself the truth. You have great foods available. You have high quality fresh foods available. But be honest with yourself. If you're going to have this greasy meal, make sure you understand what it is going to do with you. And it's okay to live life, it's okay to have that once in a while, but just don't make it the norm. I think that's the bottom line for me. So,
You all have touched on several things, not just the availability, but quality. I feel like it's a double-edged sword. In my experience, I worked as a clinical dietitian, I've worked as a health coach for a number of years. I work with truck drivers. I hear truck drivers say all the time, there's nothing available, there's nothing available. Well, there is. You walked past it because what's sitting out on the counter is what they want you to buy because it's that whole profit margin, right? And so some of it is getting those companies to be incentivized, as you were mentioning, to put the healthier stuff, not banana, that's, but nuts and having sections of nutrient-rich food. So at the same time, Di, you also mentioned the other side of it is there is stuff available for sale and packaged in the United States that would never pass in Europe, would never pass standards. It has more preservatives, more additives. The food quality has been allowed to be marketed differently to us than it has to other people. Now, is that because we haven't stood up and said we demand it to be different? Most certainly. So let's talk about that. What steps can we begin to say, okay, this is what we've seen, but we want it to be different. As healthcare professionals, as people who in technology and in the health space, what can we do to make our voice heard to say we want quality, we want it available, we want it at a decent price, we're tired of the propaganda. So let's talk about that a little bit with some strategies and solutions we might offer to begin to make our voice known.
I really appreciate what you just said. And I think that the education aspect of it is huge and empowering, and nothing can really move forward without it. That's what I do. I educate people on health. But it goes back to what I said before. Nothing can happen if I just teach people stuff, but they literally don't have it available, because when you're hungry, your brain is going to tell you to eat. And that's it. And like, move out of the way. I'm going to go grab whatever it is that I'm going to grab, and I'm going to eat it. So I'm not going to go from point A and drive a whole bunch of miles over to that affordable Trader Joe's, let's say, in the hypothetical world. Okay? So it has to be, there has to be a deep understanding of the aggressive marketing that there is right now in at least this country, the United States. There is aggressive marketing regarding snacks, very non-nutritious foods. A lot of it is geared for the kids. They're hurting our kids. I mean, I wish I could help in this case, because this kind of blows my mind. But it is crucial to actually do the aggressive marketing on the nutritious side of things, and educate with really go head to head with the giants of the snack foods and their marketing. And I'm just going to say that it has to be policy. There has to be lobbying, because it's not going to work without the government. And so there has to be a lot of incentives and regulations, and I guess people like us have to start lobbying a little bit more, I guess. Right?
We have to be loud. I mean, we can educate our patients all we want. We can educate our clients. We can make culture change within an organization, which is what a lot of us do in corporate wellness, right, Joe? But at the end of the day, the marketers and the big business, they're setting the mark.
It's very, very expensive to have communities that are obese. It is very, very expensive. And I think that once someone gives the government the numbers, that it costs a lot to have communities with all kinds of metabolic diseases, that costs a lot more. And then, money can start talking.
Dr. Stephanie? Yeah, other thoughts?
So Dee talked much more on like a macro level, which is amazing and perfect, and everything you said I agree with 100%. So I'm going to talk a little bit more on a micro level.
Great.
I think when we are working with a client, because there is so much inundation of marketing like in your face actively on a regular daily basis, and that information is so flooding for the typical person, ourselves as well, right? Like we experience that too. And we're not next to them as they live out day to day, right? It requires a collaborative team of providers, not just one singular person, right? So especially in the beginning, when we're trying to habituate new lifestyle patterns, and trying to help the client buy into a change process that is notably going to be uncomfortable, because any kind of change process is uncomfortable in the beginning, which is a natural deterrent for the continuation of that change. We want to build them up with as much supports as possible. So it really does require a team effort of providers to help them ground in the importance of making these changes and in directing them to trusted, third-party tested supplement brands or whatever it is that the treatment plan requires, because they're not going to be able to find that information on their own.
And in that collaborative effort, I'll just throw this out, doesn't it also include changing the language? Stop saying don't, and help them understand do, and select and choose. And
I love that.
the language,
More
it makes
active,
all the
empowering.
difference. You go to a diabetes educator. If there's any diabetes educators, I'm not trying to call you out, but the list is don't. And as a dietitian, I learned a long time ago, never ask someone to do something that you wouldn't do yourself.
Right.
That was the best lesson I ever learned in my internship. Well, I don't want anybody coming at me with a list of things I'm not allowed to do. Help me, empower me with what I can do, the choices I can make.
Right.
So that's that education part, but it's also collaboration. We ought to start talking in a positive, encouraging language. Joe, are you seeing that corporate-wide?
Yeah, for sure, 100%. So when we, actually to piggyback on what you just said, so when we go into an organization and work with them, we don't tell employees, don't do this, don't do that. It's what can we add in first, typically just habit-based. We don't even say, pick from this food list and not this one. We might start with something simple like, just try eating slower, right? You're ultimately going to get fuller sooner and stop eating as much. But ultimately, I think when kind of going back to the question originally, is the easiest way, at least in this country, to get things started is to vote with your dollars. If you're not going to go buy that candy, it's one less person supporting that effort. Like for us with corporate wellness, we go work with groups of 2, 3, 5, 800 people at a time. And so if we're able to have our ROI, we call ripple of impact, if we're able to have a ripple of impact where more folks are subscribing to a healthier diet, they're less likely to spend money on those less ideal foods, which then ultimately would lower the budget for marketing that they have and hopefully eventually extinguish it.
Right.
Would be the goal. But really, I think ultimately it's helping folks to empower them, show them, hey, it's not an all or nothing. Like, let's just get things started, get you going on the right track. Over time, that'll expand and they can choose better options. But really what's happening is they're voting with their dollars, right? Buying healthier food.
I try to get my drivers to do that all the time. If you stop buying the candy bars, they're going to stop putting them out there.
Yeah.
Definitely.
No, that was great. And actually, speaking specifically geared towards corporate, I think that's a great point, Joe, and the team. I also feel as though you have to learn how to be comfortable being uncomfortable. And I think another issue that a lot of us are having today is you hit a quarterly goal and your boss or your manager is like, let's go out. Let's go out for dinner. Let's go out for drinks. Let's go out for appetizers. Let's go have a good time. And I'll just use myself as an example. Somebody who is very locked in, very driven. I try to tell people, it's easy to feel that pressure because your colleagues are having fun. You guys hit your quarterly goals. Everyone's having drinks. Everyone's having appetizers. Everyone's having meals, and they're high caloric intake. And it's easy, right? It's easy to be like, well, everyone else is doing it, so let me fall into it. Whether you're 4 or you're 40, peer pressure happens to all of us, man. It happens to every single one of us, right? It's easy to fall into that. So I feel like you have to be able to, from a leadership perspective, understand that if you hit your quarterly goal, try to recalibrate, shift your mindset to be like, you know what, let's go out and do something more on an activity side. It doesn't have to be someplace in a, in a drinks atmosphere, appetizer atmosphere, dinner atmosphere, high caloric, or on the flip side of it, it's okay if you are on that team and your boss is taking you out. It's okay to say, yes, I would love to come celebrate with my team for sure, but I'm not going to have this, this beverage tonight. I'm not going to have these appetizers tonight. I'm going to have a water and I'll have a salad, and because I have my own personal goals, I have my own personal missions, and I think that is really good. I think this is something that should be happening more, to be honest with you. I think it's easy, and I think that's the biggest problem that we're having, especially in the corporate world that we see here today, is falling into that trap of the peer pressure. Make sure you stick to your guns. I mean, there's so many times. The first year that I was training from 2010 to 2011, I didn't go on any vacations. I didn't hang out with any of my friends. I didn't go to any restaurants. I sacrificed so much, and I had a lot of support because they understood that I was on a journey, I was on a mission. So I feel like it can easily translate into corporate America too. It's okay to be comfortable being uncomfortable, and if people are around you, you have a good support system at home, with your friends, with your colleagues, they will support you. You just have to have the courage, build that belief that, okay, like I'm on a mission, I'm on a journey, this is how it's going to be. And again, from the leadership side of the house, just be creative. Of course, it's easy to, do the norm, but there's other ways. And I think from the leadership down and then also the employees down in corporate America space, we can all be better. And I feel like those are some ideas possibly that hopefully could help out.
You hit it. Now, we only have 8 minutes left, and I do want to leave time if anybody has any questions. But you tipped on the whole safety, the emotional safety, right? We can talk about safety in environments all we want about food safety, but environmental safety. So in just a couple minutes each person, social media is everywhere, and family dynamics of families saying, oh, you don't like what I made, you didn't have 3 portions, and so give us a tip on how you think people can begin to navigate and own that emotional well-being for themselves for that emotional safety of food integrity.
I have to say that what was just said, what I think is the bottom line, the social support, the family support. I wrote a short book. I don't mean to plug, it doesn't matter, but that's the main thing that I talk about is the bottom line, the thing that research points to the most is that when you are so held and so supported, then you're pretty much good to go. And the thing is really the courage to reach out. I also work a lot with mindfulness, and everything that you said just really resonated with me. The feeling of just being uncomfortable and being totally okay with it. Again, but you do have to reach out for support there because that really goes hand in hand. And just to touch on the Instagram feed, et cetera, all the feeds, unfollow anything that you feel is toxic and make sure that your feed is as clean as possible, because I don't know if you're going to take the app off your phone. You might leave it on, but maybe you can cram it with all the stuff that is super positive, super supportive, and then you've got just a lovely support system on your app. Thank you.
Totally.
A lot of what I do in the support of my clients is psychology and somatics of food health and of body health, right? So, and I think the foundation of that starts with self-love and bodily respect and appreciation. So questions like what are the underlying function and needs for food intake for you, right? Like, why are you eating on a regular daily basis? Is it to alleviate boredom? Is it to ameliorate emotional pain or social anxiety? Is it to just survive and keep your body moving so you don't pass out? Or is it to optimally perform to become an athlete? These are all very different functions, and the fulfillment of food and the appreciation of food intake or the choices that you make are going to vary pretty significantly depending on the underlying function or the need there. So I think that's where we start.
Great.
Yeah, so kind of to piggyback again, I think, and probably the psychologists in the room would agree, is one of, if not the most powerful force in the human mind is you have to stay congruent with how you identify yourself. So when we work with folks, we kind of have like a 3-step framework that we go through. Of the first step is educating people, making them cognizant of like what the right choices are. The second would be getting some emotional connection to that. If you're not emotionally sound in what that thing is, you're not going to do it, right? And the third is cultivating an identity that's congruent with that. So Raheel here is probably the perfect example of what I'm talking about.
Exactly.
Right? Like if I said, Raheel, we're going out for pizza, he'd be like, no, we're not. We're not doing that. We're going to go out for water and salad. Sounds like a hoot. I'm in. But is helping folks...
Sparkling water.
Right. Yeah, we'll do that. Start slow. We'll add it. Is cultivating that identity, and then they're only most likely going to make choices that are healthy choices congruent with that identity, versus if they are down on themselves or negatively seeing themselves, have a negative feed on their social media, it just feeds into that spiral of making poor choices.
Exactly.
That was great. You are in Jersey. I do love Singa's famous pizza. So if you ask me for that, I might have to join you on that. But no, I know we're getting close to time here. But I think when it comes to social media, I think the bottom line is stop comparing your journey, your path to everyone else. You know, everyone tells me that they know me. If you guys don't know, I was in Men's Health Magazine twice. I was on NBC News. I did Fox 5 DC News on World Obesity Day. But I've cried so much, I struggled so much, I suffered so much. I lost my father in my hands. I gained 65 pounds during this process. I had to get back surgery done. A lot of people who don't know that, they might not see that on my story. I'm actually very open with it, but others might not be. So if you see somebody with a six-pack or you see somebody who looks great in a bikini, that's great for them. But don't sit there and say and think that their life is perfect. My journey was far from perfect. I had to fail over and over and over and over again. And it's not about how many times you fall. It's about, do you have the litigated gall to get back up? And that's the bottom line. So with social media, don't compare yourself to anyone else. Your journey is your journey. Own it, love it, appreciate it.
Oh, perfect. Can't say any more. Question.
Awesome. Thank you so much, everybody. Quick question, and just for context. In a previous life, I was professor of nutrigenomics at Mount St. Vincent University in Halifax, Nova Scotia. We had a dietetics program. And one of the things I did was help come out of my discussions, call it, a analysis, if you will, is that dietitians were saying, orderly or healthy eating, insofar as how we need to retrain people in terms of food accessibility and food availability, it almost seems like you need to be disorderly, or essentially you're having an eating disorder, so to speak. Because if you walk out and, to your point, this notion of food deserts, it's not real food, is it? It seems to me it's really more entertainment than it is food. So the whole notion of, marketing and industries, that's going to be a big rock to move. I guess the question is, as coaches, because I'm assuming a lot of you coach, what kind of support do you encourage in the home? So if somebody is trying to, meet a certain nutrition goal or health goal, how much time do you spend in building the reinforcements in the home so that they might achieve that end? That make sense?
Yeah, great question. I love that. So your immediate food environment's where you live, right? You're there most of the time, say. So when we work with folks, the first thing we do typically is what we call a pantry audit. So we go through and we say, kind of our law of gravity, right? What goes up must come down. Ours is, if it's in the house, someone's going to eat it. So it's going through and making sure that those triggers are not there in the immediate at all. Like, donate what you can, get rid of what you shouldn't be eating, and let's restock with those good things. And then you're less likely to reach for a candy bar because it's just not there, right? We have this concept that we call like just creating friction. So you want to create a lot of friction between you and the thing that you probably shouldn't be having. Meaning, if you don't have ice cream in the house, how are you going to get it? You got to get dressed, you got to get in your car, you drive there, spend money, come back, and then eat it. It's a lot of steps to make it happen. Where if you can reduce friction between the healthy food, if I just have a bowl of fruit on my counter, I can grab an apple and there's no friction there, I can get right to it. So those are kind of two quick and easy ones that are, anybody could do that, right? It doesn't take a lot of brain power, and it's something you can lead them through in a 20-minute conversation and they can do on their own. That's a great question, and my wife and I are working through that together quite frequently. No, it's so. And to Rahil's point before, right? It's kind of an 80-20. Like, you got to live your life and have fun. And I know for us, like, food's a very comforting thing, but I think it's setting boundaries around those things. And so, as an example, like in our household, we do like one fun dinner a week. So that's where we order out and eat the foods that we like to eat beyond just the healthy stuff.
Thanks. Barry, I'm sorry we're not going to have time. I hope you can grab, I know you come up and your time is up. I hope you'll get with any of the panelists for your question. And thanks for this great conversation.
Thank you.
Thank you all.
Thank you for having us.
One thing real quickly. In the structural things you're looking at, I'm free to discuss this with anybody, look at where food goes that comes into your city. What we've discovered in Dallas is that many times when the food goes to the warehouses that go to the wholesalers, the warehouses are full and it goes to the dump.
Oh, that's a whole nother discussion.
Thank you.
What a wonderful discussion. Thank you to our panelists for their insights. And I just want to apologize to the gentleman. If you've been here the last 3 days, you've seen him get cut off at the question line. But I really appreciate you always getting up, always being inquisitive, and having something to share. I do appreciate you. Now, moving on to our next subject. Diversity is key to progress, yet it remains underrepresented in clinical trials. This disparity affects the validity of our medical advancements as we fail to fully consider women in minority groups. Get ready to unpack this crucial subject with our upcoming panel. Please welcome our moderator, Dr. Pranali Hoyle, professor and consultant at Neurodiversity of Northeast, LLC, and panelists, Parmjit Kaur, speaker at Parmjit Kaur, LLC, Dr. Joseph Rosado, MD, MBA, physician speaker, author and educator at International Medical Consultants Incorporated, Yasmin Samatar, co-owner of Mawada, and Firaoli Adam, co-founder of Mawada, as they share their thoughts on the topic, Diversity Matters, Why More Women and Minority Groups Must Be Included in Clinical Trials. And if I mispronounced your name, please take a moment to reintroduce yourself to the audience. Thank you. They're not here yet. Okay, we're going to take a brief moment to pause while we wait for the rest of our panelists and our moderator, and we track them down. I do want to apologize. We've had some slight changes to our schedule, so we're just tracking down the rest of our panelists and the moderator. At this time, you are welcome to take a short break for bathroom, water, coffee, and for networking. And we're back, ladies and gentlemen. We're going to keep moving forward. At this time, I am going to reread the introduction and reintroduce our wonderful panelists and our moderator. Diversity is key to progress, yet it remains underrepresented in clinical trials. This disparity affects the validity of our medical advancements as we fail to fully consider women and minority groups. Get ready to unpack this crucial subject with our upcoming panel. Please welcome our moderator, Dr. Pranali Hoyle, professor and consultant at Neurodiversity of Northeast LLC, and panelists Parmjit Kaur, speaker at Parmjit Kaur LLC, Dr. Joseph Rosado, MD, MBA, physician, speaker, author, and educator at International Medical Consultants, Inc., Yasmin Samatar, co-owner of Mawada, and Faroli Adam, co-founder of Mawada, as they share their thoughts on the topic, Diversity Matters, Why More Women and Minority Groups Must Be Included in Clinical Trials. We're excited to hear all of your insight. Thank you.
Tell me if you can hear me. Okay. Sorry. Hi, welcome everybody. We're very excited to discuss this topic, and I'm excited to introduce my esteemed colleagues here, Dr. Joseph Rosado, Parmjit Kaur, Ferrari, and I apologize if I'm saying your name incorrectly, but I would like all of them to introduce themselves. My name is Dr. Pranali Hoyle. I'm coming from a very behavior analytic background within research. So I have 20 years of experience within applied behavior analysis. I work with children and adults on the autism spectrum, as well as conduct a lot of parent trainings and school consultation for children and adults on the autism spectrum. I'd like to introduce Dr. Joseph Rosado.
Dr. Joseph Rosado. Okay, thank you. I'm a primary care physician by trade. My history in medicine is quite varied. I started out as a certified nurse's aide at the age of 16, became an EMT, then an EMT paramedic, then a cath lab technician, then I went to chiropractic school, then a medical doctor, then I got an MBA in healthcare management, and within that, yes, what do you tell me to do?
Grab the other mic.
Does that work better? Oh, yes, much better. I said hip, hop, the hip. I'm sorry. I relapsed. So, went to medical school. After medical school, I got an MBA in healthcare management. And within medicine, I've done a lot of things, including medical director for a clinical trials, clinical research company. So I have quite a bit of experience doing clinical trials and research with specifically minorities. So that's one of the points that we'll be addressing today.
Okay, how do I follow that up? Okay, hi everyone. My name is Parmjit Kaur. A little bit about my background and how I fit in. So I am actually a project manager. I also serve as the executive vice president of PMI Southern Nevada chapter right here in beautiful Las Vegas. I also have worked in healthcare for almost 20 years. Don't be fooled by my young face, but I've been in healthcare for quite some time. But the reason I'm really here today is I am also a patient, like many of us actually sitting in this room. Whether you, if you go to the doctor to go visit your PCP, whether you go to your podiatrist, all of us are patients, right? So that I'm here to represent the patient perspective. So I'm a patient who was diagnosed with multiple sclerosis in 2008, and I'm going to talk a little bit later on about how I was not able to participate in a clinical trial because I was not made aware of it, but I'll talk a little bit more about that later. But being a patient is why I'm here today, and I'm also a patient advocate. So that's a long way of saying that is why I'm here. So,
is it on? Hello? Yes. Yes. My name is Yasmin Samatar. I am a respiratory therapist for about 6 years, and also the co-owner of Moada, which is a PPE company, and we launched our first patented disposable hijabs in November of 2022, and very excited to speak today.
Hi everyone, my name is Fraoli Adam, and I'm also a respiratory therapist. I met Yasmin at school, in a respiratory school, and been working as RT for the past 6 years. And we also co-founded Moada, which is, like Yasmin explained, we are first pilot project being disposable isolation hijab. And we will kind of go over it later, the reason why, how we got into this business field. Definitely it was not something that we planned, but you know, the best thing is when you're the one that actually facing the problem, looking for a solution, you kind of come across something that hopefully can make a difference in the future.
Amazing. Thank you so much, everybody. And I'm so excited to welcome all of you to this panel. I'm excited to talk about this topic. It's a very important topic, near and dear to my heart, especially because I do a lot of research within the autistic population, where minorities and people that live in specific rural areas who still don't know what behavior analysis is. They don't know that the treatment exists. They don't have access to it. So really including a lot of diverse populations is very important to research. So my first question, or the first question for the panel, and I'll talk briefly about this as well, why minorities may be resistant to participation in the clinical trials. So as we know, past research has indicated that there's definitely poor ethical standards that have existed. So one of the studies that I'll speak to is the Little Albert research, which was conducted in the 1930s. I'm sorry, I am not tall enough for this panel. It's just nuts. So bear with me, sorry guys. So the 1930 study that was conducted with Little Albert, where it was an operant conditioning study where he was exposed to various stimuli, and one of the stimuli he was exposed to condition fear was a white rat. So then every time he saw the white rat, he would engage in crying and screaming behavior, and this was done through that with John Watson in the 1930s, a very famous behavioral scientist that we still admire, and a lot of his studies do have valid and merit, but that particular study did condition some fear into a 9-month-old child. So it's that aspect of consent and assent that we really want to talk about, and why people might be resistant to participation in certain research when information is not given to them of what's really happening within that research. So I'll pass the question over to the panel and let Dr. Rosado and the rest of the panel add to that.
Who here is not, I repeat, who here is not familiar with the Tuskegee syphilis study? Hands up. Okay, so for those of you that are not familiar with that, I will do a brief recap of that. That study was conducted in Tuskegee, Alabama in the early 30s, where it was an observational study of African American men with syphilis. However, they did not receive treatment for their syphilis. They were being observed because, a little background on syphilis, you have 3 stages: primary, secondary, tertiary. Primary syphilis, you notice a chancre, a painless chancre or a sore in the genitalia. It's pretty asymptomatic. Secondary syphilis has that chancre in conjunction with pain, general malaise, loss of hair. Sometimes they get a rash on the soles of their feet and the palms of their hands. And then it progresses, if not treated, for 20 to 30 years, and they develop what's called neurosyphilis, where the virus, or the bacteria rather, makes its way into the nervous system, goes into the spinal cord, and now they develop neurological changes, i.e. behavioral changes, because it affects their brain, which is one of the causes of death that's been attributed to Sigmund Freud. He had tertiary or neurosyphilis. They also may develop what's called tabes dorsalis, where it affects the back or the posterior column of the spinal cord, and when they're walking, they walk like if they have flippers on their feet, and so they're slapping their feet on the ground. So because of the progression of this disease and the marked symptomatology that's evidenced with this disease, they opted to evaluate and monitor these individuals from the 30s on. Now, fast forward to the mid-40s, that's where they developed and discussed and discovered that penicillin was the conclusive and definitive treatment for syphilis. However, treatment continued to be withheld. Fast forward until the 70s, that's when they realized what they were doing to these men, that they were infected, they were all sick, and none of them had received any treatment. And it wasn't until the mid to late 90s that former President Bill Clinton decided to openly apologize for that situation. Now, as a result of that, that is very prevalent and predominant in the African American community. So, as a result of that, many African Americans are reluctant to receive any medical care, any medical attention, because of fear that they may be sick and will not receive the treatment or the care. Imagine that you're proposing investigating a medication that's geared specifically for an African American population. You're not going to be able to get any subjects because of the past history and lack of trust that exists in the research facilities, research studies, and the medical profession as a whole.
Okay. All right. So before I continue, I just want to let everyone know I am extremely nervous, and that is why my voice is shaking a little bit. Would you believe it? I'm an inspirational speaker, and would you believe speakers get nervous too? So I'm nervous, so bear with me. So I think there's a lack of trust with a lot of healthcare providers and with doctors specifically. I feel that a lot of folks don't feel that they can freely speak with their providers. I'm one such individual. When I was diagnosed with MS, I remember I would have conversations with my doctor about certain symptoms I was feeling, certain things that I was going through, but he did not listen to me, and so I did not feel that I could openly have a conversation with my doctor. And then so in my family, a lot of my family does not speak English, so my family comes from India, so a lot of my family does not speak English, and so I think because there's that language barrier, a lot of folks don't know. Number one, they don't know that there are clinical trials available, and number two, they don't know the questions to ask. And then once they do discover that there is a clinical trial, I think that they don't know, again, what does it mean? What does a clinical trial mean? I know, again, my family does not speak English, and so I think that there's that lack of understanding. And so I think that is one of the reasons. And again, also, guys, I apologize. I keep looking down on my phone, and I promise you, I'm not looking at Instagram. Okay, I have my notes on my phone because I want to make sure that I don't overlook something that I want to mention today. So,
kind of referring back to the topic before I dive into it, to give you a little bit of a background on what we do. As a respiratory therapist, can you guys hear me? Oh, that's a lot better. So as a respiratory therapist, graduating from our bachelor's degree and going into the field, no one really prepared us on how it is being a Black Muslim woman in the healthcare field. So we're just going in as newbies, trying to kind of like assimilate and not stand out, right? So going into our first OR surgery as a respiratory therapist, remember my preceptor being precepted going in, you have to go in having sterile gowns on. So I had my hijab on going in, and my preceptor said, oh, make sure you tuck your hijab in. And I never thought, like, oh, my hijab is going to be an issue going in, right? So I was like, oh, okay. And then I start tucking it in. He's like, oh, get the back. And I'm like, getting the back. And now I'm like extra nervous. I'm like, am I bringing infection into my patient's room? So as we go in, another nurse says, oh, make sure you tuck the back of your hijab in. And I'm like super nervous. You can't touch any of the sterile items around you. So I'm going in, and during the whole procedure, I'm hyper focused on my hijab, and I just have so much anxiety to the point where by the time I left the room, I had no idea what were the skill sets that I learned. And I just felt like a sense of relief, like, oh, I'm not impeding anyone's care in the room. So going back into the department and speaking to fellow Muslim women, and they had the same issues too. And I was like, oh, like, but you're not thinking as newbies, like, oh, let me create something in the system. So we're just going in and putting a temporary bandage, for say, on everything. And going into COVID later on is when we later discovered a lot of the issues that we're dealing with kind of brought to light, especially going into COVID patients' rooms, and now you have to fully gown in and gown out, and you're still wearing your hijab for 12 hours, and you're going from one room to another, and you're going to cancer patients' rooms, neonatals, so, and you're going home with the same hijab. And that's when we discovered, like, the word PPE was so prevalent, but we were kind of left out with our hijabs. And so that's when we later traveled and saw other hospitals and the type of care they provide. And soon enough, saw that they had, what was it called, a beard cover? And we're like, if they have beard covers, why isn't there hijab covers? We're like, okay, we're just kind of like researching to buy something. And that's when we saw that there was articles out there, but nothing to buy or in the system. So that's when we went on our journey, and Faroli can go a little bit into it, on our journey about how we developed our PPE hijabs.
Yeah, so definitely everything everybody's talking about is an issue that we all faced. You know, being women and especially minority, nobody caters to you is something that we discovered. And mainly it's because nobody talks about it, nobody say this is an issue. And we understand that, but now we're just like, okay, we are telling you guys this is what we're facing, right? Like Yasmin explained earlier, going from room to room, we're trying to put temporary bandage on, talking to the manager, how we can stay in one unit and not go all over the place. And it was just hard trying to survive the COVID period. On top of that, worrying about family and different patients, it's just like, okay, why didn't anybody, develop something for us? And it's not only like, making sure there is diversity and inclusion, but also at the same time is patient safety. Is we want to come up with this so we can prevent, spreading infection. That's really important to us. We're just like, we had family members that were going to different fields in healthcare, and we just don't want anybody else to face the same issue that we are. So once we saw that, we make sure we took, like, I think 6 months off from work, just focusing on research and how, PPEs are made. So looking for manufacturer that is in USA, and also, going through the FDA, since this is something that's gonna be in a hospital setting. It was definitely a process, but once we brought this issue to light, we had a lot of Muslim women that wear hijab, actually a different minority group reaching out to us and telling us how much, they needed this. Some of them had to leave the country where they're in medical school and trying to practice to a different country or state as well, to see who's gonna let them just practice with their regular hijabs. And some people do know this is an issue that is out there, but there is no solution. We are pretty new at this, but at the same time, having the community behind us and everybody support us, knowing that how this is important, something that gives us a push. And definitely, I agree what you were saying. It's kind of hard having that trust when you feel like you're not included. You don't feel like you're included, because it's like, okay, everybody was so, taking COVID very serious, and obviously everybody got used to the word PPE, but we were left out, and we didn't want anybody else to feel that way, so we focused on it, and we launched in November, and hopefully soon enough you guys can see it at other hospitals where you guys participate as well.
Amazing. Thank you so much. It was such various perspectives. So obviously, due to the fact that we're shorter on time, I want to make sure that we address how we can address the issue of including more diversity in clinical trials, making sure that the information is available to various demographics. I'll speak to a little bit from my own perspective. When I was conducting research for my dissertation, for my thesis, I ensured that when my IRB application was being processed, that some of those inclusion and exclusion criteria were coming from a very culturally informed perspective. So making sure specific wording was included and making sure when I created the flyer that it was being shared on various social media sites and community platforms, and making sure that when the IRB passed my dissertation to be approved, that all of those informed consent criteria were included on being, when they were participating in the research, they knew exactly what to expect. There were no hidden agendas. It was clearly identified what specific treatment and baseline conditions they were going to experience. So I think that's also really, really valid, is to make sure that you're being very transparent about what you're conducting research on and how is this going to benefit the society in general, that social significance aspect of it. So I want to pass that on to the rest of the panel, Dr. Rosado, Pramajit.
Yes. So are there any Spanish-speaking members in the audience? Anyone speak Spanish? One? Two? Okay, cool. So this story will sound really interesting. So there was a clinical trial that was being done in the Bronx, where I'm originally from, and it was a sleep study. And they asked the woman about how she was able to sleep, or was she able to sleep the night before, because they had started her on this medication. And it was being conducted in Spanish. And her response in Spanish was, no pude dormir porque había unos tigres haciendo una bulla. Translated, no, I could not sleep because some tigers were making noise downstairs. They transferred her to psych. Why? Because, she's hearing tigers. She's Dominican. In Dominican Republic, the phrase tiger or tigres is designated to individuals, young guys that are hanging out, just causing trouble. So she said, habían unos tigres haciendo ruido. There were some tigers making noise. She's got a psychiatric problem. She's hallucinating hearing tigers. In an emergency room in Arizona, an individual came into the emergency department with seeing orange and hallucinating and completely disoriented. And when they evaluated why he was experiencing these symptoms, he said, well, the only thing I've done is take this medication. This medication was started last week by my cardiologist. The medication is Digitalis. It's used for an irregular abnormal heart rate or heartbeat. On the prescription, on the label, it read in English, take once per day, ONCE. He did not know how to read English. He read once, ONCE, which in Spanish means what? 11. So instead of taking once per day, he took 11 pills and almost killed him. Okay, so these are challenges that exist not only in medicine, but also in clinical trials. And if you don't have an individual that can speak to your language, whether it's Indian, Spanish, whatever languages that you're addressing. And so as a result of that, the solution, because we don't want to be all about gloom and doom up here, there is a solution, and that is the Diverse Trial Act, DIVERSE, Diverse Trial Act. It is a bipartisan, believe it or not, a Republican from Indiana and a Democrat from California, and they are bolstering finances. I see someone nodding, so you are familiar with the trial, yes? And so the advantage of that is that it's going to bolster bringing in underrepresented populations into clinical trials, as well as providing the proper funding for these clinical trials.
Wonderful. So I'm going to touch a little bit on my personal story. I'm just going to touch on this. I'm going to share my full personal story later on. But so my story. So again, I mentioned to you all that I was diagnosed with multiple sclerosis in 2008. And when I was diagnosed, I was put on a medication called Rebif. And it is to suppress my immune system because, as many of us know, multiple sclerosis is an autoimmune disease. When I went on Rebif, I had a lot of side effects from the medication. And so after 2 years, I made the decision after speaking with my doctor that I would no longer be on Rebif. And so we switched me to something called Copaxone. Once I got a Copaxone, tried Copaxone for a year, and Copaxone was not working. My MS was still progressing. And so my doctor and I, again, went back to the drawing board to see what else is an option. What he did not tell me is, at the time, so let me backtrack. So at the time, he recommended to me that I should be on something called Tisabri. And so Tisabri is an infusion. It's a once a month infusion. With Tisabri, it carries a risk of PML. And PML, I'm not going to give you the medical term because I'm going to jumble it. PML is a brain infection. Now, one of two things happens if a patient gets PML. Either that patient essentially becomes a vegetable, or that patient dies. And so clearly, I did not want to go to Tisabri. If you test positive for the JC virus, how many of you have heard of the JC virus? Okay, so over 80% of Americans actually test positive for the JC virus. If you test positive for the JC virus, you are more at risk of getting PML. I tested positive for the JC virus. Still, my neurologist wanted me to go on Tisabri. And anyone who knows me knows I'm an anomaly. So if something is going to happen, it will probably happen to me. And so clearly, I did not want to take the risk of going on Tisabri. So at the time, I said to my doctor, let's explore other options. What he did not tell me at that time was there was a clinical trial for something called HSCT. And I'm not going to, again, I don't want to jumble the words, so I'm not, basically is a chemotherapy-based stem cell transplant. And the thought is that this stem cell transplant can stop the progression of MS, and it's over 85% effective in stopping the progression of MS. At the time, there was a clinical trial taking place at Northwestern University Hospital in Chicago, but I was not made aware of this. So, and I'll touch on, again, on my story a little bit later on how I found out about this clinical trial. So I'm mentioning this to say, providers need, in my humble opinion, I think that communication is going to be important. I think it's important for providers to communicate with their patients which clinical trials are coming up, possibly run a query on which patients they have with certain conditions and which clinical trials are coming up. Run a query on what is the exclusion and inclusion criteria. Run a query on which patients, because we need to factor in patient consent, which patients consent to their information being shared and being contacted about these clinical trials. And so I think communication really is the root of it. I think it's important for providers to communicate this and then also take into account that not all of their patients are probably English speaking, like folks in my family who speak Hindi or speak Punjabi, or you have other folks who maybe speak Spanish or another language. Take that into account and then communicate the clinical trials and what that means. What does that mean to the patient? And then explain it in a way a patient can understand, in simple terminology.
Thank you. So that, unfortunately, that's all the time we have. We do want to make sure if there's any questions, you please come and find us during the lunchtime. Unfortunately, that is all the time we have. And I'll hand the mic back.
Okay, thank you. Thank you today, everyone. My heartfelt thanks to each leader who took the stage today to bestow upon us their valuable insights in the field of medicine. Thank you guys so much. There's so much to digest still. But now it's time for our day's showstopper session on 497 page 1 rankings in 7 weeks, How Pillar-Based Marketing is Changing SEO by Ryan Brock, Chief Solution Officer of Demand Jump. This session is going to be in the Internet 2.0 ballroom in 316 to 319 Alliance. That's going to be out the door to the right, all the way down the hall at the end. we will see you over there for the showstopper session today. And when we're done, we will be returning to this room for our awards ceremony. Thank you, and we will see you soon. good, man. All good. We're not starting yet. I got a little quiet. Everyone's looking at me. Our ceremony will be starting in 60 seconds. All right, we're going to go ahead and get started. Welcome back, everyone, from the Showstopper session. I hope you had an amazing time. The forward march of global healthcare has been driven by the relentless efforts of visionary leaders, meticulously working to install a significant change in the world. Let's take a moment to acknowledge these extraordinary personalities who have bravely pioneered the revolution in healthcare. But first, we'd like to thank our sponsors, Trigent, for associating with the Health 2.0 conference, and on behalf of the organization, we invite Mr. Nagendra Rao, President Sales, to come up to the stage. A global leader in software solutions, Trigent Software's mission is to enable customers to overcome limits of competitiveness, productivity, technology, complexity, time, and budget constraints through offshore software development and outsourced product engineering. Known for being innovative, the company has developed over 400 products, most of which are deployed in record time in both small and large companies. Thank you so much. Now, please, I'd like to invite to the stage our honorary award presenter today. It's going to be Pauline Barrister from the Cameroon Union of Young Lawyers. Please welcome Pauline to the stage. I would like to take a moment for some housekeeping. I want to remind everyone, please use the stairs at the left and right of the stage. It is a safety hazard. We're looking at you. When you come on stage, we'll be taking a photo with our photographer, and you'll be invited to speak for about a minute. All right, please keep it to a minute. I know we all love to give. I know we've all prepared several hours of Oscar speeches. Today we're just accepting our awards. All right, without further ado, our first awardee of the afternoon is the CEO and founder of Cerna Solutions. With a background in counseling and psychology, they are dedicated to promoting mental health and addressing racial justice in the health sector. Please welcome to the stage, Brian Cerna.
Testing. Hi everybody, my name is Brian Cerna from New Mexico, and I'm very honored to accept this award. My work in behavioral health over the years, for 20 some odd years now, has been to adapt evidence-based practices for ethnic minorities, specifically for Spanish-speaking communities and indigenous communities. And I'm just honored to accept the award, and I'm very thankful for my team back in New Mexico and for all the mentors that have helped me along the way, especially there's a gentleman named Dr. Robert Myers who developed a program to help families who have a loved one with an addiction. It is the opposite of an intervention and is non-confrontational, positive, and relationship-based. And that's been something that I've taken with me wherever I go. Helped people in all sorts of communities adapt and help their loved ones get you so much. And
That's beautiful. Thank you. Our next awardee is the owner and licensed professional counselor at Beacon of Hope Counseling Services, LLC. She founded Beacon of Hope Counseling Services in 2020 with the aim of bridging the gap between healthcare and mental health care. Please welcome to the stage, Christine M. Colburn.
Well, hello, everybody. I'm not Christine Colburn. My name is Hunter Colburn. I'm actually her son. On behalf of Christine and myself, I would like to thank Health 2.0 for this incredible award. I was very young when my mother started this journey of hers to help. It's been a pleasure to see her grow from the ground up to rubbing elbows with some of the greatest in their field. It's been a pleasure and an honor to be here at the conference. We wish everybody well for the remainder of the conference and thereafter. Thank you.
Thank you. Our next recipient is the CEO of Encode Health, a company focused on the application of AI in neurosurgery. He is a medical doctor specializing in neurosurgery and conducts research on the subject at the University of Buckingham. Please welcome to the stage, Kostas Fantis.
I've lost my notes. One moment. Nope, I've lost them.
If you can't find it, you can always speak from the heart.
I've got many people to thank, so here we go. There it is. Right. Apologies for that brief moment. Right. It is with utmost gratitude that I accept this prestigious award from Health 2.0. This is a momentous recognition and is a testament to the collective effort and unwavering commitment of our incredible team. I would like to express my heartfelt appreciation to the organizers of Health 2.0 for providing this platform that celebrates innovation and excellence in healthcare. This event brings together brilliant minds from all around the world, inspiring collaboration and propelling industry forward. I would also like to extend my sincerest thanks to our partners, clients, and stakeholders who have believed in our vision from the very beginning. It is through your trust and support we have been able to push the boundaries of what is possible in the field of AI-driven healthcare. None of this would be possible without the dedicated and passionate individuals who make up the Encode Health team. Each member has contributed their unique skills and expertise, working tirelessly to revolutionize supply chain management, surgical scheduling, and beyond. This recognition belongs to all of you. At Encode Health, our mission has always been to match clinical demand with medical supply. We strive to create a future where AI seamlessly integrates with healthcare, improving patient outcomes and streamlining processes. These awards serve as a resounding affirmation that we are on the right path and that they fuel our determination to continue pushing boundaries and driving meaningful change. Together, we will continue to harness the power of AI, transforming the landscape of healthcare for the betterment of humanity. Thank you from the bottom of my heart.
Thank you, Doctor. Our next recipient is a renowned naturopathic doctor, author, and researcher. She is a trailblazer in the field of naturopathic medicine, blending traditional medicine with natural remedies to enhance holistic healing. Welcome to the stage, Dr. Julie Tran-Olive, ND, LAC.
Actually warms my heart that all of my colleagues here from all across all different industries are talking about holistic health, wellness, and prevention. Thank you from the bottom of my heart. A big thank you to my husband, Doug. Because of your obsession, I have clean clothes all the time. And because you have a steady paycheck, I get to do all the fun stuff I want to do as a self-employed doctor. Thank you.
Beautiful. Our next recipient is the CEO of Care Counseling Center, a renowned mental health professional dedicated to promoting well-being and preserving family unity. Welcome to the stage, Dr. Maria Rodriguez. Maria Rodriguez, are you here? We will be accepting this award on your behalf. Thank you. Our next recipient is the Chief Medical Officer at Anyplace MD, a renowned expert in anatomic and clinical pathology with 32 years of experience. Please welcome to the stage, Dr. Randy Eckert.
I'll be brief. I don't have anything on my phone to share with you, but I do want to say to the people who organized the Health 2.0 conference, everything cost us that. So thank you for putting the conference together. Secondly, no one gets to where I have gotten in my life without the help of many, many others. And so this award is as much for them as it is for me. In my current position as CMO of Anyplace MD, I would like to thank our CEO, Shane Stevens. And then finally, I would like to thank, for her being here, my partner, Becky. Thank you very much.
Thank you, Doctor. Our next recipient is the founder of Renewing Minds Therapy, a Christian psychotherapist, registered social worker, and self-published author. Please welcome to the stage, Faith Sundaralingam.
Good morning, everyone. Thank you for this opportunity. Firstly, I want to thank Lord. Thank you, God, for His grace, for getting me through. I wouldn't be the woman that I am or be where I am today if it wasn't for Him guiding me and leading me. Thank you to my community of support that have loved on me, prayed me through, supported me, walked alongside me in this journey. Thank you to all the organizers at Health 2.0 for this recognition and this honor. Creating spaces for these types of conversations are so necessary, and to see this platform be available to us on a global setting is extraordinary. Renewing Minds Therapy was created as a passion and a mission for me to always be engaging in mental health conversations because we need it. My hope and my drive is to be able to allow and encourage folks to understand that their experiences, whatever they've been through, whatever they've gone through, do not have to define them, but instead shape them to be the very persons that they are today and the way that God has fashioned them to be. So thank you finally to all the clients that have given me the permission and the access to walk alongside them, to learn from them, and journey with them on their path to healing. Thank you, and God bless.
Thank you. Our next recipient is the founder and CEO of Jayu, a public safety-focused medical essentials brand. She is an interdisciplinary designer and business strategist dedicated to continuous process, service, and design improvement in rapidly changing markets. Please welcome to the stage, Fulya Turkmenoglu.
So happy to be here and meeting with amazing people, exchanging ideas. It's been inspirational 3 days. It still continues though. So I would like to thank each and everyone who supported us since the beginning in a very traditional medical market and for supporting our human-centric design approach. We'll continue working towards to see more people happy and healthy. Thank you.
Thank you. Our next recipient is the co-founder and owner of Biofield Medical Inc. and Geraldine Energy Healing. She is an award-winning energy healer, medical intuitive, spiritual counselor, and mother. Please welcome to the stage, Geraldine Lowe Monaco.
Everyone, thank you. Thank you for having me here today. It's such an honor to be here. I want to thank you, the Health 2.0 conference, for opening up the opportunity for an alternative medicine practitioner in the holistic wellness to be awarded. So thank you for this. In my practice, I work with doctors, traditional doctors, naturopathic doctors, and integrative medicine practitioners to help clients, patients, to have an holistic approach to their health. So we're helping them in their physical issues, emotional issues, mental issues, and spiritual issue. Because everyone deserves to be healthy, happy, and especially joyful. Thank you.
Excellent, thank you. I couldn't agree more. Our next recipient is the founder and CEO of JL Therapeutics Massage and Bodywork. She has created a haven for massage therapists and customers alike. Welcome to the stage, Jennifer Matten.
Hello, everyone. Thank you so much. This has been such a journey from day one, starting as a massage therapist and now growing into providing and understanding what bodywork is to the practitioner and what bodywork is to the client and the places that we can assist them to go emotionally and physically. We are bringing in a side of massage therapy that has only barely been touched on with our pediatrics and our youth teen programs. It has been so eye-opening to see what people really want and what they crave and the touch that they need, like not want, they need it, and they become so powerful and connected to their own bodies, and the facilitation that we give them is so powerful for us. And to create a center with these brilliant therapists and to protect them from burnout and long hours and low pay and all the things that we experience in the nursing and other healthcare fields, it is so important, and it is my mission to continually bring therapeutic touch to everyone, young and old, but also to protect everyone in the field so that we can keep it growing and bodywork doesn't die because the burnout's so early. We need to make sure these individuals continue down the path because they are our healers, and you can't recreate that. And that's my mission, and I'm so excited to be recognized. Thank you, guys.
Thank you. Our next recipient is the founder and CEO of Mindful Living Group, where she promotes the practice of self-care and living in the present moment. Welcome to the stage, Jessica Brazil.
Thank you. It's such an honor to be recognized with so many incredibly talented peers across the nation. And I have to say that this has been a huge self-care inspiration, a recharge just being together and seeing and experiencing all of your knowledge and expertise. So thank you for reigniting the fire to continue doing the work that we do. Sometimes it feels like we're fish swimming upstream in this system, that we are playing in this casino where everything is stacked up to be in favor of the house. So being together feels like we're really able to continue to make a difference in the quality of care that we're offering clients and patients in our work. I want to thank my husband for his tireless support in the days that I'm exhausted and wondering if I can keep going. And we're only as strong as the team and the support system that surrounds us. So this award is dedicated to my team at Mindful Living Group, as well as all the clients and those along the way whose lives I've been able to touch directly and indirectly. So thank you all so much.
Thank you. Our next recipient is a psychotherapist, consultant, speaker at Christina Debris, LMFT, a licensed marriage and family therapist in Los Angeles, California. Please welcome to the stage, Christina Debris. Is Miss Debris in the building? Miss Debris has left the building. All right, thank you. We will accept this award on your behalf. Our next recipient is the VP of Lab Operations at Quick Med Diagnostic, a tech entrepreneur with expertise in engineering, logistics, and healthcare operations. Welcome to the stage, Michael George Savides.
And I think, first of all, I want to obviously thank the conference for hosting us all. And obviously, being on stage with other peers is obviously incredibly humbling. But the first thing I think I need to obviously admit is that this award would not be possible without the people that I've worked with and my colleagues, as well as my team members. And Quick Med Diagnostics, we were a company that was born out of the pandemic and naturally pivoted into high complexity testing, where we had 3 laboratories across the country. And we moved from virology to serology, hematology, microchemistry, and so on. But the thing is, I had very limited experience in healthcare before I got into this role. So I obviously need to thank the leadership team for believing in me. But the one thing is, and I'm sure a lot of you would agree when you're in a startup or any form of a new position, is that you find yourself doubting your abilities and building the plane whilst flying. So something that I always had to remind myself of to keep myself going was a quote by the great Alan Turing, a mathematician and computer scientist, and the quote goes like this: "It's often the people that no one imagines anything of who go on to do the things that no one can imagine." So thank you very much. I appreciate this, and I'm incredibly humbled for this award.
Thank you. Our next recipient is the CEO and founder of SOAR Career Coaching for Professional Women. She brings over 30 years of experience in progressive hospital, nursing leadership roles, including serving as a chief nursing officer. Please welcome to the stage, Michelle DeStefano.
Good afternoon. I want to thank Health 2.0 for this prestigious award.
So grateful for being here amongst all these experts in the healthcare industry. It's been a real privilege being here. I had a vision for creating SOAR career coaching for healthcare executives after I had my own setbacks and challenges in my own career, where I was actually a chief nursing officer, and they wanted to go in a different direction when the new CEO came into town. And with that experience and that setback and what I had to go through to continue my journey for safe patient care and for continuing my leadership skills and my knowledge, I created SOAR methodology so that I could ensure that my clients had the perseverance, had the skill set mastery to continue in their executive leadership roles for career advancements, and if they so desired, career pivots. And so as I tell everyone that works with me, I will be there to watch you soar.
Thank you. Our next recipient is the founder and executive director of Cologne Family Services, LLC, an acclaimed expert in family support and education. Please welcome to the stage, Vanessa Cologne.
So I want to be honest, when I got here, I started a school, and I was like, why am I in healthcare, not education? And I started a school for children with neurodiverse issues, behavioral learning issues. 7.5 years ago, after 3 kids that I knew, my clients got kicked out for behavioral issues. Before that, I developed a yoga program, so I have done a lot of work around autism and yoga and how to work with the body. And I have to tell you that I'm really honored that my work is seen, not the education piece of starting a school, but the actual work that I'm doing with the children. So thank you. And I actually want to dedicate this to all my kids in my school that are always challenging me and teaching me things are always not what they seem sometimes, and you have to be flexible. And the way that I work with families is really bringing the family and child together to connect through yoga, mindfulness, and in my school you'll see movement desks. It's about social skills and teaching empathy. So I'm in San Francisco. I also have a book, How to Do Parenting with Confidence, and if you follow me on IG, you can download that for free, because I'm sure everyone here knows somebody who is struggling with their child. So thank you so much.
Thank you. Our next recipient is the Chief Nurse Executive at Humboldt County Memorial Hospital and has been with the organization since 2014. Please welcome to the stage, Victor Bycroft.
It's really hard to follow up some of the folks that have been up here already. This is such a tremendous group, and I've been asking myself ever since I learned about this award, why me? What am I doing here? It's been fantastic to be here, to learn from all of you folks, to get to see the advancements that are going on, and I'm just really proud to be here representing small and rural hospitals as a whole, and just want to thank my wife especially, but my team back in Humboldt for giving me this opportunity and helping me to be who I am today. Thank you.
Thank you. Our next award is going to Expion Health, which is leading the way in transforming healthcare cost management through the power of technology. Drawing on over 30 years of experience, Expion Health tackles the high complexity factors that drive healthcare costs for payers, self-insured employer groups, TPAs, and PBMs. Karen Humphrey is going to receive this organization award. Please welcome to the stage, Karen Humphrey. Is Karen in the building? Will accept this award on their behalf. Thank you, Karen, and Expion Health. Our next recipient is the founder and president of the Afro-European Medical and Research Network, which is accredited by the UN ECO SOC. He's an associate professor and medical doctor specializing in dermatology with an MSc in dermatology from the UK Okay, please welcome to the stage Dr. Charles Senesi.
Thank you very much, the organizers of this event, the Health 2.0. And I want to extend my thanks and appreciation to everyone. And indeed, I heard the stories of one of my colleagues who was pushed into action by a private incident in the family, loss of a loved one. And I shared the same story, that most of my work was pushed into action by somebody we lost. And I dedicate this award to her and everybody who's lost loved ones that have pushed them into action. My appreciation also to people who may have mentored me along my professional life, especially my colleagues in my home country, Sierra Leone, in my resident country, Switzerland, and I can remember my mentor, Dr. Victor Willoughby, of late, Dr. Andrew Kosia. And to my family and friends, I thank you for your support along my professional life, especially my brother, Mr. Joseph Bokari in Baltimore, who should be here with me. To my entire executive of the Afro-European Medical and Research Network, who believe in my leadership around the entire world, in Africa, in Europe, in the United States, and everywhere around the world, I thank you for the trust and confidence you have in me. And to the international community, especially the WHO, Dr. Tedros, the Director General, I thank you for the support you afford me each time I reach out to you, and to the entire United Nations, and to all those people we have touched, whose life we touch with our mobile clinics in very hard-to-reach communities in low and middle-income countries. I thank you, and we hope to continue our service to you. Indeed, together we can make it happen. I thank you.
Thank you. Our next recipient is a board-certified clinical psychologist and founder of Concierge Psychology, a luxury mental health practice specializing in assisting high-achieving individuals to thrive in all aspects of their lives. Please welcome to the stage Rebecca Johnson Osai.
Osei, like Osei can be
Osei. Rebecca Johnson Osei.
Beautiful.
Everyone.
Thank you so much. It is an honor to be here again. When I came up with the idea to essentially piggyback on the concierge medical model in mental health about 10 years ago, there was actually a fair amount of pushback and people feeling like, will people be interested in this? And I think as we've seen this week, people absolutely are interested, and I've been really excited to see the model expanding and a lot of people having interest to bring into their own practice. And it's just such an honor to be here to share with everybody and learn from everybody, and I thank you so much for having me.
Thank you. Our next recipient is the founder and CEO of Lincoln Innovation, Inc. He is a social entrepreneur, investor, and mentor, actively managing technology and innovation for global digital health startups. Please welcome to the stage, Shinya Yamamoto.
So thank you very much for such a, the honor, the award here. I'm so much honored to be here as an awardee of a Visionary Award here. So I have been contributing to the healthcare industry in Japan more than 20 years. Then I am currently challenging digital transformation of a hospital for the patient centricity and real-world evidence, decentralized clinical trial, etc., by using a technology. So thank you so much for your kind invitation, and I'm really looking forward to working with you closely in the future. Thank you.
Thank you. Our next award is going to Wound Masters. which was founded at the end of 2012 and designed to provide hospital services to homebound patients. The practice has patients all over Southern California and Arizona. The president and CEO of this organization, Wills Nguyen Gamphon, is going to receive this award. Please welcome to the stage, Mr. Gamphon.
All right, I want to thank Health 2.0 for doing this again. This is the second award we're getting for Wound Masters. This time it's for Wound Master itself. So I will thank Health 2.0 and I'm thanking my team, my crew. I'm just the leader, but I have a technical crew that really supports me, the management, especially Kimberly, Tagayuna, Mark Gubert, the marketing team, Iman is here, and all those who followed me, Rennie, and every other body in, at the company. Please, this award is for our services, for the good job we've been doing. I thank you so much. Thank you.
Thank you. Our next recipient is the owner and psychedelic-assisted therapist at Laura Evans Counseling, PLCC, and is a leading figure in the field of psychedelic therapy. Welcome to the stage, Laura J. Evans. Is Laura in the building? We will accept this award on her behalf. Next, our next recipient is the president and founder of Blakebrook Ventures LLC and is a seasoned professional in the medical device industry with over 20 years of experience. She serves on the advisory board of Alta Science and holds key positions with the Watershed Fund and Vastrum USA Inc. Please welcome to the stage Angela Dotson. Is Angela in the building? All right. That concludes today's awards ceremony. Let's give another round of applause to all the recipients today. What an incredible honor. We're so happy to have you here today with us. Now we are going to dismiss for lunch. Have a great meal. We'll see you after the meal. Of course, thank you.
I went and seen. I think they're check 1 2. Hey hey. Hey hey. Yep yep. All right. Check 1 2. Hey hey. Yeah. Check check. Hey hey. Check check. Hey hey. Yep. Uh-huh. Hey hey. Yep yep. Hey, check. Check, check. Hey, hey, yep, yep. Hey, hey, 1 2. Check, check. That ain't it. Check, check. Hey, hey. 1 2. Yep, yep. Hey, hey, yeah. Check 1 2. Hey, hey. 1 2. Yep, 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 yep. Hey, hey. Check, check. Hey, hey. Yeah, 1 2. Check, check. Hey, hey. Yeah. All right. Check, check. Hey, hey. Hey, hey, hey. Hey, hey. Check 1 2. Hey, hey. Chick, chick. If it feels like it. Just don't panic. Hey, is it working or is it working? Just like, no. What do you need? Hey, the award session is scheduled in a few minutes. Oh, that thing's over, yo. You must get by.
Okay, welcome back everyone from lunch. I hope everyone enjoyed their lunch. It was delicious. Yes? Maybe? I had a great time. It was delicious. The marsala, on point. Okay, so before we kickstart off the afternoon session, a heartfelt token of appreciation is due to our gold sponsor, Nemours Children's Health and silver sponsor, BrainTap Inc. Your unwavering support is truly invaluable. Thank you. Now it's time for a panel discussion on whole body, whole mind, the power of holistic wellness. In this session, our experts will delve into the interplay of physical and mental health, shedding light on the transformative impact of integrated wellness. Let's unpack this essential subject together. Please put your hands together for our moderator, Taylor Hooker, Health Systems Specialist at Veterans Health Administration, and our panelists, Elizabeth Connolly, Founder and President of Thin Line Peer Support Team, Inc., Matt Edwards, Founder and CEO of the Me Method, Brian Cerna, LPCC, LADAC, Founder and CEO of Cerna Solutions, and last but not least, Natalie Jordy, Founder and CEO of the True Alignment Academy. The stage is yours.
Awesome. Can everybody hear me okay? Fantastic. We started right on time, so thanks for our amazing host in his rockin' pink jacket. I was complimenting him just earlier on his impeccable fashion taste, so let's give it up for all of our conference organizers. Thank you, everybody. Over the next 50 minutes, we're going to spend some time together with our esteemed panelists, just talking about holistic health, whole health, these buzzwords that you've likely heard across the healthcare sector. And I'm going to share some of my perspective from my background, but I'm going to hope to corral some of these amazing folks. We've got a lot of wisdom. We could probably spend hours here together, but we're going to try to condense this down into 50 minutes. So in order to get started with this panelist, we're going to form this a little bit more of a discussion. And so I encourage folks, as you have questions, we're going to carve off the last 15 minutes of our time together for our audience questions. But please, if you've got something that's itching, feel free to raise your hands and we can get started. We're going to do a little bit of a round robin style, and I've encouraged my panelists in some of our breakout rooms to just kind of speak from the heart, speak from their experience, and chime in as they feel ready. To get us started and to kind of warm up the vocal cords a little bit, I'm going to adjust my mic here. If I could have everyone just start off, we'll go down the row and end with me. If you could tell me your name, your current position, the company that you work for, and your interest in this topic. So if anyone would like to go first, we've got lots of hot mics on our panel. Your name, the company you work for, your current position, and what led you here to talk about this today.
Okay, I'll jump in there. Just making sure that this is on. So my name is Brian Cerna. I'm with Cerna Solutions, based out of New Mexico. My position is I am the CEO, owner, founder of Cerna Solutions. We are a behavioral health company that does telehealth, in-person health, and my interest in the topic is that mental health and issues around addiction are they're always put off to the side when we're thinking about holistic health, especially just in the medical community in general. And my interest is to break down the over-specialization of some of the things that I see, and that we should be able to be more integrated as we respond to people in a holistic way.
Thanks, Brian.
Hi, my name is Natalie Jordy, and I'm the founder and CEO of True Alignment Academy, where we help nurses, first responders, and healthcare workers heal from trauma. We have a cutting-edge technology that uses a subconscious approach that gets to the root. It's a permanent solution, and then we teach them how the brain works, how to process their emotions, regulate their nervous system so that they can take control over their own mental health. So my interest in the topic is that's exactly what we do. It's all about the mind, body, and soul, and then giving our clients the tools so that they can take control over their mental health and their body and drive them to a place where they actually want to take care of themselves and start changing the behavioral patterns behind that.
Thank you, Natalie.
My name is Liz Connolly. I am the founder and president of the Thin Line Peer Support Team Incorporated, based out of Connecticut. I am a paramedic and firefighter by trade, and my interest in mental health is that firefighters, police officers, corrections, tow truck drivers, ER nurses and doctors, military, veterans and active service personnel, and obviously closest to my heart, EMTs and paramedics, are faced with trauma every single day, and we do not get the mental health support that we so desperately need. First Help, which is a nationwide organization that tracks the suicide rates of first responders across the country, estimated that the normal adult sees 2 truly traumatic events in their adult life, whereas a first responder will see 183 truly traumatic events in their adult life. That's a difference of 181 truly traumatic events. And the suicide rates for first responders are astronomical. Everybody's heard of the VA campaign for veterans, that 22 veterans commit suicide a day. The rates for first responders exceed that. And nobody's talking about it. So the Thin Line Peer Support Team, our mission is to provide peer-to-peer support so that no first responder, no veteran, no active service personnel ever feels that they are alone, that they are fighting this battle by themselves, And if we cannot reach somebody with just peer-to-peer support, we act as resource brokers, and we are able to put them in contact with either mental health support with an LCSW or a clinician, or we are able to get them into contact with drug and alcohol resources or whatever other resources they need to continue their mental health battle.
Thank you, Liz.
Hi, my name is Matthew Edwards, and I'm the CEO and founder of the Me Method app, as well as memethod.com. It is a preventative care approach to mind-body health. And I believe having good mental health is a series of different daily tiny habits that can be incorporated into a lifestyle, and it doesn't have to be complicated. So there's a quote earlier that was spoken about, Einstein's quote about simplicity, and it was something in the nature of make it simple, but not simpler than it has to be. And so my goal is to simplify your health. And in order to do that, I think it takes coming up with some routine consulting strategies based on your personalized, individualized situation. And so what I'm doing is I'm building an app from the ground up on the front and back end to create a system that I'm calling the method. And Me Method because me is you. And it's really about you taking control over your own personal health in terms of, you know, mind and body. And really, that approach for having an optimal, you know, mental health, which is a series of different things. One, it's movement. So this can be as simple as walking or doing some chores around the house. You know, two is you can call that fitness if you're really into it. I personally have created a program that is focused more on improving your posture and alignment, because when you have good posture, you actually have better confidence. You're able to sit in your chair longer at your desk. So it's a much more functional approach to movement and fitness, and it doesn't actually have to take a long time. So there's a series of functional movements that I put together, and a way where you can actually recover from those and do it for the rest of your life. So you could be, you know, 15 years old and just getting into this, or you could be retired, and the method would work for you. It's just a matter of putting variations on those movements. So I say 3 hard, 3 soft, 1 off. So 3 days, putting some form of resistance on your body. This could be through body weight. It could be through, you know, Pilates. It could be through walking, literally. And 3 days soft, which would be more of an active day. You could focus on your productivity, your work, you know, family, all your obligations. And then 1 day just completely off. And on that off day, I think it's really important to focus on the second thing, which is mindfulness. And, you know, it's a word that's thrown around a lot. I think it encompasses a lot of different things. So there's a lot of studies, scientific studies on human trials that have come out recently, the National Institute of Health, as well as other publications, which is what I usually incorporate into my strategies, stuff that works for humans, is, you know, the power of prayer and meditation. And it's actually shown to decrease stress, improved heart health results, able to make you actually smarter by clearing out your mind and just sort of like noise that exists within the mind, because we're all being hit by different stimuluses that stimulate the brain synapses, and opening up the frontal cerebral cortex is actually very important. And so in my program, I've basically put together a 7-minute prayer meditation that you can do as your quiet time or as your moment of silence, because all the answers are usually found in silence. It's kind of the opposite of what you would think. The whole thing is actually the opposite of what you think, because less is more, and it's really about quality over quantity. So the next approach to having good mental health is nutrition. And I've basically created a home cookbook as well as an eating out guide for restaurant recommendations and easy, simple orders, scalable meals you can make for your whole family, even travel guides of like what to eat when you're traveling, such as this conference, etc.
So,
And
Matt, we're actually going to get into some more tips here, and I'm loving where
all
we're
right.
going because I'm going to have you
Sorry, I'm
circle
really
back. No, this
passionate
is
about
great.
this, guys.
This is fantastic.
But I'll cut it short by saying I wasn't able to find a solution anywhere in the world for something where you could get all this information in one place. There's all these people that are really focused on this, all these people that are really focused on this. So after the global health pandemic, I felt like I wanted to educate myself I have a background in entertainment, a lot of on-camera movement type of stuff for modeling and national commercials and stuff. And so for me, it was about, all right, how do you simplify this and make this information available for the general public, for corporate wellness, for day-to-day strategies. So
It sounds like a really holistic approach to
hopefully we can go
bring
into
it all
more
together.
and
Absolutely.
I can finish up because really I think when people know the right information, you can actually simplify your whole life. And I think that's the goal, and that's how you can make the best impact on whatever you're doing business-wise.
It seems like the most holistic approach. Many of our panelists so far have mentioned this aspect of needing to simplify your life, take things in an integrated approach. So as we wrap with our introductions, we'll pass it over to Marcel and wrap with myself, and we'll dive into some more questions together. But for my audience, as you're listening in, as you're starting to think about some of these concepts, I encourage you to think about this from a personal perspective and also from your own healthcare systems and how you start to integrate holistic and whole health into your systems as well. But Marcel, take it away.
Thanks. Yeah. My name is Marcel. I am the Chief Financial Officer of MedAccess Pharmaceuticals. We are a specialty rare disease company, stem cell transplant, certain orphan diseases. So we sell drugs for just a very small part of the population who have that disease. But I've been in healthcare for 20 years. Grew up in Novartis, and the topic is very interesting to me, just as an overall concept. Yeah. And I'm looking at it as the body, the mind, and the soul all together, because all those three pieces have to go together, ultimately, way of looking at life. So a very interesting topic, and I'm looking forward to my colleagues' comments.
Thank you. And last but certainly not least, I'll go ahead and introduce myself. My name is Taylor Hooker. I'm currently a health systems specialist with the Department of Veterans Affairs and the Office of Health Equity. And starting Monday, we'll be taking a new position as the Chief of Learning Engineering for the San Francisco VA. As a clinician, prior to working in healthcare administration, I got my start as a recreational therapist and a whole health coach. And so my primary focus is helping veterans, but really veterans are representative of our entire American populace, find holistic approaches to take power, like many of my colleagues have been mentioning here, taking charge of your own life, simplifying what matters to you, and really taking charge of your own health and life and not allowing that to just kind of take charge of you. And I think these are themes that we've heard all throughout the conference this past couple of days. And so my encouragement as we are talking about some of these questions, if you have your notepads nearby, you're going to hear some kind of thought questions that I encourage you to really marinate on yourself as you think about your own health journeys and see how this applies to you personally. So thank you all for those lovely introductions and for giving us a little bit of background. We have a wide gamut of folks on this panel with a plethora of different experiences. But holistic health, holism, whole health really touches all of these different areas. So my question to each of my esteemed panelists, and we'll try to keep these responses between 1 to 2 minutes, is what does holistic or whole health mean to you? If you could define that.
All right, I'll keep it short. Minutes. Holistic really is all about the when I look at it from the physical, the body, the mind, intellectual side of the house, and then I added the soul part to it, so the whole belief system, and each of them have to be in balance. And if you look at the body, mind, and soul, it's sort of how all these actually impact our physics. So that's interesting how a thought can biology. All of the.
You might have to share a mic.
Is this? Yeah, this is better. Yeah.
Better.
So really, the three of them have to interact interdependently, and how they all come together at the end of the day. And if one of them is out of order, then this is when people get sick. And one of a powerful statement I heard from one of the panelists earlier was like, healthy people recover faster. And to me, that was sort of a powerful statement to say, this is not just to be healthy, but if everybody gets sick at some point, and you know, stress causes you to get sick, but then you have to recover. And if you do that, if those three things are sort of in balance, then I think we have a better chance to recover.
Other folks.
So what does holistic mean to me? So ultimately, it's the approach of looking at someone as a whole person. It's the mind, it's the body, it's the soul. And I think holistic, as we look at this topic, whenever the majority of people solely focus, and this is just the way the brain works, on themselves. And they don't have room to hold space for anybody else. So when you look at a holistic approach, what you want to make sure that you do is you have the space to hold for the whole person, that you have the space to hold so that they can feel seen, heard, known, and understood, and you can identify exactly what they need, because each person's needs are different. Plus, the mind and the heart, it directs the body, right? So when you look at the holistic, you can't do a lot with the body if you have a block in the mind. Because if someone has a limiting belief, I deserve to be punished, I'm not good enough to have X, Y, Z, since 96% of everything that we do comes from the subconscious mind, if that is the correct statement according to the subconscious mind, no matter what you implement in that person's life, they're not going to do the self-care or the things on the other side of that limiting belief. So I think there's an order to it also as you look to this holistic approach, so that to ensure that the continuity of that, you have to address certain things in a certain order.
So from my perspective, you know, in preparing for this panel, I was trying to think, well, what do I have to offer that might be unique? And that, you know, I agree with all my colleagues here. But one thing that I have that might be unique is I have an extensive background working with tribal communities in health and wellness. You know, for a lot of years, that was my title, actually, the Health and Wellness Director for a Native American tribe. And one of the things that I've learned in that experience is it's not just what you eat, it's not just how you move your body, it's not just how many prayers you say or meditations you do. It's also your relationships. And so I think that when we think about health and wellness, especially in the context that I'm thinking about it is, it's multi-generational connections, or connections to your community. You feel connected to other people. And I feel like sometimes especially with those who are contemplating suicide, for example, a lot of them feel so isolated. Even though, like in their profession, everybody's going through it, but they still feel isolated, and that I can't handle this, I am weak, and it's just so much focus on just, you know, them in isolation. And I feel like, you know, whether it's health and wellness or even recovery, like from addiction or a mental health challenge, it's your connections that not only help you with recovery, but they also provide a really important layer of resilience. You're not supposed to do everything on your own. And I feel like in America, we really hold up this idea of the rugged individual that can withstand anything. And we're not supposed to be like that. That's unnatural and it's unrealistic. And then, you know, and so we do need to cultivate those connections to other people as it relates to wellness.
I think what holistic wellness means is, you know, how everyone touched upon, but interconnecting, you know, mind, body, spirit, but also to relationships, to business, and that, you know, going back to the relationship thing, that's your relationship with yourself, with God, you know, or whatever you believe in, because you really do have to have, you got to believe in something greater than yourself, because, you know, there's going to be seasons in life that are good and that are not, and it kind of ebbs and flows just like the weather. And I think it's really important to, you know thyself, and to know thyself, you know, we all have our own individual purpose, and in order to fulfill that, you know, we have a mission in life, and everyone here has one. And I think it's really important to come into that and be who you were authentically created to be. And when you do that, you can actually change your cellular biology. You can improve your confidence, you can decrease your stress, you know, you can improve your appearance, and your daily living becomes inspired because, you know, not only for yourself, but maybe others. And that's when you know you're approaching the holistic thing from a holistic standpoint. And, you know, anxiety, depression, loneliness are these problems that we're dealing with in society today that play into the mental health thing due to, you know, the breakdown that has been caused by the global health pandemic of this new communication strategy that's become digital. And everyone here has been on a Zoom call where you're doing whatever and your screen's blacked out and, you know, you're trying to get something done. And the accountability factor kind of goes out the window. And I think there's really the solution is to really go back to the basics and master the basics. And when you can do that in the areas like fitness, nutrition, you know, using products that are clean from the source, and having some form of, you know, mindfulness in your life that doesn't need to take a long time, then I think you're better equipped to perform under pressure and to lead teams and to provide value in your company, be a better employee, be a better, you know, husband, wife, friend, and, you know, that will allow you to want to be more social and want to be more successful. And it starts really with you. And yeah, that's why I like what I'm creating, this me is you concept. And you know, filming all of the long form content of these various situations that are universal that I believe we're all in. Waking up every day, doing something in the mirror, you know, going to bed at night, working, maybe working out, eating and drinking. It's really, all of this stuff plays into everyone's life. And so as humans, you know, we're all playing on the same page. And as technology changes, unfortunately, human nature doesn't. And so that's the constant that holds us all together. And so I think coming together and, you know, trying to approach each individual for who they are without judgment can allow a much more mindful or mind-body holistic approach, not only to, you know, wellness, but also to life. So hopefully that can give people more of an open-minded perspective, regardless of, you know, your background or belief system. I think it's super important, and that's really what's going to give us more of these solutions that can be implemented into corporate business. And once again, it doesn't need to be complicated.
I think for me, holistic approach to health, building off of something that Brian said and something that another panel yesterday was talking about, really goes back to community. Something that we see big in the military community is the buddy system, and something that I see a lot when I'm dealing with veterans, and something that I found a lot having joined my state militia, is when I joined the state militia, I immediately found a sense of brotherhood. I immediately found a sense of family. And for a lot of veterans that we're dealing with that are in mental health crises, they've lost that sense of community. They've lost their buddy system. They've lost their relationship. They've lost that sense of grounding because they don't have that community anymore. And that, for me, I think that holistic, you know, everybody keeps going back to that mind, body, soul approach. For a lot of us, I think we know that we need to take care of our bodies. We need to take care of our minds. We need to take care of our souls. And to an extent, I think we all know how to do that for ourselves. But I think the piece that we all kind of forget and that we all need to focus on is the community aspect, taking care of each other, taking care, you know, especially if you're in that position of management, of leadership, and you have the ability to affect your communities, to affect your companies. What are you doing to be able to take care of your employees? What are you doing to be able to, like, for example, in the first responder community, paramedics in Connecticut typically make around $30 to $35 an hour. Paramedics are typically working 60 to 90 hours a week, if not more. What time do we have to be able to take care of ourselves on our off time? Because we don't have any.
Liz, that's a great point, and actually leads me to another question. So I'll provide a little bit of a definition of my perspective on holistic health. In fashion of, we've talked about like these different domains of health, whether it's cognitive health, behavioral health, your mental, spiritual, emotional connection. Are there areas, and I'm going to throw this out to my panel, I'm going to build off of what you say, Liz, are there areas of our entire experience as human beings, this whole health wheel as we start to think about it, that folks tend to miss? And so, Liz, you've brought up community, and that's also struck in me recently. For folks that kind of follow public health, the U.S. Surgeon General has recently put out a advisory about the second pandemic that we're dealing with, this second pandemic of loneliness, and that as a society, loneliness and isolation is more deadly than smoking a pack of cigarettes a day. And we can give blanket advice to people like, get out in your community, get involved, volunteer, make a friend. But the challenge is, as adults, which I'm going to assume everyone here watching would fall in that category, it really is a challenge to make friends and find community as we move into different roles, we move across country. The pandemic certainly didn't help that at all. So one of my distinct privileges as a recreational therapist is teaching people how to use recreation and leisure as a coping skill. And so I might encourage folks to start to think about, how do you operationalize some of this stuff? We talk about conceptual things about holistic health, what it means to us, but how do we individually start to take stock of how do we start to move that needle in our own life? So I'm going to ask my panel to kind of marinate and think of some questions. But one of the questions that I might encourage the audience to think about, and this is kind of a 1-2 punch, so I apologize out of the gate. But as you're scrolling down on your notepad, the question is, what matters to you? What matters to you? What do you live your life in health for? So what matters to you, and what do you live your life in health for? And I encourage folks to marinate on that for a second, and we'll start to build off of this conversation together. So I'm curious to the rest of my panelists, are there questions throughout your experience as a human being, as a professional, as a healthcare worker, like many of us are? What are some of these questions that you ask yourself when you maybe need a little bit of a litmus test, or you're trying to check in with the holism of who you are as a person and your whole health? How do you take that pulse check?
I think that's a good question. I think everything is a system, and for example, the body is made up of massive amounts of systems: the endocrine system, the respiratory system, the circulatory system. The list goes on. And when you pull into your laptop to do work for whoever you're working for or yourself, you pull into another system. And you go on social media, there's another system. You're here at the conference, it's part of a system. So I think you have to be in a system, but you also have to go outside of the system and make some personal decisions and come back into the system. So no one's telling you to go outside of the system, but sometimes there are areas to check in or reset, such as, the mindfulness or the spiritual part or whatever you want to call it, that is outside of the system, where you can't really put like a number or, a necessarily track that. But I think that's actually where you can make the most progress. So, the communication of that and however that works for you, like for me, I take a walk and I just get all of my best thoughts, clearing my head on a walk, usually outside. At some point, it could literally be to the car on the way to work. It could be on a commute. It could be to end the day, like whatever, breaking up the day in the afternoon. I think for me, that's like what I like to do to get that reset check. But For some people, it's like their coffee in the morning, or, you know, doing focused work, or, you know, a lot of people find it to be very meditative to, you know, just make a meal, or to have a one-on-one conversation with somebody else that's has some form of depth, regardless of if it's, you know, useful or not. But, you know, implementing some of those systems for yourself that, you know, whether you're an introvert or an extrovert, you know, if you're an introvert, you just kind of need to be told everything's okay, right? You're working from home, everything's going to be okay. If you're an extrovert, you kind of need some interactions out and about, right? So to, you know, combat loneliness and, you know, these things that are the silent killers, right? Anxiety, you know, whatever. Implementing a couple of those systems for yourself that could be outside of the system, but for you, you know, it works. So for me, it's a walk. For you, it could be, you know, whatever that is.
And to reset that question, are there opportunities that folks can take stock of, questions that they might be able to ask themselves, almost like a litmus test that folks can check in and kind of take stock of where they are on their holistic health journey?
Sure. I'm going to kind of steal a concept that you and I were talking about. And, you know, I think in this group in particular, I'm just going to just blanketly call you achieving professional people. Ask yourself, what do I do for play? I think that adults forget to play. We don't prioritize play. And what I mean by play is not playing some game on your phone, right? Or even video games for that matter, because neurologically, those are not states of rest. And when I think of play, I think of something that puts you in a flow state that actually recharges you. And that could be painting, it could be walking, like Matt was saying, it could be anything. It could be lifting weights, martial arts, it could be just literally playing with children, right? And I think that that's where I think a lot of us just neglect ourselves, because we just don't play.
You make me very happy as a recreational therapist when you mention the word play. Absolutely.
You know, I kind of giggled at your question, like, what matters to you? So I was definitely my own first client, and after being a nurse for 16 years in trauma and critical care, I was so burnt out and in survival mode, I probably wouldn't have had no comprehension of that question whatsoever. My survival mode was to the point where I could not sit down, I could not sit still. You put me out to go on a vacation and my skin would crawl because my nervous system was so dysregulated, my hypervigilance was so at the surface. And what matters most to me, what are you talking about? Nothing should matter to me. My job is to take care of everyone else around me and to survive. So even to think of what matters most, which I think is why, you know, if you have a company or a healthcare system and you're looking and trying to figure out what do we need to do to help this, you know, our staff be more holistic, let's look at the survival mode rates. Let's look at their nervous system regulation. Let's get the trauma taken care of. That's the war under the surface first before we can ever move on to other approaches. Because play was absolutely out of the question because I just could only survive, even on vacation.
One of the two questions I'm asking myself is, what am I doing here and why? And this comes back to like you're in a situation where, you know, you're on your own. You mentioned loneliness, and they say, well, yeah, you may gonna go for a walk, yeah. So you take that step, or you're actually surrounded by too much noise, and you have to actually get into some like quiet space, yeah. Or it's just simply health related, and say, why I'm eating so much, yeah, I'm gaining weight, and have to do something else, yeah. So what I'm doing here and why, just to ask on a regular basis and just get out of your comfort zone. And now we talk about systems, but a lot of it is actually out of the comfort zone, and we're so comfortable doing things, yeah. I don't think a lot of people are comfortable talking in public. A lot of people are comfortable doing those things, but stepping out of that helps you to actually just get a little bit ahead of yourself and then just question things, yeah.
So pushing past that discomfort is really important. Absolutely.
Yeah, building off of what Natalie said, you know, being an EMS, when you're constantly barraged with that trauma, it never gets shut off. You know, going on vacation, you know, first thing we would do is find our emergency exit routes. You know, if I was on vacation, I have to be sleeping closest to the door. I knew exactly how many paces it was to get from my bed to the door, how many paces it was from the door to the stairwell emergency exit. I can tell you how many paces it is to get from this door to the emergency exit outside. My brain doesn't shut off when I'm on vacation. Even when I'm supposed to be on vacation. Although this is technically a work trip, so does it really count as vacation? But I guess your litmus, for me, I guess my litmus test is in something, building off something that Marcel just said too, is think outside the box, play. What's something that brings you joy? What's something, everybody thinks about, rest and relaxation, everybody thinks about like, fitness and working out, that's supposed to help build endorphins and help build serotonin. I hate going to the gym. I can't stand the thought of going to the gym. The thought of walking into a gym and being around a whole bunch of sweaty people is the most cringing, skin-crawling idea in the world to me. But I happened to go and do ballroom dance one day with somebody, and it was the most awesome, coolest thing ever, and I ended up doing it for the next 10 years. So.
Dancing. I agree with that. Get out and dance. I have the most fun when I'm dancing. Also, if that does require you to have some alcohol, that's totally, it's a big myth, because if you're lonely and you're just sitting there at home and you can't sleep and you're struggling with sleep habits, you're actually better off like going and doing something social, whether that's having dinner with your significant other or a friend or literally just that one person that you can call, or going to dance or going to have a drink out. Like a few drinks is not going to do anything in relation to like what you do consistently. So, it's actually a myth that you have to sacrifice your social life and, be this like wellness guru type of person. You can actually have an amazing social life and be very normal and still completely optimize your health in a very way that can transfer over into the corporate world and to your home. And yeah, once again, like all of this stuff can kind of get you out of your head. And the more you can get out of your head by doing something that is, stimulating, including even the mindfulness part, actively meditating, actively praying, actively taking a walk, but actively doing things with the mind-body connection is really like the way to solve mental health. So it does require action, unfortunately, and the more, passive mindset, sort of like reacting to stimuluses and response, the harder it is, so that's why I think it's so important to set some of these, take a macro overview of like your routine and these daily habits that you perform on a regular basis, which are almost like ingrained in us. And, habits are very difficult to break, but just stepping back out of the system and sort of looking at it and thinking, okay, what is it that I'm doing every day? Because I'm a product of what I do every day, like, period. So what is the product that I'm creating on a daily basis? Because over time, when you put in time and effort into something, it usually turns out you're usually going to get some form of outcome. And hopefully, you can learn from the mistakes. And I make a ton of mistakes all the time, but I think this whole like fountain of youth and wellness thing is about, having an open mind and being willing to learn. And when you're willing to learn, you're willing to change. And if you're willing to change, you're willing to, make progress. And it just takes, sometimes it takes, hey, what should my left and right be today? Like, just do it, kind of thing. It doesn't need to be this massive change. So it could be that one little small thing. And I think that's the most important thing. If you don't know how to get started, or you may not be an expert in different things. You just kind of want to get better. Just start.
So we're going to take some audience questions in just a moment here. To build off of that comment about like how to operationalize this, I can't say it enough as a therapist and a health coach. I am a therapist, I am a health coach, I go to therapy, and I have a health coach. And so as much as we can normalize those two processes, to Liz's point about the impact of trauma, we can't even have this discussion when we're in that fight and flight mode, when we're in this responsive reactive mode. So we have to really address those underlying traumatic pieces before we start to explore building on some of those pieces. My life completely changed when I went to therapy. My life completely changed when I worked with a health coach. We have to believe in these processes as much as we tout them to our clients. We need to take stock of them as individuals as well. In the remaining 8 minutes that we have together, I encourage folks from the audience, we have a microphone here in the middle of the room, to come on up, ask questions, provide some perspective, but we'd love to hear from our fellow audience members, and it looks like we're live. If you could introduce yourself, let us know your name and your question.
Certainly. Happy Wednesday, everybody. My name is Ro Patak. I represent Elevation Capital. We are a multi-business private equity firm with a heavy presence in the CBD kratom space from a CPG perspective, as well as multiple holding assets. So possessing the myopic viewpoint from the financial perspective, open question to the panel. Matt, I'd like to hear from you first. If you were to look on a macro level at the unit economics, and specifically where you see the biggest opportunities ahead, what makes you most bullish or excited from all the different lessons you've learned, either from your own experiences, through some of your fellow esteemed colleagues here who've been recognized with awards?
Yeah, I think I see the biggest room for disruption and growth, I think, in the media space around health and wellness. I think it's top of mind globally. The word health is top of mind globally throughout corporate business and, you know, in homes more so than ever. And I think, you know, creating video-based content that's long form, that can actually provide solutions and take you through the entire process of how to do something, as opposed to what we're seeing a lot now, which is short form content, and then giving people the ability to express themselves through short form content as a mechanism of validation and accountability. I think that chain reaction is really what can create a flywheel effect that, you know, can build a community. And like what we're all talking about here is, you know, you sort of have these core values and you try to embed those in the world the best you can, but really what makes the most impact is how do you build a community? And I think the fastest way to do that and the most effective way is really in the digital health space and through SaaS. And, you know, SaaS is software that is scalable. And when something is scalable, you can communicate the message more effectively to more people in a more macroeconomic way that can not only be more lucrative long-term, but also more efficient. But however, although I do believe, you know, digital health is the future, and there's a need for technology that actually provides these sort of solutions in the most holistic way, whereas, you know, there's a lot of apps out there, there's a lot of programs out there, but there's not a lot of all-encompassing programs, and I think that can be implemented into corporate wellness. And I think it can also be implemented into, like from a B2B perspective on SaaS, but as well as a B2C perspective.
Yeah. Right. So you see this opportunity through potential integrations with these large enterprise players who, you know, are valued at $1 trillion at any given trading day. And so I believe we have some colleagues here with questions. So I'll be brief. I really liked your point about the differentiation between the short-term and long-term opportunities. Could you just elaborate a little bit more on what that means from a content perspective? For the layman's,
Yeah, so smart people basically view content long form. So for example, most people in this room would watch a movie or a TV show or a podcast or a TED Talk or a YouTube episode, or, you know, buy a course and go through the course and complete the course and read a book, depending on what type of learner you are, right? So,
and Matt, those are versions of long-form content. Is that correct for our audience?
That would be an example of long-form content.
What would be an example of short-form content?
So, maybe like a couple different people on YouTube. Whereas short-form would be more, you know, these quick-hitter commercials or things that you're seeing on TikTok, which is a short-form content app. You know, Instagram Reels. These apps are created by people that want to get you addicted to an algorithm, right? And so most people are in an algorithm in which they're living not just from, you know, a AI perspective, but also, you know, a habitual perspective. And once you're sort of in that, it's tough to get out of that rut. And so, you know, I like coupling, what I'm trying to do is couple long-form content so that you can really gain trust and, you know, authenticity, and that's what's really what it's about. And then you can give people the ability to post short form, which is actually more of a social response for the human, because we're all social creatures, to, you know, basically validate that we are part of a community, that it's almost like a motivational, inspirational dopamine hit. So a lot of these things that we've all spoken about, you know, movement, food and drink, that's good. Interactions with people, mindfulness.
Matt's point.
These are dopamine hits.
Matt, we just have a few more minutes left, so I want to give some opportunities to some other folks. But to build off of that point, there's a key introduction around when we talk about tech-enabled care and human-centered care. We have a lot of these platform-based, app-based programs that have multi-million-dollar valuations, and that's amazing and that's important. I think one of the key things that a lot of these opportunities are missed upon is, yes, the content, but then how do we operationalize people to actually connect in their community? So for me, what we're seeing in the data with some of the companies that I work with outside is finding that happy medium between engaging content and actually engaging people to operationalize themselves, to get out in the community, get connected, take power of their own health, and not just live on that phone and device.
Right. So you view it more as operational than technological, as far as
it's got to be a mix. It's got to be
certainly a hybrid, right? Because there's always going to be a human element to
Absolutely.
it. Thank you so much.
Thank you.
Hello, everyone. My name is Pulkit Gupta. I'm setting up a plant-based vegan vegetarian cafe over here in Las Vegas. Thank you so much to all the panelists. This was an incredible panel. Got to learn a lot. I'm curious to get some insights on what is the future of nutrition in the healthcare system. You know, there was a panel yesterday around the early termination of pregnancy, but nobody really talks about the nutrition aspect of what is being fed to you know, mothers giving birth at the hospital, you know, to the postpartum food these new mothers are eating, and also the food which is being offered to healthcare professionals who are working at hospitals and other revered health offices. So what do you think is the future in terms of offering these people, you know, higher quality food, which would in turn make the people perform at a higher efficiency long run, saving millions of dollars to the healthcare system in long run?
Unfortunately, I don't think we'll be able to answer that question today, but I do encourage you to stay back and talk with our panelists. But nutrition is a core component of this holistic health, just as all of the other domains. I am probably going to get my gold hook here soon, so I just want to say thank you to all of my panelists today for your esteemed wisdom and for sharing of yourselves. If folks have questions, our panel members will stay behind to talk with you. But thank you for this opportunity. Thank you for everyone for your questions and for listening. And congratulations to everyone on the panel. Thank you.
One more round of applause for our panelists, everyone. Thank you for your insight and your knowledge. Incredibly eye-opening discussion. Moving on, as we all know, technology has been advancing at an unprecedented pace, and it is no different in the healthcare industry. From portable ultrasounds to 3D printing of organs, new screening technologies have the power to transform the way we diagnose and treat patients. Keeping this in mind, let's start the panel of the topic, Disrupting Healthcare, How New Screening Technologies Are Revolutionizing Medicine, and see what our panelists have to say on this subject. I would like to invite on stage our moderator for this session, Yasili Ogando-Roa, VP of Quality and Regulatory Affairs at Drive DeVilbiss Healthcare, and our panelists, Sean Nason, Chief Executive Officer of OFFOR Health, and Dr. Osama Kandilov, MD, Associate Medical Director and Assistant Professor of Internal Medicine at Care Medica Family Practice in Yale University, and Dr. Jeremy Koenig, Head of Business Development at Sequencing.com. Thank you.
Everyone. My name is Yasili Ogando-Roa. I am Vice President of medical devices, For me, how can technology disrupt healthcare means Right now, we are seeing 5G. But back when COVID came, this is when we wake up and saw how technology really was impacting healthcare. We had telemedicine, 3D printings, right? That is being used in surgeries. We had the watches band that we use to monitor our heart pressure, oxygens, and so on. Also DNAs, as Jeremy recently presented to me. Very, very nice job, and looking forward to hear more about that. And I would say, as we continue this, there are pros and cons. The pros are good. We're going to be preventing. We're not going to be reactive. We're going to be going to the root cause of the illnesses. The cons, a lot of data to collect, to manage, cyber attacks. We have to validate our software. And we have to have very good regulation. And right now, FDA is heavy in what it is data integrity. I'm going to pass it to my colleagues now.
Awesome. Good afternoon, everyone. My name is Sean Nason, CEO of Offer Health. We are a pediatric anesthesiology company where we provide anesthesiology to pediatric dentists. But I've been in healthcare for several years and really talked about what disruption is for a lot of years and have been known for it. And I think this is kind of interesting, and we didn't really talk about it here as a panel, but I think disruption has become a fluff word in the space of healthcare, much like the word innovation. Like, what the hell does that mean? What is disruption? What is innovation anymore? Yes, it's all happening so fast. What I have seen in my years, 15 years in healthcare, is this pendulum swing of everything must have a technology for it. So I lost track of, I think it's 3 million and something apps out there for healthcare now. So it's ridiculous. And in 2019, something like $68 billion was being invested in healthcare startups. And that we've seen a decline in that, because what's happening now is, how do you figure out to still stay high touch and high tech? Because the one thing in healthcare you can't do is take people out of it. And we as people want connection. We want to have that relationship. I never knew, I've worked in experience, and particularly patient-provider experience, for a lot of years. But last year, April 15th of last year, I was diagnosed with stage 3 colon cancer. I really didn't care what technologies were out there. What I wanted was a very educated doctor that knew how to deal with my cancer, and I had a relationship with and could walk me through that journey. So really I think the disruption comes in, how do we balance using tech as a way to help clinicians be able to take better care of people? So, pass it to you.
Okay, so, kind of going in through this journey of disruption, kind of going through the journey of how I came across, at least, to change up how we're doing in terms of the norm. There's, a very kind of conceptual concept in medicine regardless, which is, providing the best possible quality care over to your patient. And I think and this may be a slightly difficult thing to say in general, one of the benefits that we've seen from COVID, the benefits from COVID, is that it showed how fragile and how inflexible our systems are for adapting to change. My personal definition of disruption is more so of focus on building something new outside of the norm, outside of the regular route and vein of what we're used to and what we're comfortable with, but move into something qualitative. Aim to build something with a purpose that gives benefit to people down the road as we are building it. The difficulty with it is that we don't really know where it's going to lead. And this in particular comes into the discussion of AI, which has probably come up something, 5,000 times through this conference so far. This isn't the first time it's come up. It won't be the last time it's come up. But the idea of disruption, if you have a piece of cloth that you want to work with and you want to make a dress out of it, you have to cut it up in particular ways to be able to make it. But if you keep tearing at that cloth, you're not going to be left with anything. So I agree with you fully. It's that balance between finding the qualitative and new. And it's going to be a gradual process in and through. And I think us as a culture and a society, innovators from all different departments in marketing and IT, in technology and engineering and medicine and legal, bureaucratic, genetics, engineering itself, it's going to be a very shared and cultural effort for us to finally get to that stage where we're building something truly qualitative. That's kind of it. And I won't bore you guys with my story in general, but it's a long one, and I will ramble about it if you guys ask me about it later on.
Thank you. Thank you very much. Mig from sequencing.com. So I'm the head of strategy and strategic partnerships business. And years. And before I go into maybe that past or the future ahead, a quick question. How many people have had their DNA sequenced? Hands up. Oh, wow, the whole panel. Okay. All right, so we got around 10, and there's around 30 people in here. So I've been asking this question for about 10 years, and the numbers proportions are slowly increasing year over year. So the second question that I normally ask is, how many people in the room have DNA? Okay, so that's everybody. So we are close to have every year. Right. I'm yet to meet as reported not having DNA. So Right. The first question that I think. Okay. Yeah. You know, I think about. I talked to. Say again. I worked quite a bit as an entrepreneur as well, and with various startups, and saying that you're going to disrupt an injury has kind of become like a badge of honor. I don't know if you guys have come across that, but I think about disruption more in as really a byproduct. I think when I think about organizations like, say, Airbnb, where I don't think Airbnb started to disrupt the hospitality industry or the hotel industry. It was really, you know, folks would show up to a conference like this, as an example, and hotels would be fully booked, but there would be lots of empty rooms, and somebody had invariably an air mattress, and so we could be at the conference, right? So you're really, I think, dealing with, you know, a specific problem, and that was, you know, not enough places for individuals to stay and have a meaningful relationship. So it was very, like, experiential. And so then, of course, this evolved, and there are all kinds of, let's say, so the intended benefit is to get people to that experience, irregardless of hotel beds, right? But then there's been these unintended consequences. You know, one of them disrupting the hotel industry, let's say, but another one is disrupting the you know, the home industry, the rental industry, for example. You know, where I'm from, Halifax, Nova Scotia, in Canada, housing has become an issue because landlords would rather rent their houses to an Airbnb for 10x what they would get from, you know, somebody who might rent it for, you know, for a year, as an example. So anyway, with that being said, I kind of see what we're talking about. We're going to get into, like, screening and diagnostics, those are interesting words to define also. But when I look at disruption, it isn't necessarily the goal, but I do see there's like a gravity in the value that we provide. And so the opportunity before us, I think, with healthcare as an example, is maybe there are some things in the screening process, in the diagnostic process, that might improve specific things that we can measure, like how quickly you can get to your care expert on an emerge admission, for example, because, you know, we have the Internet of Things, and we have, you know, you've been framed up as an individual with your holistic picture of you before you even get to the hospital, as an example. So I will pause there. Pass it back.
Yeah, I mean, it's to exactly that point. You know, there is a systemic and there's a systematic way of how we do things. You know, patient shows up to the clinic, patient gets treatment, patient gets, you know, leaves the clinic, goes home, goes to the pharmacy, picks up their medications. We're kind of set from that perspective. There is a tried and true manner in which we can actually deliver care to patients. But recently, specifically since COVID itself, we've seen the uptick in massive different areas of services right now. We have, you know, the concierge medicine or executive medicine. We have some interest in at least telemedicine, which has been absolutely massive and is now a mainstay of how we actively see and treat our patients. Because realistically, let's give an example for flu or UTI, you don't necessarily need the full physical examination if this is something that's bread and butter based on your evaluation. We have concepts of DPC that are coming through direct patient care, an extremely interesting space that's being developed right now. But, you know, again, it's still an emerging space, and eventually we're going to get to the point where this becomes a mainstay of treatments. What we're doing with our clinic right now is we're looking into the international medicine aspect at the moment, and how do we leverage our skill set, our knowledge, what we've learned here, and connect with other communities abroad in how they perform medicine and practice it. Because really, this is a globalization effort. We're gradually moving closer and closer to total globalization, and healthcare is one of those spaces, I may just say this, is a bit behind in that perspective. We're there with the research, we're pumping it out, but we do have that limited connectivity from the medical side. I don't know what you guys think about that, but I mean, that's at least some of my perceptions in terms of some of those structural changes that have been coming in.
Well, and I think this still goes back to this principle, and not a very common and happy one for most people, is we still have a system that is built to pay claims, not to provide care. And I worked for one of the big 4 insurance companies. I don't anymore. There's probably a reason why. But we have, going back to even what you were talking about in the beginning, and the disruptive space and getting to this qualitative space is why are care decisions being made around how it's going to get paid for? And that, to me, even as we look at these new screening technologies, and I'm new in the dental space, and I'm learning a ton about what's happening there in the dental space. There's still basic needs of humans that have to be met in this healthcare space that we are just not doing. And so, yes, I get tired, and it's funny because I'm sitting on a panel talking about it, but I guess I get tired of just talking about disruption, when what we need to do is really get stakes and do what we do, and the main thing be the main thing, and let's take care of humans.
I would say that we have to take a step back and go back to the basis of communication, roles and responsibilities. We have end users or patients that need a service, a treatment. We have regulators, but we don't have regulations. Maybe table without the proper regulations released at the moment, or that I fear that behind 1,000 miles per hour. Said to bring claims. Can you hear me now? Yes. What is I'm going to repeat myself. So I was saying, everything comes back to communication, roles and responsibilities. Innovators are working 1,000 miles per hour bringing innovations. The regulations are not in place. How good is that? Whose role is that? Are we here to bring claims, or are we here to save life? And I think that for the whole purpose of health, awareness, medicine, is to save life. I would say it has to be a better system in which insurance companies, innovators, and the government have to come together to bring a better system. But we have to have a process for that.
A tiny bit of contribution into that as well, because I think it's not just the responsibility of the company, corporation, government that's making the rules and regulations. I think there's also responsibility that sits in with the patients themselves, the people who are actively using the software, to be aware of what it is, what it does, what the consequences are. My fiance, Jessica, she brought up one point in terms of, some of the technology that we use for genetic sequencing or gene sequencing, the 23andMe or Ancestry. We were chatting about this earlier. 20%, it's a 20% population pool, if not something smaller, of the base information that we use to give us genetic markers. When I test myself and I get the results back, it's telling me I have a Parkinson's gene, but that's only based on 20% of the global population itself. It's underrepresented, but also not clinically relevant, to which we're causing a lot of harm potentially to patients, mentally, cognitively, and maybe down the line. So, going to bounce it back to you.
I think definitely the population genetics topic is something we can dive in further on. Basically untapped richness and diversity that we're on our way to discovering. By the way, one of my favorite ideas from Stephen Jay Gould, one of my favorite authors, is this notion that the irreducible essence of biology is our variation. And so the way that we really get to understand that is actually by doing more representative sampling at the population level. But maybe before that conversation, because sequencing.com is doing some work there, specifically different indigenous populations in the U.S. and also in Africa. But coming back to your point around patient responsibility, notwithstanding there's a ton of disparity around socioeconomic status, many reasons why we're not in a position to be at our best and be our most responsible. So hopefully we have advocates, et cetera. But still, notwithstanding those points, what we're finding is with the rare disease community is a huge amount of proactivity insofar as taking on their own diagnostics, let's just say. So we take an example like EDS. There's about 1.5 million of those folks globally. But if you actually zoom out a bit and ask, well, how many people have rare diseases? Actually, it's around 1 in 10. And so that's about 1 billion people, let's say. And I think it's safe to say that all of us are carriers. So the idea of the way I've been thinking about DNA is DNA as a service, the way that we do software as a service, right? There's the commoditization of all of these kits and reports and technologies, et cetera. But there's a huge upfront cost to getting those things going, so it takes a lot of time. So if any physician is trying to do this on their own, to source the labs, the wet lab, the dry lab, to do all the bioinformatics, ensure the data privacy and security. No, so it's like, how do we take that wet lab stack, that dry lab stack, and then the physician or the expert becomes the UI on top of that. And of course you can plug in some software, et cetera. But I guess the point is so one of the two other words we were talking about was diagnostics and screening. And I don't, like, there certainly are diagnostic DNA tests that you can do, like, so the Parkinson's example, again, notwithstanding the disparities, so for some populations that's actually a relevant diagnostic, but for others it wouldn't be. But the notion that there's now this whole genome sequencing, where instead of sequencing panels, you can sequence the entire genome, 3 billion base pairs, and then you can actually engineer, digital screens on top of that forever after, and that is, evolves with, the utility that the practitioner wishes to prescribe. So that could be your concierge clinics, that might be IVF, that might be Parkinson's, Alzheimer's treatment. So yeah, all.
Prescribing is basically moving through the pathway that we are comfortable with, which is what we know. Somebody comes in with.
Yeah. So in a way, there's DNA as a diagnostic. Certainly, like the EDS example. It's like these individuals, because they're not patients yet, because they don't necessarily have anybody that would take them, because they're feeling a little. They're being told, well, maybe it's all in your head, kind of thing. So the diagnostic odyssey comes to a head where it's like, okay, I know what it is. But then the future utility of something like your DNA is not always a diagnostic per se, but a compass. So these specific moments in our lives. So again, at Planned Parenthood, for example, to find out, are you a carrier of a particular variant? What decisions might you make as a result? IVF, which embryos are you going to select as an example? Like, these are things that are happening now. When your child is born, are they born with a rare disease? Because there are rare diseases that manifest specifically in infants. Nutritionally, one example I give is, anybody seen any babies that turn orange when they eat baby food? I was one of those babies because I don't convert vitamin A or beta carotene to vitamin A. So that prolonged deficiency results in skin issues, immune issues. So again, this is not a diagnostic. This is it's a compass. So.
To which, I mean, like, you're referring to one of these core concepts in medicine, specificity, sensitivity. You want the ability to be able to rule out very common conditions that are coming through. Cystic fibrosis is one of those conditions that's screened at birth with infants, because I think 1 in 4 Caucasian people have the genetic carrier risk for cystic fibrosis. Cool, so we're going to screen everybody for that, fantastic. But realistically, to check if you have a gene that may be related to Parkinson's disease, or that you may have a gene that puts you at a high risk of having colon cancer, the clinical utility for that is very limited. It doesn't necessarily change the structure of how we will screen or treat patients, but it may cause more harm and worry. I guess what we're talking about is setting up framework and structure for new developments that are emerging and coming out. Yes, to your point, the responsibility of the corporation, not just to produce a product that is going to give us a very interesting feature or effect or something of that sort, but what is its utility? Actually something that's contributing into the health space that will benefit the patient. And I think that end sight is what's missing. It's who is the focal point of this product? Is this something fun that's there, or is this really to benefit somebody that's there?
And I can add, you mentioned the end user, the patient. It would be really nice if everybody understands the concept in one shot, but this is not a reality, right? So I have been for a long, long time providing training, and you can repeat and always come back with the same basis. I would say that it would be really good when we get to the point that people are willing to hear how technology can help them. But we need to be prepared. That's the con. How are we going to educate them? Without education, we are in the same place. Education starts where? At the school, at the homes. But sometimes the core of the house, parents are the ones that have to be aware that they have to have an open mind, that the world is changing, that we need to be open to new opportunities, but we have to be educated for us to be successful presenting this concept.
Yeah, and I'll add to this just a different perspective. So I spent 7 years working for the Walt Disney Company, and how they use data, and how they use data effectively. So I don't know about any of you, anyone been to Disney lately? Or had to go through a queue, right? They know how to move people through parks so it doesn't feel like the way that it does. Like a 3-hour line doesn't seem like 3 hours unless you have an 8-year-old like I do who has autism. It's like 7 days in those 3 hours. So as we start to look at this, and how many of you have a smartphone that you're holding right now? Anyone want to share how many health and wellness apps they have on their phone? 1? Oh, you may be the only one in the room. 4 or 5? About 7? You think you've got about 20? Right? Right? Now, how many of you use those apps? Okay, wow. Do you use all 7 of those apps, though? You don't use all 7, right? So that's a prime example of where technology being disruptive is a good thing, in my opinion, right? So how many more health apps do we need to create in this country? But we still do it, right? And there's startups every day being started. We are going to create the best diagnostic app that anyone's ever had. Have you gone to shop for a blood pressure cuff lately? Like, what makes it different than any other? It takes its blood pressure, right? Like, why do we have all of these? But where Apple truly disrupted the industry is they took something that we use in our day-to-day life, a watch. How many of you wear a watch in here? How many of you quit wearing watches because you use your cell phone as your watch now, right? Like, I wear one for fancy, but I can't read it. I still pick up my phone and have to see what time it is. So, but they took something that was so basic in our life and figured out how to integrate health into it. So you, sir, are saying you use your watch so you can do stuff. I do the same thing, you know, but I have 30 apps. And when I talk around the globe about this, I don't need a doctor to look at me and tell me I need to eat healthy. I know I'm overweight. He doesn't need, I tell my doctors, I don't need you to tell me to quit eating cheeseburgers and I need to eat this. I know that. What I need you to understand, and this, again, this came true to me last year once I was diagnosed with cancer, is what does this impact? How am I going to live a better life? What do I need to do to have wellness? And what wellness is to me may be different than what wellness is to you or to what wellness is to you. But we've tried to box this whole technology disruption thing into one simple box. And again, I said at the beginning, there's one thing you can't take out of healthcare, it's humans. And I guess I'm also tired of hearing us talk about we're going to use technology to become more patient-centered. Have you asked a patient lately if they wanted technology to be more patient-centered? Like, that's the stuff that I still think we just miss the mark on huge.
It's, a lot of it, I agree with you. I think it needs to seamlessly integrate in with the society as well, or with your daily life. There is no incentive for you. There's really no incentive for anybody to change how you're acting on your day-to-day, unless there's something that kind of helps with a prompt or an assistance, at least in terms of curving it up. So, I mean, with the watch, yeah.
10,000 steps. Yeah. How many of us got on the journey to walk 10,000 steps, whatever it was, 10 years ago, right? If you get 10,000 steps in, use this, and then how many pedometers hit the market? And then companies came out, right? Fitbit was born because of 10,000 steps. How many of you are still doing 10,000 steps today? Well, I need to take you out drinking because right? Like, I worked for Humana at the time, and we made this huge push around it. And then that's when all the gamification came around and behavioral learning and, you can change behaviors. Well, guess what? Once I got to the highest status that I could get using the 10,000 steps and the gamification, I got bored with it and I quit doing it. So it didn't change my behavior, right? So those are the things that I think we have to figure out. You look like you have a
burning desire to share. Yeah, I think. So let's just say, if it's okay, I would want to take a turn from reactive healthcare and more proactive. And by the way, I'm not poo-pooing on reactive. Like, there's people get in accidents and bad things happen. But shifting just to the proactive for a second. So I founded a DNA company focused on human performance back in 2016, and it was 2014 actually. It was way, way, way too early because we actually had to build all the apps that didn't exist at the time, right? So what it was is it was DNA at the center, and it was focused on athletes, and specifically track and field athletes. So I had a collaboration in Phoenix, Arizona with the World Athletic Center, thousands of athletes, track and field athletes specifically. So think shot putter, marathon runner, and everything in between. So different bodies, right? Very, very different bodies. But the thing central to them is they all had DNA, they all had goals, and they all had a coach. And that was really neat. And so think about that for a second, goals. It's an extreme health goal, but it's a health goal, kind of. It's not the most healthiest thing you might pursue to run as fast as you possibly can until the wheels come off, but that's what some people do. And so what I watched was we used phrases like user engagement. For an athlete who wants to run 9.58 and is willing to do everything to kind of sharpen the spear to get there, they're highly engaged, and they're interacting, with their coach because, well, they also only have a limited time to do this. Maybe they have 4 years to go at this. So there's an urgency around this, right? And in a way, there's actually an identity issue around this as well. And so because of that, gravity, that burning desire to be that athlete, you had athletes reporting daily on their specific biometrics. So at the time, this was before wearables were taken off. So people were actually manually reporting on their sleep, and they were reporting on their soreness and their rate of perceived exertion with the workout. And we were able to, use highly credible, qualitative survey metrics developed by exercise physiologists to actually develop what's called an acute to chronic training load ratio for athletes. And what that is a fancy way of saying this athlete is likely to get injured. And then we were actually able to adjust those scores based on genetic predispositions, and so get them on the massage table sooner, or get them in front of a chiropractor sooner, or get them in front of a nutritionist sooner, because what would happen, as an example, you might have heard of high altitude training. Athletes will go and train at high altitude to increase blood volume. That works for some, but it doesn't work for others, for example, who don't metabolize iron as well, or vitamin B12. So we had all this information, and we had athletes starting to make decisions on their genetics. But it was, as I said, it was implemented by the coach at the end of the day. And it was driven by this burning desire to manifest their best possible form. But again, what was interesting is at the center is you had this DNA, and take two 100-meter runner athletes, like a very homogeneous event, but athletes were training extremely differently because of their genetics, because of their experience, because of their vulnerabilities. Some would do a ton of weightlifting, and that would work for them, but that wouldn't work for others that are more reflexive and like a gazelle, so they would do more plyometrics. So the point was the athletes were really owning their journey. So I get to thinking about this, and I think about, what about that can we learn? And again, this is a more ideal, proactive scenario, healthy people, but starting with people young, how do we get them not to necessarily be Olympic athletes? And by the way, athletes in this group, there were around a few thousand of them. If we considered the World Athletic Center a country at the time, in 2016, they placed 5th in the track and field events globally. So it was a massive success, basically having this precision guide to your own human performance. So now what if we adapt that to not human performance for the Olympics, but human performance of your health? What are the data metrics? How do we create an environment of not necessarily an athlete, but like a healthlete, so to speak? So you take your health as seriously as you would your sport.
Yeah. No, just to dovetail off that, the idea behind having so many data points right now, it's kind of an insurmountable challenge really to sift through that quantity of information that's out there. It's never going to happen with people actively running through these particular mass mountain of data without having an organized format for it. So, a data scientist is going to have a question, they're going to ask that question, they're going to look for the particular pieces of information and account for that. That's the, yes. Yeah.
So the athlete wouldn't know about their iron status issue or their B12 issue until the environment triggered that knowledge. So in the same way, I've been thinking about this as like DNA moments, right? So at specific development phases in our lives, from infant to early childhood to adolescent, and on and on and on. What are the moments that we make critical decisions, and then what information from our DNA can pop up to help us make those better decisions? So there's this concept of marginal gains, 1% better every day, and then how does that translate?
It's exactly that. It's the idea of not reactive or defensive medicine when we have the opportunity to be proactive about healthcare. When we think about somebody coming into the clinic, into the office, and you want to screen for them multiple different things that they're coming in for, it's again an insurmountable quantity of data for the time that a provider has to sit down and talk to a patient and work with them and diagnose and treat and counsel and focus on their wellness, and it'll never happen. The goal is, though, that when we have these types of technologies and applications and, again, the emergence of AI, we now have the ability of a supercomputer at our hands where we can potentially navigate this mountain of information in a way that we've never been able to do before.
So I'm going to play a little bit of a devil's advocate here around this because, as I mentioned at the beginning, I'm CEO of a company, Offer Health. 98 to 99% of the patients we take care of are on Medicaid. So it's great to talk about proactive health, but again, if we aren't dealing and meeting the basics, going back to when the 10,000 step thing happened in the world, I remember I spent 9 months in the state of Mississippi doing ethnographic research to really understand what was taking place. And I had a mother look at me and say, I am more than willing to do 10,000 steps, but I work 2 full-time jobs. Who's going to have someone come and take care of my 4 children at 4 a.m. in the morning so I can get up and get those 10,000 steps? So I love that the fact that we in healthcare are talking about proactive health, but we can't even talk about proactive health until we meet the basic needs for someone to be able to start looking at proactive health.
And that's exactly my point. We have to go back to the roots, family, the core. If we don't organize our life, we can have 10 apps. We can have 3 watches. We can have AI, which is at the earliest beginning. But we work in 2 jobs. We had 3 kids. We had to plan, start again, education at the core. This is my point of view. We can have right now the rocket to go to the moon, but if we are not mentally prepared to do that, we're going nowhere.
I agree with you. You know, I think with, again, the emergence of all of these technologies, with everything that comes into play, these are tools that we can use to help answer specific questions or to get us to a particular point. You know, if we have a history of atrial fibrillation or we're just interested in our heart health, interested in the activity that we're doing because we want to better ourselves down the line, we have a tool for that. We can use it, fantastic. And if that attention span, let's say, you know, with an application that comes through is 2-3 months, but we got some benefit from it, fantastic. But I agree with all of you. This is not the all and be all. An application is not going to solve everything. And this is the same thing as putting like a piece of tape over on an empty faucet. You know what I mean? It's not going to stop the leak of water.
We don't need another app.
Yes. Yes.
So if you're an app creator here, I'm sorry, but we don't need your app. I spoke to the leadership at Pfizer 2 months ago. Just in Pfizer alone, they have 96 different apps. How is that patient friendly? So I have to have, you know, I have colon cancer, so I have one app. Oh, I'm a male with colon cancer. Oh, that's another app that you have to have. You know, you're obese with colon cancer. Oh, that's another app that you have. Like, it's insane to us. I know we only have 8 minutes, and we probably want to open the floor for questions.
When we have the DNA project ready to go that you presented, Jeremy, it will be easier to say, based on my DNA test, this is what I need, because this is the root cause of my problems. And then we can decide which app to follow, right?
Well, so I was thinking about developing this app. So, no, but seriously though, so I just wanted to maybe finish on this point because we did talk about it at lunch. So there's this opportunity to have you know, a conversation with your physician. So at sequencing.com, again, it's a wet lab stack, dry lab stack, and then on top of that, you've got the patient care and the physician. But ultimately, what you can do now, or you can very soon, I've done it with myself, is you can basically have a conversation with your physician and with your genome in the context of, you know, the broader environment. And so ask yourself, well, what medications might I be allergic to? You know, I have a surgery coming up. What should I tell my anesthesiologist? So these are things that, not an app, playground, right? That's going to be the new word. But we have 6 minutes. We should probably open things up for questions if there are any.
Any questions, make any comments, please feel free to. Yeah, so thank you so much for those comments as well. Yeah, no, 100% agree. I think, it kind of comes back again to that main point, which is, again, yes, finding that pearl and really kind of delving into that one particular problem that's there. But we have, again, created so much information out there as well that really collating and focusing on one particular aspect of the problem becomes, it's a drop in the bucket in terms of hyper-focusing over on one particular aspect. Not that it doesn't give and improve healthcare, but in terms of the overall disruptive community, that's, or at least in terms of making effectual and large-scale change, maybe a bit difficult from there.
Yeah, and when it comes to payers, there's not a payer I know that's not making money. Hand over fist, right? So it is time that we start pushing back on payers to make it a consumer friendly. We were just sharing before this, I don't know how many of you guys have done any work over in the Middle East, but I was fortunate for a couple of years, about 3 years, to sit on a board for the Ministry of Health in Dubai. And my job on that board was to tell them everything they shouldn't do in healthcare that the USA is doing wrong. That's what they put me on, is because I studied those things. And it's frightening to see how messed up for such a brilliant company and the amount of money, or world, or country, and the amount of money we have in healthcare, how messed up it still is to me. So,
I think in terms of communicating about sandboxes, the tools and the treatments that we potentially have that are out there, and then the new technologies, new developments, I think we have our own particular sandbox that exists. Right now, this is the world that we are in. If we're talking and referring over to the US itself, this is the sandbox that we're in, including everybody that's in play. We need to find a new way to overhaul that system. I don't think that there is an immediate change for it or a sudden change for it, but this needs to be a very cognizant effort from everybody in play, in full agreement to make the same goal changing. Go ahead.
Hi. You guys talked a lot about disruption, but what could be the definition of disruption? To me, that's one biomarker replaces the better biomarkers, which covers, if it were covered 20%, right now it will cover 50%. So that is my definition of disruption. All others are redistribution of the information. And if you can elaborate on that.
I am in agreement with you because when disruption occurs, it can be improvement, also can be redistribution. I'm in agreement with you.
I would say it's, as well, yeah, sometimes it's kind of, okay, so let's stop what we're doing and let's move into something completely different from there. I do think that it's an evolution of what we've been doing in terms of norm. This is how we've been doing things constantly, chronically. We're still getting up in the morning, still going to work. In the past, it used to be us walking. Now it's in a horse and carriage. Now we get to drive our, Porsches or Ferraris or something like that. You know what I mean? But it's the same thing that's happening, just an evolved format of it to make the process easier and more simplified. In my mind, disruption isn't an immediate change or something that completely shakes up the, it's not an earthquake that's immediately there. It's a gradual shift in the ecosystem.
Okay, thank you.
Well, I'll just say that the disruption doesn't need to be catastrophic either, right? Like coming back to this notion of, the nudge, it could nudge us in the right direction. So, yeah. Go ahead.
I just wanted to be a little bit of a contrarian and push back on some of the payer bashing, because I used to work at Aetna, and we would look at health outcomes. And so there might be two surgical options or two treatment options. One would have a readmit rate of like 50% and a mortality rate of 5%. Another would have a much lower readmit rate and a much lower mortality rate. And so did the second option cost Aetna like less money? It certainly did, but it was better for the patient as well. And we would try to talk to providers saying like this, we advise you to do treatment option number one over number two, or number two, over number one. And the pushback is immense because they're like, well, who are you to tell me what to do? I'm the one treating them. I know what's best. And then when that person dies or ends up in the hospital again, as we know that the statistics are going to bear out, then eventually they'll come around, but it takes years. So I would say like maybe less of an adversarial relationship with payers and really trying to find more of a common ground with them, because they have a tremendous amount of information. And at the end of the day, it's in their best interest to keep their members healthy, because that means that they're paying out less and the member is happier. So everybody wants the same outcome. It's just how you get to that outcome that's the problem.
So I'm going to be the adversary. I don't think everyone does want the same outcome. My insurance wanted my oncologist to do a completely different treatment on me because it was cheaper for them to have to pay that versus the treatment he wanted to do. And if I wasn't educated in the system to know how to work around the system, I would have never got that treatment. But it was all being driven by money and what was cheaper for the insurance company to cover versus what was best for me as a patient. And I'm sorry, I don't think insurance companies have the right to tell me what's best for me and what's working best for me. They have data. I worked with all of them when I worked there because I ran innovation. They have data, but very few do I see make decisions based off of what's best for the outcome over money.
Sure. And I would say that some of those...
Gentlemen, I would love to continue the discourse, but unfortunately we're out of time. I appreciate you for your question, and if anyone has any further questions, you may approach the panelists with their consent outside.
Would love to,
all right.
Would love to continue
Moving
the discussion
forward.
further. Yes.
The progress... Oh, you know what? Let's give it up one more time for our panelists, everyone. Thank you. Yes, truly wonderful. The progress we've made in recent years in mental health care is indeed worth celebrating. However, there is still much work to be done to ensure that those living with mental health challenges are treated with the same respect and dignity as everyone else. As we delve into this multifaceted subject, our panelists bring their wealth of knowledge and experiences to explore the issue from various perspectives. So please put your hands together for our moderator Minu Bassi, CEO and founder of LRS Wellness, and panelists, Conrad Aquino, MD, Chief Experience Officer, Stress Free Initiative, Raheel Sadiq, Motivational Speaker, Colleen Greco, Joyologist at Colleen Greco, Faith Sundaralingam, founder and psychotherapist at Renewing Minds Therapy, and Dr. Nusha Nui, PhD, clinical psychologist at Marina Health of California. The topic of discussion is mental health care, how far we've come and what needs to be done. Thank you. The floor is yours.
Test. Is this working? Can you guys hear me? With the few of us left in here, so hang in there. We'll make this fun and interactive. So thank you for joining us virtually as well as in person. And yes, mental health is on the rise. And it's time to do something about that. It's on the rise due to the post-pandemic, COVID-19 pandemic. It's on the rise with smaller family units. It's on the rise with less community involvement. It's on the rise with all the social media apps that are bringing individuals more introverts versus being extroverted. There's less interaction with humans and more interaction with technology and apps. And it's time to change that. And that's why we have our specialists here to discuss their piece of mental health and why they do what they do, and what's been your experience in it. And also, if you can briefly introduce yourself as well before you speak on the topic.
All right, well, good afternoon. I'm Conrad Aquino, Chief Experience Officer, Stress Free Initiative. I'm originally from the Philippines, came over here in 2007 and landed in West Virginia. Not that America that I had in mind coming from the Philippines, right? So anyway, brought my family here now. We live in Maryland. I have a family with 3 kids. The eldest is 17 now, going to college. Mom is not quite still ready to separate with our eldest, but that's who I am.
Maryland, shout out. I live in Maryland too. So Raheel Siddiqui, if you guys didn't hear me this morning, I am a motivational speaker. I recently lost 190 pounds and just blessed and thankful to be here. My journey's been pretty wild and booking engagements across multiple platforms, and really want to help share my message, my story, my background about how I was able to overcome so much adversity, struggles, mental health issues, just a little bit, and can't wait to have this amazing discussion with this amazing panel here.
Great, thank you. Colleen Greco, joyologist. So happy to be here. So my story, very personal as well. About 6 years ago, my son was 10 years old and he attempted suicide. And thankfully he's okay. But as you can imagine, that brought our family to our knees, and that really made me question quite a bit. We made a lot of changes. As we were beginning to repair and rebuild, I did a lot of work on myself. We did a lot of mental health work within the house. But it really sort of unveiled to me my calling, which is joy. And everything I do when I coach clients, be it in nutrition or their mindset or their approach to their own life, is firmly grounded in joy. So thank you for having me.
Hi everyone, my name is Faith Sunderlingam. I am a psychotherapist and founder of Renewing Minds Therapy. I'm also a speaker and an author. My why started at the age of 4, quite young. I should also say I'm from Toronto, Canada, repping the 6 today, if you know Drake. My why started at the age of 4. My mother was diagnosed with a chronic long-term illness, and that really shook up our household. I saw the impact of trauma occur within a marriage. I saw it take place in a family. I saw it impact my childhood. And she unfortunately passed away when I was 16. And so that really catapulted me into this whirlwind of just unpacking what I was navigating in my childhood, which was essentially a childhood that was lost. So I'm continuing to learn that, and that's essentially why I do what I do. I want to be able to engage in mental health conversations and dialogue, the conversations that I never necessarily got to have when I was going through my journey. So it's a pleasure to be here.
Hello, everyone. My name is Nusha Nuhi. I'm a licensed clinical psychologist. I'm based out of San Diego, California. My company is called Marina Health of San Diego. My why, or my purpose, essentially, started out between the summer, first and second year of college, when I was volunteering at a cancer hospital in the pediatric ward. And I was working with patients one-on-one, just providing general support, water, movies, things like that. And I just started noticing how often the medical doctors were really rushing in and out of the rooms, and how they weren't getting a lot of focus on the behavioral, emotional, mental toll of what the cancer diagnosis was for these patients. And so I switched from pre-med to psychology, much to my parents' surprise. And here I am today, and I focus primarily on how physical health conditions affect the individual and provide support through their journeys in that. And I'm honored to be here. Thank you for having me.
Excellent. And my why, briefly, mental health is something that I battled with throughout my life and during many situations and times. But the reason why I got into developing LRS Wellness was there was a time when I worked for corporations, and I thought I was at my high peak of my career, reporting to the president of the company, everything's going well. And I had to go in for my meeting, but I sat in my car frozen, not being able to move. My mind, I still can't explain what was going on. My mind was working, but body wasn't. And all I kept saying to myself was, oh, you have a meeting coming up, you gotta go in. And a couple of minutes later, I'm like, oh, okay, I guess I can't. And missed that meeting, missed the second meeting, finally built up the courage to open the car door and go straight into my president's office. And I told Mike, I can't do this anymore. I don't have it in me. He's like, what do you need? How can we help? And I said, you could put $1 million on the table, it's still not enough. And that's when he said, those keywords that you're in the self-fulfillment stage. And I believe today everybody is in the self-fulfillment stage. Our needs are met in terms of resources, nutrition. We have a lot of services and products that can help each one of us. But what it takes for more than that, it takes for us to go in and really analyze and figure out what it is that we need and to feel authentic in our bodies and to be as real as possible so that we can spread that wellness to others. So that's how LRS started, and it's been established since 2017. And the goal in the long run is to be the Amazon of wellness services. And I will continue to the next question. Now that we know what we know with our 3 days of conference, with meeting with so many intelligent minds, discovering so many amazing apps, what can we do from here on forward to ensure that mental health can be combated, that it doesn't continue to go on the rise that it has been?
All right, so forgive me, I didn't know we were talking about the why the first time we introduced ourselves, so let me tell my story. So started when I was still a kid, teenager. I had chest pains, a lot of chest pains, and the chest pains would happen anywhere, anytime, at church, you know, at school, wherever that was. And I didn't know what it was at that time. But going into med school, I started to learn more about what heart attacks are. And then the way that the cardiologist was describing what a heart attack is and what you feel like when your chest pain, like, wait a minute, I feel that. I know that feeling. And so I approached him and asked him, hey, I know that feeling. I've been experiencing that as a teenager. Like, what do you mean by that? As a teenager, it's not heard of, you know, having heart attacks as a teenager. So he took a listen to my heart. There was something wrong with it. And there was a third heart sound. You shouldn't have a third heart sound. And got it checked up, and they saw everything was normal, but let's proceed further. They did an echo, which is basically an ultrasound of the heart. They saw a huge part of my heart that doesn't work anymore. So it was really a stress-induced type of heart attack, even as a teenager. And it further progressed, although they gave me pills for that, it further progressed to give me more anxieties. And the anxieties with the palpitations, the sense of impending doom, it just happened at random instances, driving, you know, buying groceries and things like that. But the thing is, what happened to me, the why I'm here today, is because I was able to change that around, where my life has totally changed, a 180, to be able to, you know, do something about it. And to go to the next question now, what do we do about it? What did I do about that to be able to change that mindset, to be able to get where I am? Well, right now, I'll be honest with you, it might shock people, but the truth is there is nothing that stresses me anymore. So from that day that I realized that, and I remember it clearly back in 2008, it was spring, from that day onward, I was relieved of all the chest pain. I was relieved of all my anxieties, and I didn't have to change my work, my job, my family to be able to do that. It was as simple as realizing what those stresses are and taking away those stresses. Because the stresses exist when we have, let's say, the difference of our expectations and what actually happens. So the greater the difference between our expectations and what happens, the greater the stress. The smaller the difference, the smaller the stress. And sometimes they align. The stress level that we have plus, you know, the expectations that we have, like maybe you got promoted and this is what I expected. And so, sure, yes, wonderful. But it rarely happens that way. There's always that gap between the expectation and what actually happens, and what we fear about, what has happened in the past, what might happen in the future, and what it is right now. So what I did was to simply remove the expectations. So if you remove the expectations, there's nothing to compare reality with, right? And without comparing something with reality, the gap ceases to exist. And because it ceases to exist, there is no stress. That's kind of my superpower today. The peace of mind that I have does not rely anymore on my job, the people I interact with, my bank account, and it's just happens. So I'd just like to share that with everyone.
Awesome. So I guess I'll kind of do a two-part, adding to my why and also to the question of where we can get better. So my why, briefly, I fast forward to 2010 January. I was 27 years old. I was 405 pounds, very broken, very depressed. I mean, I was on a downward spiral. My father, who was a healthcare professional at that time, he was a pharmacist. He just looked at me one day, blue in the face, and he was like, I got to take you to the doctor. I'm getting very concerned for you and your health. Let's go get checked out. Got my blood work done, went to the doctor's office. A few days later, the doctor comes out, has a folder in his hand. The results are in the folder. Looks at my father and I, flips through the few pages of results, closes the folder, throws the folder on the counter, and looks right at my father and I and says, it doesn't matter what these results say. Your son will be dead by the time he's 40 anyways. I mean, we're kind of wasting our time here. And that was it. And first thought was, well, there goes a 5-star review for you. But my father and the doctor talked for a couple minutes, and then we left. Fastest doctor's visit ever. Driving home, I was driving. My father was in the passenger seat. We were about halfway home. My father was like, hey, I need you to pull the car over. I said, okay, is everything okay? He said, pull the car over. And he had looked at me right in the eye, and he said, listen, you know, this isn't a game. I'm running out of time. I won't be there to see you get married. I won't be there to see you have kids. You need to take this seriously. You need to promise me. And, you know, I'm thinking to myself, I'm a father now, so I'm like, you know, typical parents-child relationship. Oh, my dad, you're just talking crazy. But I just saw the pain in his eyes, like the watery eyes. And he had a liver issue that he was dealing with at that time, and it was really wearing on him. So I just felt like in that moment, that was like his one moment to kind of really get through to me, maybe his last moment. So I said, okay, I promise I will do my best. I promise I will try to, you know, take this seriously. Tried and failed a lot. Joined the local gym, tried to play pickup basketball, just kept quitting. It's hard to tell a guy who's 405 pounds and who doesn't see light at the end of the tunnel. But, you know, few close friends of mine told me about a local gym, joined that gym from May 2010 to May 2011. I lost my first 150 pounds, and I felt like I was an unstoppable force. My father was happy. I fulfilled my promise to him. July 2011 rolls around. 2 months later, go for a family wedding in Connecticut, and we're thinking we're just going to go for the wedding and come back. The night of the reception in the hotel room, my father's liver blows out. He ends up dying like right in our hands, and it was just a very, you know, traumatic experience. And I'm thinking to myself, man, like, life is just not fair, you know. But I think the end all be all is I just have like this fire that burns inside of me, and throughout all the experiences that I've been through, and I felt like when he looked at me at 405 pounds, he saw the guy that you guys are seeing now. I didn't see that. You know, it's like he just had this vision inside of him, like looking right at me, and he just felt like I was different, and he felt like I was special. And when all of you guys leave here today, I want you guys to understand that you guys are different and you guys are special in your own way too. And I truly believe that. I feel like somebody, a loved one, a spouse, a child, a parent, they probably see that in you too. And maybe you can find it yourself, but I truly feel like that's how I feel. And I feel that now. And I feel like 13 years later, I've been through so much in my life. You know, with the day of the funeral, I actually ended up blowing out my back. I had severe sciatica down my leg, L3, L4 for 8 years. So I actually gained about 60 to 65 pounds, you know, as the years go by. January 2020, I blow out my second herniated disc. I had back surgery. I didn't want to keep going. I wanted to quit. I did quit, man. I wanted to quit. I didn't want to do it anymore. But my wife, my rock, my everything, she was like, you can't quit. You made a promise to your dad. My son was just born a few months earlier. She was like, you need to be the best version for our son, mentally and physically. And she's like, I know you, man. Like, I know you. I know you love to train. I know exactly how you are. And she was like, You will never be the best version of yourself. You will never be happy until you fulfill your promise, but also be the best version of yourself. So every day I wake up, every single day, and I hope all of you hear it in my voice, I just have like that fire that just burns in me. Like I probably have nothing left to prove to everybody who ever doubted me, but I still have everything left to prove. And I tell everybody, don't ever sell yourself short. If you want to be great at something, go get it. I always believe in my philosophy that life has nothing but a bunch of walls. It's up to you and you alone. Either you run away from those walls or you run right through it. And every morning I get up, I'm going to run through every wall that comes in front of my way. And that really stems from my dad and my wife and my son. And in terms of where we're going really quickly, I feel as though you have to be selfish. And what I mean by that is do what you need to do. It's okay to not hang out with friends. It's okay to not hang out with families. It's okay to not to socialize. It's okay to take time for yourself. You're never going to find, you know, that stability in your mind if you're so worried about taking care of others. I get it. We're all, you know, or I don't want to say all, but we feel like we all have responsibilities towards loved ones, relationships, kids, and I get all that, and that's great. But that, you know, but there's 24 hours in a day, and I hate it when people always tell me, over here, I want to exercise like you, or I want to get to an exercise program, but I don't have time. You have time. There's 24 hours in a day. You work 8 hours, you sleep 8 hours, you have commuting, you have family. You have 1 hour to dedicate for your physical health and your mental health. So bottom line is you have to find a way to be selfish, and I promise you, if you can lock in that brain and keep that discipline, put that in your mind, I am going to dedicate 1 hour to myself. Be selfish, because you're not just being selfish to be, you know, greedy. You're being selfish because you want to be better, and you want to be better for yourself, and that way that could be the best version of you for all of your loved ones and so forth.
Mic drop. So I think, you know, when we're talking about where mental health is going, there are a few words that come to mind, and I can appreciate what your doctor said to you, but I think, you know, we need to be leading far more with kindness than berating a patient. It did work for you. You snapped out of it, and thank God you did, and your dad had your conversations with you. But I do think most people don't respond to that, and they actually spiral even further. And so in my line of work, I'm trying to teach people about self-love. And self-love is the foundation of any transformation, and it's so critically important to mental health. But being kind to yourself is one of the toughest things to do. You can be kind to other people. We all hold doors for people, buy each other coffee, whatever. But who looks in the mirror and can say with complete conviction that they love who they see? Not many people, which is why I'm employed. But I really want to get more and more people to that point, to the point where they can really love who they are. I also want to remove the stigmas that are associated with mental health. I shared that my son had committed suicide, oh my gosh, I'm so sorry. He attempted suicide. And thankfully he is okay today, thank God. But we didn't have any services. No one would take my call. I made hundreds of calls and left messages. No one, not one person would take his case. And so imagine, you know, I'm in shambles, he's in shambles, my husband, my other son. And so there's this stigma. Nobody wanted to take on a 10-year-old that had a suicide story associated with them. And I think we have to have more resources available, if that's the case, to be able to rebuild. And I think, again, we have to talk about these stories. I think even now, he's really proud of where he is, where he's come from, but he won't use the word. And I use it all the time on purpose because I want to make sure that people know that this stuff happens every single day, in every single city, in every single country in the world, at any age. And it's frightening, and I think it's because we don't allow people to talk about it. So I think, you know, removing the stigmas, being super kind, you know, being very dialed into self-love and compassion, I think are keys to unlocking mental health issues. And you also need to, one of the things I work with my clients on is redirecting their response to triggers. So understanding that those stories that you tell yourself are not true. And I'm sure, you know, you two will back me up on that and probably talk a little bit more about it, but they're not true. And once you can figure out how to let those stories go, the sky is the limit. And it's really, really empowering. And I think that was the turning point for me when I realized that that story that I was telling myself wasn't true. I thought, well, that means I can tell myself a different story, right? Because I made that one up, obviously, right? And so that was a turning point for me. And once my clients master that, they very much end up, going to a point that far surpasses their expectations. So just want to kind of encourage that line of thinking too. And I'm glad you're here.
I appreciate what you mentioned about stigma, because for me, growing up as a Tamil Canadian woman, young child at the time, conversations around mental health were very keep it hush hush, keep it in your home and don't talk about it. Don't let everybody else know what's going on, because if you project that to everybody else, they're going to look at you and they're going to judge you and assume things about you. And so we hear this whole these connotations around sanist, crazy tendencies, right? That's what you used to affiliate mental health and illness towards. So for me, a big thing, and I think what we need to work towards, is engaging in dialogue and being intentional about it. If I didn't take the time and listen to myself and work within in order to deal with and get out the very traumas and unpack what was really going on in my mind, I wouldn't be here today talking about it. I think that also comes at that space of being willing and able to unlearn and relearn our very own misconceptions about what mental health, wellness, mental illness looks like across the board. I'm speaking from a Canadian context, but I think we're here with a bunch of innovators and leaders on a global scale. We need to acknowledge what that looks like from every scope, whether it's local, whether it's statewide, whether it's provincial, whether it's national, whatever it looks like for you internationally as well. We need to be able to unlearn and relearn our own biases. What I would also say too is we need to consider accessibility and understand that we will always be engaging with folks who may not have heard about these concepts or even been given opportunity to work through the things that they've been dealing with and living with, whether it's generational, whether it's just starting with them. Systems, institutions, perceptions, family could have set that precedent that you're not able to talk. Let's talk about it. Let's engage, not just have water cooler conversations at the workplace, but actually be intentional and go beyond asking somebody, how are you? Are you okay? Because we can all just say, I'm great, I'm doing good. But are we really doing good? Or are we just saying it for the sake of not having someone really ask you how you're doing? Be intentional and be receptive in those conversations.
Man, guys, you guys are so good. It's so beautifully spoken. So innovations in mental health, where are we going? This is a big question. I really had to think on this because I'm like, we've come so far. And like Meenu said earlier, starting out, the pandemic kind of shoved us in a way. And I'm grateful for that, sadly. We didn't require a pandemic to shove us towards mental health, but I'm happy the doors are starting to open. As we touched upon, accessibility is a huge thing. Insurance as a barrier, not considering mental health a part of medical care. Mind is a part of your body. It's all connected. Everything is integrated. This needs to all be together. In that, it takes me to integration, right? So integration, that is so important, whether it's you having a mental health provider in your medical practice or available at the hospital, someone to consult, someone to do what's called a warm handoff. So during a medical appointment, having someone come in and have a chat with the client or the patient about what's going on with them, what the toll is that they're experiencing through their diagnoses, through their chronic illnesses, through their management of various, stressors in life. And having someone there and, providing space and potentially getting that person an appointment right away or getting them connected to an appointment, reducing those barriers, increasing that integration, having on-call consultants available. On-call consultants available to, be available on iPad or by phone, things like that. And then lastly, and I think most importantly, is really the language we use around mental health and medical care. And we've touched upon this a lot in this conversation, this panel, as well as earlier panels. Language, at least in mental health, that's our medicine. The words that we use to interact with patients is our medicine. And we have to be very careful in the language that we use. And it's so important to not make the person their diagnosis. I do not work with diabetics. I work with patients or individuals with diabetes, a person with diabetes, a person with cancer, a person with high blood pressure, any other chronic illness you want to throw at me. That is a person first. Their diagnosis, their medical condition is second. We have to look at the person as a whole and use the appropriate language to address them as an individual in their journey through the waves of life and to support them in that. And I think those three areas, integration, accessibility, language, are really the future of mental health and physical health, because again, this all integrates. This all is one health. We just, separate it out a little bit in our discussion.
Fantastic. Thank you so much for your input on that. And you guys are absolutely right. And you might be thinking why we're here sharing our personal stories on mental health. And it's just to show you that we are a testament to that you can do it. Be real with yourself. You will fall many times. There were days where I felt like that every day was a new day, that I would have to wash the day before just to be stronger. And that's just it, is that many of us unfortunately experience a deeper level of pain to find that we need to heal ourselves by healing others. But we need to heal ourselves by sharing our stories and by motivating others to know that it's okay, you're not alone, we're all in this together. But what's the most important thing is that moving away from the traditional methods of feeling like that I can't talk about my mental health, that it makes me feel like a weaker person. No, it doesn't. It actually makes you a stronger person. The fact that you're able to still get up and cast your own journey and say that, you know what, I make the decision to be happy or sad today. Like Conrad said, he has the superpower to not stress. And that is a power that all of us hold. We have it within us. That my cousin and I used to say this: 0 expectations and 100% acceptance. And it's, as much as it's really hard to stay on that track and keep going and do what's good for all. As long as whatever you're executing, it's a win-win situation for all, that's when you know you're on the right track.
We can open the floor for questions.
We know, last panel, last day. Any questions? Oh, after you.
So, can you hear me? Okay, great. Hi, everyone. By the way, great panel. It was a very intriguing discussion that you guys had, and you highlighted great points. Just to introduce myself, I'm Nita Negra. My background is I'm a registered psychiatric nurse. And what you actually said really hit home to me, that when you're working in mental health, words are the medicine. So how you communicate and what you communicate is what's going to make an impact to those individuals. And something else that I find in my practice is the concept of trauma-informed practice. And so, which is essentially, should be applied universally, where regardless of whether you're working in mental health or just in healthcare in general, assuming that everyone comes in with trauma. Now, I guess my question is to you: do you find working in healthcare that everyone does apply this principle of trauma-informed practice in their approach and in their communication, not just in mental health, but just in healthcare in general? And if not, how can we equip healthcare practitioners to have those skills?
Thank you for your question. That was brilliantly placed. So I'm blessed in that I work in both a private practice and a major hospital system. And I work alongside medical practitioners every day. And we are so lucky because our practitioners are amazing, and they come and actually use us and talk to us and ask questions and things. Trauma-informed care, as you said, is very vital. Everyone experiences trauma of some kind at one point in their life or another, and especially when managing illness, it can happen a lot. It happens to everybody. So how do we do that? How do we address that? How do we talk about that? And I think some people are, most providers I would say are aware of it. I don't know, or how do I put this? I can't say that they always have time to address it. And I think the time is a part of our accessibility piece, right? Like having the time, having the capacity as a medical provider to sit there and ask, what has this experience been like for you? Like, let's talk about this. Let's talk about what you really struggle with and how that's affected you and potentially how that's been traumatic for you. And it's just not always there. And I think that's a big part of it. And also just, again, like we talked about, learning the language. You know, speaking to someone about trauma, having trauma-informed terms in care, it's very important, and it should be integrated within practices. So maybe more trainings, more discussion, more accessibility, all of that. It all is a part of the whole package, providing care.
One of the approaches that I utilize when I work with clients is a trauma-informed approach. And the one thing I will say that I've identified is that a lot of times we maybe are a little bit more hesitant or apprehensive to address trauma for what trauma really is. It is entrenched in a lot of us, like Nisha, you were saying. And I think once we've kind of debunked that and stepped away that it's not a fearful concept to address, that intentionality in terms of what trauma can present as in an individual is really important. Trauma might not come out in our words, it might show up in our body. And I think a lot of the times what happens with trauma is we feel things physically. Bessel van der Kolk, great individual, he wrote this book called The Body Keeps a Score. And he wrote about how trauma shows up in the body, and I think maybe it would be something to look into. It's a great resource to really see how it shows up, and he identifies how he's worked with his patients in terms of unlocking that. From a therapy perspective, I think also with medical practitioners, it's important that we're in constant dialogue and we're creating an avenue of access to communicate about it, again, to debunk that fear, you know, that maybe might sit as an umbrella over what trauma can look like and how we can work through it effectively as well. Yeah, and to normalize it, as Nisha was saying. Thank you.
Any other questions?
No, but thank you for answering that. That was brilliant. Thanks.
No problem. So one of the things that, that I would actually propose to everybody, and that is globally, right, is that we have the technology, we have the platform, and we have the accessibility, and we know this method works. And that method is, if Amazon is able to deliver products to each and every home, why can't we deliver wellness services to each and every home? Let's change it up. We have enough material where we're not a materialistic world anymore. It's all about mental health now. Take care of yourself. And together with LRS's vision, it is to build a community of health and wellness professionals and utilizing your services, your technology, and to be able to deliver your services to the consumer. And that is to homes across the globe as well as corporations. Our traditional EAP system didn't work. We know it didn't. We saw it during the pandemic. There was only 7% uptake on some of the employees for what they used in their EAP service. People didn't use it. They were scared. They thought they were going to lose their jobs because of it. But whereas with LRS's EAP system, we want to go beyond the traditional services, include some of the more modern and traditional services like Reiki, yoga, aesthetics, reflexology, nutritionists, doctors. All of these people should be at your fingertips. Just like you can open the Amazon app and done, you can order your products and it's there. Let's get together and develop this so that you can open up the wellness app and there, your service is there at your fingertips. And together, and it is a big, big project, but we're going to work together and do this. And I believe it in every bit of my cell in my body.
All right. First step, the first step that everyone has to take for that mental health change. The desire to change must be greater than the desire to remain the same. Okay, the desire to change must be greater than the desire to remain the same. And that's an action call to you for everyone in us to start that change within us. Thank you.
Any final?
remarks?
Let's just get together and rock the show.
One more round of applause for All right, up next we have a keynote on the topic Major Breakthroughs in Cancer Research. I'd like to welcome to the stage the CEO of Uncode Health, Kostas Fantis. That's right, gotta use those stairs.
Hello, Las Vegas. Right, this is a little bit of an unexpected situation. I wasn't supposed to be giving a keynote. It was supposed to be more of a fireside chat. So what I'm going to do is invert it. I'm going to actually create a fireside chat with everyone here. And I'm going to make a comment. Your name again, please remind me? Minu Bassi. I've created the concept that you're mentioning with Encode Health. We actually monitor medical inventory and match it with medical demand. So if you want to talk about the prospect of creating a kind of Amazon for medical services, come and talk to me. Well, you don't have to talk to me now, but we'll talk later. Okay? So with cancer therapy and new innovations, what I want to hear from people is what do we think are the most recent innovations? Just there's about 7 major topics, and I would like everyone to just shout out what they think might be the innovations that are really changing cancer care right now. Anyone? PD-1 inhibitors. So that's kind of to do with precise therapeutics. Okay, yeah, that's one of them, precise therapeutics, yeah. Anybody else? Sorry? Biomarker testing. Very true, that's another one as well. Okay? It's a third one, yes, very good. Exactly, yeah. Anyone else? No. Okay, so let me introduce myself and tell you a little bit more about my background. My name is Dr. Kostas Fantis. I studied medicine at the University of St. Andrews in Scotland. I don't know if you know the university at all, but it's the same university that Prince William went to. And I also went to Manchester University as well, where I set up a not-for-profit medical school. Whilst I was in medical school, I was known as the only medical student to own his own medical school at the time. Even though it was a summer school, medical students from all over the world would come, and we would inform them how to get into the specialty of their choice. So we would arrange workshops about surgical skills. We would arrange workshops around cancer therapeutics and what they would need to study in for their particular specialty, and other kind of workshops as well. So I set up that summer school, and it ran for about 10 years. And then I was involved in a company called Touch Surgery, and I was the senior surgical officer there, where I would create these procedures, animated procedures, and engage with some of the best surgeons in the world and some of the largest medical device companies, and kind of glean their golden nuggets of information and animate that process so that junior surgeons would be able to understand the surgical process. So we were mapping the surgical procedure itself, step by step by step by minute step. And during that process, we would learn a lot about the procedure. Currently, what I'm doing is doing research in the application of artificial intelligence in primary tumors in the CNS, so gliomas, and the application of biomarkers with that artificial intelligence process as well. So let me go back to the 7 main topics. Yeah. So, yeah? Sorry? So the other presenter isn't available? Oh, you're here? Well, why didn't you come? I've been emailing you. Ah. So I was informed by the organizers that I'm going to have to go it alone. Okay, so welcome. Yeah, I sent an email. Hi, pleased to meet you. Hi, Robert. Please take a seat. Let's have a fireside chat. Okay. So let me just finish off the topic that I was talking about then.
Talk about your things and then I talk
Yeah,
about my things.
sure.
Let's chat.
Okay. So the 7 major factors that have recently improved cancer care are precision medicine, immunotherapy, liquid biopsies, targeted therapies that were mentioned just now, minimally invasive surgery, artificial intelligence, and generally the supportive care and survivorship care in cancer as well. So I've done my introduction and I've started off the topic. Robert, please go ahead, introduce yourself, and let's have a fireside chat about those 7 main topics then.
So I'm Professor Emeritus of Pathology, Environmental Health Sciences and Radiation Oncology at UCLA and at 4 huge public universities in China. And I have 16 patents. And it's my mission in life to make all creatures in the world healthy, beautiful, and sane. So 16 patents, and I can cure most, up till now, uncurable diseases. And I have something for almost all diseases. And I have also something for cancer. Can I talk a little bit about the cancer?
Go ahead, yeah, please do. Hold your microphone a little bit closer to your mouth.
Okay, so what my chemical is doing, I call it a chemical because all drugs have negative side effects, and we yet have to find any negative side effect of my drug. The worst things that can happen to you is that you live longer without diseases, and without cancer, and without diseases. And this is all patented. So for cancer, it prevents cancer, and I can deal with stage 1 and beginning of stage 2 cancer because it inhibits the proliferation of cancer. And it also supports the immune system, and it actually, in addition, gets rid of all the other problems with the immune system, which are allergies, but these are other things. So because it supports the immune system, at some point, the longer the cancer doesn't proliferate, at some point the immune system gets rid of it. And for stage 3 and 4, it gets rid of the side effects of chemotherapy and radiation therapy. And finally, when the cancer is excised, it's smaller than expected because it doesn't proliferate further. And after that, it actually inhibits a relapse. And it cures tons of other diseases too. So it's highly anti-inflammatory, and that's probably why it inhibits progression of cancer because inflammation is involved in the progression of cancer and actually also the spread of cancer. So I have patients on lymphoma watch. They have not developed lymphoma so far. I have patients on prostata watch, which check their PSA level, and they have not developed prostate cancer so far. And none of my patients have developed cancer in the meantime.
This is fantastic. So how does it work? Is it like a targeted therapy like HR2 or BRAF? Or is it an immunotherapy? What kind of therapeutic would you say
yes,
it is?
Yes. It's probably more likely an immune thing because it supports the immune system. It actually gets rid of allergies. It gets rid of autoimmune diseases and also infections. And we're doing lots of other things with it. So it's probably immuno, but it's also, I don't know. It's specifically an anti-cancer. So in mice. Lymphoma-prone mice, where 80% of them develop, this is the ATM model, where 80% of them develop, 80 to 90% actually develop lymphoma. They live fourfold longer without, and the cancer onset is hugely delayed. Yeah, so these were the animal experiments, and in people it does the same thing. And it seems to work at least for lymphoma and prostate.
That's a very interesting point because in my research that I've been doing, some of the more recent publications have found that in primary tumors in the CNS, glioma specifically, 50% of the mass is made up of immune cells, white blood cells.
Yeah.
And also with the new kind of ways of monitoring whether there is cancer growth post-therapy, it's more to do with monitoring specific types of white blood cells.
Yeah.
Would you have a comment about that?
The immune
as well?
system is highly involved in cancer initiation, in actually development of the cancer initiation, and the progression of cancer. Yes, and that's probably where it modulates things. Yeah, but it also gets rid of precancerous lesions on the skin. I mean, this is my cosmetic cream that gets rid of precancerous lesions on the skin, which has the same chemical in it.
Okay. Are you allowed to talk about the chemical that you patented or the process that you patented?
Sure, I can. It's all patented, so I can talk about it. The only thing, you guys cannot announce it to the public, because then they might have a problem with the FDA. Not that it's illegal, but I don't want, first of all, I don't want 200 million people to all of a sudden want it. And secondly, the FDA might have a problem with
just
publishing.
just to let you know, this is live on YouTube right now, so maybe let's keep it to ourselves, and if anybody wants to contact you,
sure.
we can arrange that later then.
Well, it's live for our viewers.
It's a YouTube link.
Yeah.
Yeah.
It's not to the general public.
I think it is. Anyone who has the link will be able to.
Who has the link? But these are all people who either registered for it or other affiliated people. It's not to the general public. I actually checked that before.
Oh, okay, fantastic.
Yeah,
Good. If you've checked, then thank you.
Yeah.
Okay.
Yeah.
So how did you get into cancer therapeutics then?
Oh, yeah. Well, I'm professor of cancer research. So I've been always, I actually did my PhD at the Department of Cancer Research at the University of Vienna, and both of my parents died from cancer. And so I have lots of, even personal, and I myself had cancer at some point. So
Sorry to hear that.
I had a lot of, but it's all completely gone now. So I have personal experience, and I have lots of experience from my patients What I do is actually I listen to my patients, and that's very important. And about everything, even things which are unexpected or novel. And then I test that with a new patient population. And if it's something completely novel, then I have a new pattern. Yeah. Also has psychological effects. So I'm also curing most psychological and psychiatric problems. So it cures both the body and the mind at the same time. And that's also one thing about cancer somehow, that it also has psychological effects. And cancer patients have psychological effects. Yeah.
And tell me a little bit more about your trials or the way that you've developed your research, then, just so that the public will know, the public here. And then I think maybe we'll move on to some questions. Does that sound like a good idea?
Sure, sure.
Yeah?
And maybe we can collaborate with you seem to have patients, and see, brain cancer is also something which would be interesting, and actually maybe also some psychological effect, or maybe the brain cancer affects some psychological factors and psychiatric things as well.
Yeah,
Yeah,
absolutely.
Yeah.
Okay.
So what was the question again?
So the question was, tell me a little bit more about your trials, your research, how you actually arranged the trials with patients, maybe. Something along those lines.
I have about 50 clinical trials internationally going on with my thing. How it's arranged, I have patients and I talk to the patients, which not every doctor does, actually.
Yeah.
And I have a very detailed talk with my patients. And I listen to all the things they tell me, not just about the particular endpoint and the particular disease. And I think that is the difference, that I find new things by talking to my patients. And every patient has 4 to 5 things my chemical fixed. Normal people.
Okay. And how long, what length of period do your trials undergo? Is it like a 6-month with a follow-up, or?
So actually, so let me introduce the whole thing. I got a CMCR, a Center for Chemical Countermeasures Against Radiation Risk, 15 years ago, and I got $31 million from the NIH, and it took me 10 years for all the preclinical work and everything to develop that. And then it took me another 2 years unsuccessfully trying to convince the pharmaceutical companies to do clinical trials with it. And about a little less than a year ago, I decided, after unsuccessfully negotiating with Roche for 6 months, because everybody was interested, and everybody was interested, but nobody signed anything. So then I decided with my clinical director to design our own clinical trials and start our own clinical trials. So, and that was the best decision in my life.
Absolutely.
You cannot rely on anybody else, even with the best preliminary data, to do something for you. You have to do it yourself.
Absolutely.
And now all the pharmaceutical companies are interested in it.
That's fantastic news. Congratulations.
Yeah.
And not just for yourself, but potentially for patients worldwide.
Sure.
Yeah.
Sure.
So I would like to.
So the CMCR is a Center for Chemical. So the charge was actually to find something that, in case of a nuclear bomb or a dirty bomb or a radiation accident like Fukushima, or to have something for the first responders that they survive better. So what the chemical does, after an LD100, where 100% of the mice die, you give the first dose 24 hours later, so after the radiation, okay? All the mice which would have died are now alive. So it completely reverts the radiation damage, and these mice are now living a normal lifespan. So there's also no late effects of radiation. And it works in yeast, in human cells, in zebrafish, in mice, and it cures tons of diseases in those animals, and human keratinocytes live 15% longer with it, and mice live 33% longer with it. So that's 20 years in human life expectancy. So the worst things that can happen is that you live longer without diseases. And now since half a year, we're doing clinical trials with it. And it already cures almost all the until now uncurable diseases, and that includes COVID and diabetes, and I mean, I could talk for 10 hours about it. Yes, and it has a very fast action. So what it does, it induces in our body 244 different proteins. There are lots of anti-inflammatory proteins and DNA repair proteins, and also 9 neuroprotective proteins. So it's actually the first time that you have something that protects our brain cells, our neurons. And thereby it has also psychological and psychiatric effects. And it's highly anti-inflammatory, so it has also immune modulating effects. And also, I mean, it gets rid of allergies. It cures gluten allergy and coffee allergy and garlic allergy, and it gets rid of infections, it gets rid of COVID, it gets rid of tapeworms in my cats, and we are doing tons of additional things with it. We're even doing, we're even trying to get rid of antibiotic use in agriculture, because it supports your immune system, and to increase the meat quality with 10,000 cattle, because it also gets rid of sore muscles and of inflammation, so it should increase the meat quality. We are doing tons of other things with it too.
That's fantastic. So I've got a couple of questions before we open up the floor. How do you get the dosage right, or is there a dosage, or can you just keep on taking whatever dose, kind of like psilocybin? You can't really overdose on it, and you know there's kind of mental health benefits.
Yes, so that's an excellent question. Actually, we have not defined the optimal dose yet, but what we're using is the effective dose in mice. We're using now in people. And it doesn't matter so much, because 100-fold that dose is completely fine with mice over 4 generations. They do everything a mouse does, same litter size, same everything for 4 generations. 100-fold that dose. It's so high that it even falls out in their tissues. And it has no negative effect whatsoever. So it doesn't matter so much. But it's a very good question. One should actually use a minimum effective dose. So maybe one has to fiddle around. And for different diseases, actually, it might be a different minimum effective dose.
Yeah.
So that's a very good question.
Yeah. And you've kind of answered the question that I was going to ask, my second question. Are there any kind of autoimmune responses? But you've answered it. You said that there are no...
well, because it supports the immune system, it also gets rid of autoimmune.
Yeah.
Yeah.
Okay.
Yeah. So it has no negative. It also thins your blood, so it gets rid of blood clots. And that's the only thing that, I mean, if you're a hemophiliac, but we haven't tried. None of our people, our patients, have been hemophiliacs yet.
Mhm.
That's the only thing that. But I don't think it would. It would actually be a problem. It's just an overcautiousness that we exclude hemophiliacs. But the reason why I don't think it's a problem, because it does not interfere with the blood clotting by itself. So it doesn't interfere with any factor. It's anti-inflammatory, and actually inflammatory factors make your platelets sticky, and that's why you get blood clots. So it gets rid of those inflammation. It's still, so the blood is still sticky once it's exposed to air and whatever. So I don't think it would do that. But the only thing that it causes, if you have a flu, you might have more frequent nose bleedings. But nobody ever died from nose bleeding. And if you find that, then you just reduce the dose a little bit, and after 12 hours, this propensity for nose bleeding goes away. And it's not very bad either. So that's the only thing which we found. And the other thing that it makes your hair grow, and some people, and it increases vision, so I can get rid of all eyeglasses or laser surgery. I had myself had eyeglasses, and 4 weeks afterwards it cured 2 diopters and 1 astigmatism. So it does tons of other things. And you just have to clip your hair. That's the only thing, even your body hair. And on top here, this is all new hair. I was bald for 30 years, and now hair is growing out of the top of my head. Yes.
Yeah, we've got the same problem. Any questions? Can I open the floor to questions? Please go ahead, use the microphone.
Very interesting talk. I spoke yesterday. I think that I launched Gleevec in chronic myeloid leukemia, which was a great drug. Interferon was probably standard of care in bone marrow transplant as well before that. But it developed mutations. And that's why that's pretty scary. We thought we had the magic bullet, but like 5 years later, we started to see mutations from the drug. So what is your view on that, and can you ever really stop that?
Well, see, so this was the original experiment. It actually reduces mutations. It's an anti-mutagen. And actually it reduces even radiation-induced mutations. That was the original selection. We screened through 16,000 chemicals for something that reduces radiation-induced DNA deletions and radiation-induced toxicity. So it would reduce the mutation frequency.
Got it. And there's one more question. I also, for Celgene, we launched Revlimid for multiple myeloma. I talked about this yesterday. Originally that was thalidomide, right? The drug used for morning sickness in women in the 50s and 60s. The reformulation, this is the amazing thing. The scientists that thought about that, how do you think that came about? Because I kind of know the story, but what is your view on that?
The reformulation of...
Well, it was thalidomide to lenalidomide. That's lenalidomide's Revlimid, and that's used in a multiple myeloma. So
yes,
that's So here we had a teratogen, and like years later, now it's a cure for, not cure, but one of the best drugs for multiple myeloma.
Sure. So some chemicals, yes, have all kinds of other effects. Yeah. Sure. But at least mine, they don't cause burst effects, at least not in mice, and in people we don't know, but it should not. Yeah.
Please, yes.
This is kind of a personal question. My mother-in-law was recently diagnosed with stage 4 rectal cancer, and it spread to her lungs, liver, lymph nodes, kind of everywhere. She did several rounds of chemo, lost the sense of taste and every texture, everything was, and she started declining, not able to move much, so they canceled her treatment. Her son is, my husband is researching on the Finbin, I don't know, the Joe Tippin's protocol, and Finbinazine, it's a dewormer, I don't know. And I think he's reaching, trying to find answers in holistic approaches or other medications that she might be able to, that might be a miracle. What are your thoughts on that? And I know it's probably a loaded question, but it's just something very personal.
No. I have lots of chemotherapy patients. So my first chemotherapy patient, he threw up 4 to 5 times a day, lost weight, and just wanted to die. 1 week later, he drove his motorcycle for 320 kilometers. He stopped throwing up, gained weight, started eating with appetite, and he started doing things. He didn't want to be in bed anymore. Once the surgery came, the cancer was smaller than expected, and the second chemo was no problem whatsoever. So it gets rid of the side effect of chemo, and it also reduces the further progression of cancer. My second chemotherapy patient was a woman with breast cancer, and she started wheezing and coughing, and her daughter thought actually she's going to die. And her daughter is on my chemical because of a pancreatic cyst, which she wants to prevent from developing into cancer. And Steve Jobs died from pancreatic cancer. So she gave some of the chemical to her mother, and after 1 hour, her mother was sound asleep rather than dying. So it gets rid of the side effects of chemotherapy, and it also reduces the further progression of the cancer.
Thank you.
And finally, it actually inhibits the relapse of cancer because it's an anti-cancer agent.
Thank you for
and
your
anybody
question.
who wants information about it, I'm happy to send you information. I just need your business card, and I give you my business cards, and I send you information.
Thank you for that personal question there. And I'm sure you'll be meeting up later.
Yeah.
Any other questions? No. Would you like to add a final note or a message of hope, given your experience and your research? Any final words before we move on to the next session?
Sure, that what I really want to do in life to treat as many diseases as possible, and to make everybody happy, because I'm also curing psychological and psychiatric diseases with it, and so there's lots of comorbidities. Lots of patients actually also have psychiatric problems because of the disease. And one good example of that was one of my diabetes and long COVID patients. This is how I listen to patients. He actually was in pretty bad shape. He was mostly in bed for 4 years, and he told me he has this ugly old wife. And a week later, he calls me back and was bouncing off the walls. He couldn't stay in bed anymore. He was hiking for the first time in 4 years, and he always wanted to be outside now, and he told me he has this beautiful, loving wife. Okay? So it's not just, it not just cured his disease, but also it saved their marriage.
That's a wonderful note.
So that was the first indication, actually, that it might have some psychological effects as well. And then I started testing that on depression and other psychological diseases, and that was my 16th patent. So I'm listening to my patients exactly what they tell me, even strange things that, and then if that's fixed, then you have a new hypothesis and theory to test something new, and then you get a new patent and a new disease being fixed.
Fantastic. People always say that love saves all, but maybe in your case, health saves love.
Yes, yes. So I want everybody to be happy, beautiful, and sane, and healthy.
That's beautiful. Thank you very much.
Yes.
Thank you, Professor, and thank you everyone for joining us today.
Yes. And if I can get your card.
Thank you, gentlemen. Well done, well done. Here, I'll take that for you. We'll be back. Our award ceremony is starting momentarily at 4:50 this afternoon. That's going to be 4:50. If you have friends who aren't here yet, send them a text, give them a call, carrier pigeon, whatever works for you, as long as they get the message.
Hello, and thank you, Health 2.0, for this prestigious leadership award. I want to thank my colleagues, my friends, and my family for this recognition. I've been in medical devices, diagnostics, and health IT for over 25 years now, and it's been quite a ride. One thing I've learned in my leadership knowledge is to surround yourself with great people, which I think I've done in a variety of different positions. And one of my key adages that I picked up over the years is the difference between leaders and managers, or managers do things right and leaders do the right things. So I can say once again, thank you to everyone at the conference. Thank you for this recognition. Appreciate it a great deal and look forward to a promising career going forward. Thank you. Hello, and thank you, Health 2.0, for this prestigious leadership award. I want to thank my colleagues, my friends, and my family for this recognition. I've been in medical devices, diagnostics, and health IT for over 25 years now, and it's been quite a ride. One thing I've learned in my leadership knowledge is to surround yourself with great people, which I think I've done in a variety of different positions. And one of my key adages that
Thank you so much for giving me this Outstanding Leadership in Healthcare Award. I am thrilled and delighted, but most of all, feel really humbled because I know I stand. And I really do want to give a shout out to this one particular woman leader who's made everything happen in my life. My mom, you know, the best education.
Greetings, everyone.
everybody and all the judges for selecting me for this award, Health 2.0 Leadership.
Good afternoon, all. Thank you, Health 2.0, for this meaningful recognition of my leadership of the.
Hello, I'm Jean Chris of Crisscross Intimates and Jean Chris Media.
Hola Las Vegas, saludos desde Madrid, greetings from Spain. I am.
Hello everyone, my name is Kinjal. Thank you.
Hi everyone, this is Millicent Sykes here. Wish I could be there.
Coda.
Hi. Hello. Thank you. Working? Yeah. I'm extremely thankful for the committee for choosing me to receive this award. I'm extremely honored and humbled to accept this award. At Vascular Solutions, we believe in research. We believe in biomarker analysis. And we believe that one day we will reach our goal, which is our slogan, which is basically a blood test that can save lives. I would also like to thank my family, my wife and 3 kids. Daddy loves you. And thank you again for this award. Thank you.
Congratulations. Our next recipient is the founder and CEO of Fit to Be Strong Leader, is a registered psychiatric nurse with a doctorate in education and a master's in mental health nursing. Please welcome to the stage, Dr. Nida Nagra.
I'd like to start off by thanking Health 2.0 Conference for giving me this award. I am very grateful for it. I would also like to thank my family and friends who have constantly supported me and always believing in myself. It's been quite challenging for me in my leadership journey just because I often get judged or perceived for looking young. And so I am very grateful that I'm being recognized for my skills and abilities rather than the way I look. So thank you.
Thank you. Our next recipient is the founder of the Thin Line Peer Support Team Incorporated, where she established a peer support network for Nelson and Access ambulance companies in April of 2022. Welcome to the stage, Elizabeth Connolly.
Echoing all of my other recipients, I would like to thank the Health 2.0 Conference for honoring me with this award. First and foremost, I would like to thank my parents for all of their unconditional support over the years. Without their support and their education that they have given me over the years, I would not be standing where I am today. The unconditional support of my husband, I would not be standing here today. My amazing team back home in Connecticut, without their countless hours of volunteer work with the team, I wouldn't be in the leadership position I am today. And most importantly, I dedicate this award to all of the first responders, all the military personnel, and all the veterans that I am here standing for today. Their lives are the ones that we are doing this work for. And in special dedication, I dedicate this to Matthias Wirtz, who we lost back in December of 2022, and his wife, Barbara Wirtz, who has kind of become my surrogate mom, who is watching back home in Connecticut. Wirtzy, this is for you, and Barbara, this is for you. I promise to continue the work in your honor.
Thank you. Our next recipient is the Chief Medical Officer, Owner, and Administrator at De Anza Clinic, Imperial County. With a background in missionary work, she brings a strong sense of service to her role as a California-based physician. Please welcome to the stage, Minerva Calada. Minerva, are you here? Very well. We will accept this award on your behalf. Thank you very much. Our next recipient is the founder and executive director of Caring with Compassion Community, a seasoned disability awareness advocate, educator, consultant, and author with over 30 years of experience. Please welcome to the stage, Ronita Bolt. It is Is Ronita here? We will accept this award on your behalf. Congratulations. Our next recipient is the CEO of Ovelo LLC, a company dedicated to tackling social isolation. He achieved success with a leading social networking service platform for Japanese medical professionals. Please welcome to the stage, Shinichiro Konobi.
First, I'd like to express my deep gratitude to everyone at the conference for giving me the opportunity to receive this great honor. Thank you. My first company began as a telemedicine company. My first company started in 2014, which was a telemedicine company. And it was so successful that I sold the company in 2019, and now and have since then and taken on a journey to alleviate social isolation, which is a serious problem in the world. So I'm so fortunate to be able to take on a new journey with the same member from the previous company. So I have nothing but gratitude for the team members. And so this honor is not only for me, but for all the team members, including Q-san, Batayan, Miyagi-san, Endo-san, and so on. So I'd like to share this honor with them. So yeah, thank you.
Thank you. Our next recipient, as CEO of Onyx and editor of Distal Info Publications, they leverage their extensive experience and insights to drive meaningful change and growth in their industry. Please welcome to the stage, Sushil Ladwa.
Not in fact Sushil Ladwa. He's busy back at the office disrupting healthcare. I'm honored to accept the award from Health2O conference on his behalf. I've had the good fortune to be able to work with Sushil for the last 3 or 4 years as we've been busy disrupting healthcare by building FHIR-based interoperability solutions for health plans and health information exchanges, and basically trying to enable us as patients to gain access to our health data. So I accept this award on behalf of Sushil, and he's going to be busy disrupting healthcare from now on. Thank you.
Thank you. Congratulations. Our next recipient is going to be OnCode Health, which is an innovative organization that offers personalized solutions for connecting medical devices to clinical outcomes. They provide real-time data on implant usage, adverse incident reporting, and live supply chain management tools, transforming healthcare delivery with their efficient and tailored approach. To receive the award, we have with us Carlton Oscar Fitzpatrick, who is a business development professional at OnCode Health. Please welcome Mr. Fitzpatrick to the stage.
Yeah, now you can hear me right. Good, good. Hello, Las Vegas. I'm actually not Carlin Fitzpatrick. Carlin Fitzpatrick is my business development manager. I am the CEO of Encode Health. And unfortunately, Carlin cannot make it because I've treated him to a 2-hour massage. I think he needs it. So instead, I'm accepting this award on his behalf, on our behalf at Encode Health, whilst he's having a massage in Caesar's Palace. And I'm here. It is with heartfelt gratitude that I do receive this award, and thank you very much to Health 2.0 for giving us this award. Thank you very much.
Of course, thank you.
Congratulations.
Our next recipient is the principal consultant and founder of Pratima Shah Healthcare Consulting, specializing in healthcare management and strategic planning. Please welcome to the stage, Ankit Shah. Is Ankit in the building? We will accept this award on your behalf. Thank you very much. Our next recipient is the president and CEO of Avicen Medical, a leading manufacturer of non-invasive FDA-cleared medical devices. His extensive expertise and academic background make him a highly accomplished leader in the healthcare industry. Please welcome to the stage, Anthony Shimkim.
One thing I've learned in my leadership knowledge is to surround yourself with great people, which I think I've done in a variety of different positions. And one of my key adages that I picked up over the years is the difference between leaders and managers, or managers do things right and leaders do the right things. So I can say once again, thank you to everyone at the conference. Thank you for this recognition. I appreciate it a great deal and look forward to a promising career going forward. Thank you.
Congratulations, Anthony. Our next recipient is a passionate chief product officer at GHX, driven by a lifelong purpose to enhance healthcare and global health. With a focus on combining technology and human services, she strives to achieve sustainable outcomes for the betterment of people's lives. Please welcome to the stage, Archie Mayani.
So much for giving me this outstanding leadership in healthcare award. I am thrilled and delighted, but most of all, feel really humbled because I know I stand tall on the shoulders of these giants, these women leaders who came before me, their innumerable sacrifices and struggles that have afforded me this platform that I have today. And I really do want to give a shout out to this one particular woman leader who's made everything happen in my life. My mom, you know, the best educator, the best administrator, and the best leader I have seen and I have inspired to be. She is a true, passionate, one of the most generous leaders I have known, and I dedicate this award to you, Mama. I know these past few weeks have been tough, but I hope this will put a smile on your face, and no longer am I going to ask you, do I make you proud? Because I know you're very, very proud of me. Thank you again, all of you at the Health Conference 2.0 for giving me this recognition and opportunity and sharing my thoughts.
Congratulations, Archie. Thank you. Our next recipient is a clinical program coordinator at Children's National Hospital, specializing in hematology for sickle cell patients. With a passion for improving treatment models, Dr. Merriweather has received recognition and awards for her contributions to the field. Please welcome to the stage Dr. Brenda Merriweather.
Greetings, everyone. Greetings from Rockville, Maryland. I'm so sorry that I couldn't be there with you to enjoy the Health 2.0 conference in lovely Las Vegas, Nevada. Thank you so much from the bottom of my heart to all of the organizers on being awarded this very prestigious award, the Health 2.0 Outstanding Leadership Award. I wish so much that I could be there with you. Back in 2010, I developed a sickle cell disease treatment and case management model for sickle cell patients. Currently, I am continuing that work in order to improve care for sickle cell patients and also to improve their quality of life. If you would like to reach me regarding my work with sickle cell patients, I can be reached at area code 205-807-3913, or I can be reached by email at Brenda, BRENDA, the letter F is in Frank, the letter M is in Mary, the number 1968 at gmail.com. So that's Brenda FM 1968 at gmail.com. Once again, thank you so much for being awarded this very prestigious award. And I hope that you enjoy the conference and safe travels for everyone. Thank you so much.
Thank you. Our next recipient is a licensed professional counselor associate at Authentic Healing and Counseling. She is a mental health counselor based in Houston, Texas, specializing in utilizing creativity and her advocacy background to empower and encourage authenticity in her clients. Please welcome to the stage, Carolina Robledo. Carolina, we will accept this reward on your behalf. Up next, our next recipient is the CHRO and Vice President, People Strategy at Orea Soldiers Memorial Hospital. Pardon me. With over 25 years of experience in human resources, she provides strategic leadership and oversight for people services and patient relations and safety. Please welcome to the stage, Debbie Singh. We will accept this award on your behalf. Our next recipient is the founder of MSK Ultrasound Mastermind and an adjunct assistant professor at the City University of New York. Please welcome to the stage, Dr. Bashoy Gali. We will accept your award on your behalf. Thank you and congratulations. Our next recipient is the clinical fellow in GI liver pathology at Yale New Haven Hospital. She is a cancer researcher specializing in ovarian cancer, gastrointestinal tract, and liver cancers. Please welcome to the stage, Dr. Binny Kandakar, MD, FCAP. We will accept this award on your behalf. Congratulations, Doctor. Our next recipient is the founder and director of consultant surgeon of Alvi Health, a distinguished specialist surgeon known for his expertise in treating stomach and esophagus cancers. Please welcome to the stage, Dr. Krishna Murthy. I do apologize about the disturbance. Congratulations, Dr. Murthy. Our next recipient has an extensive background in project management and has been a member of the hospital's founding team since 2015. They have held a number of management positions in various companies, including partner communications in the worlds of industry and management, project management, and information systems analysis. Please welcome to the stage, Hezi Rosenberg. We will accept this award on your behalf. Congratulations. Our next recipient is the CEO of Precision Inc., a company specializing in developing clinical decision support products. With a focus on improving care and reducing the workload of medical staff, his company continues to lead the way in transforming the healthcare industry. Please welcome to the stage, Hisahiko Sato. We will accept this award on your behalf. Congratulations, Mr. Sato. Our next recipient is the Executive Director of the York Region Center for Community Safety, the first international affiliate of the Family Justice Center Alliance in the USA. Please welcome to the stage Jaspreet Gill.
Good afternoon, all. Thank you, Health 2.0, for this meaningful recognition of my leadership of the York Region Center for Community Safety, a co-located, coordinated, single access point for services within York Region, Canada, to meet the needs of those affected by intimate partner violence and sexual violence through an integrated, holistic access for services. We provide case management and system navigation support from a trauma-informed lens. Our services have always been essential, but the pandemic amplified intimate partner violence. Reported stats only tell us a fraction of the story. IPV has always been underreported, despite the fact that intimate partner violence is the most prevalent form of violence in the world today. It is also the most unseen and unacknowledged. It is so pervasive, 1 in 3 women throughout the world will experience physical and/or sexual violence by a partner. I have been driven to improve service access and supports for survivors at YRCCS, to create and foster partnerships and collaborations. The safety and well-being of survivors of IPV has been my mission at YRCCS. Healthy relationships lead to healthy families and communities. At YRCCS, we are able to contribute to the overall health and well-being of survivors and their children. A significant part of my successful leadership has been the amazing staff at YRCCS. Their hard work and dedication on behalf of survivors inspires me and has allowed me to do what I need to do on behalf of the organization so that we can continue to do what we do best. My heartfelt gratitude to my team, and thank you all again for this honor.
Congratulations, Jaspreet. Our next receiver is the founder and CEO of Crisscross Intimates, LLC. She is a multi-talented author, writer, mediapreneur, fashion designer, and tech innovator with over 25 years of experience in various media platforms. Welcome to the stage, Jean Criss.
Hello, I'm Jean Criss of Crisscross Intimates and Jean Criss Media. I'm honored to receive the 2023 International Health 2.0 Outstanding Leadership Award for Creativity and Innovation from my fashion brand, Crisscross Intimates. Since I was diagnosed with bilateral breast cancer in 2007, I dreamed of making healthcare improvements and advancements with medical devices for cancer survivors. That's what I set out to do with my utility patented product line. Today, Crisscross Intimates is an award-winning post-surgical brand, also accepted as a leading adaptive wear brand for people with disabilities and worn as an activewear, showing the versatility and longevity in the post-surgical undergarments. Our slogan, "Feel confident, look beautiful, or handsome," really comes to life in the colorful contemporary styles for women and men. If you're interested in learning more, please contact me at jean@crisscrossintimates.com. We are also seeking angel investors to introduce our additional patented designs. I look forward to hearing from you. Thank you so much.
Congratulations. Thank you. Our next recipient is the founder and CEO of Aldebaran Health Intelligence SL, an MD and business entrepreneur with over 20 years of experience in the healthcare system. Please welcome to the stage Joaquin Casariego.
Chief Executive Officer of Aldebaran Health Intelligence. It is an absolute pleasure and Hola Las Vegas, saludos desde Madrid, greetings from Spain. I am Joaquin Casariego. I am the Chief Executive Officer of Aldebaran Health Intelligence. It is an absolute pleasure and a privilege being here with you today at the Health 2.0 conference. And indeed, I feel grateful and honored for this recognition that my family and myself will keep very close to our hearts. Unfortunately, unavoidable duties have made me impossible to attend a meeting face-to-face and meet you all. We are engaged in critical activities in order to make the good to others. And this is exactly what we try to do in Aldebaran Health Intelligence. We give support to the pharma industry and biotech industry and the healthcare institutions through advice and counseling in strategy and in clinical research, but more importantly, disruptive learning and development programs that will transform the lives of the participants and hopefully the organizations. Programs like the Bootcamp Hero, an innovative, impactful, and indeed memorable experiential learning program for professionals from any sector, any function, any role, and interestingly, any background, using an original proprietary methodology that blends the fascinating worlds of clinical simulation and the case method from business schools towards the synchronous development of core competences and psychological capital and psychological safety. It's been said that whatever happens in Vegas remains in Vegas. I would encourage you not to keep what happens in Vegas during the Health 2.0 conference for yourselves, but instead to share it broadly, because of it will be for sure very impactful and contribute to make a better world. Thank you so much for this opportunity, and let's reconnect very soon. Bye-bye.
Thank you. Our next recipient is a business leader at Swathia by Kinjal, inspiring others to embrace vegan food and its impact on personal health and the environment. Please welcome to the stage, Kinjal Patel.
Thank you so much for the invitation to attend the Health 2.0 International Conference. My name is Kinjal Patel. I am answering from Edison, New Jersey, USA. I am a founder of swasthyabykinjal.com. Swasthya by Kinjal talks about how to get your life back after pregnancy, how to lose weight, and how to diet properly with the veganism strictly, and how to live a sustainable lifestyle. I want to say thank you to Health 2.0 because I never attended anything like this before. I never acknowledged. So this is my first time doing it, and I am happy to be part of it. The reason why, because I see a lot of different innovation, ideas, distribution, discussion, different diversity in the panel discussion, and speakers has participated from all over the world, which is very rarely to find, and I'm glad that I'm part of it. I believe it's in UAE 3-day conference. I cannot attend due to my other busy schedule meetings that I had to, but I'm happy to go over the video if you guys send it to me. That would be great. So we are all here to try to push the envelope to help the people in need and make life better, how to live disease-free lifestyle. And it can be done, can be achievable, but everyone needs to be part of it with their own different life journeys. So thank you so again for the beautiful award that you guys are willing to give it to me, which is outstanding. Thank you again.
Thank you and congratulations. Our next recipient is a registered nurse at Wellness Infinito, a company that revolutionizes health and wellness education through healthtainment. Please welcome Latifat Ajentun Mobi. we will accept this award on your behalf, and I apologize for any misspellings or mispronunciations. Our next recipient is the Chief Financial Officer at Medexus Pharmaceuticals Incorporated. He is a senior finance executive with a proven track record of success in global Fortune 100 companies, as well as medium and small size entities. Please welcome to the stage, Marcel Conrad. Marcel, we will accept this award on your behalf. Our next recipient is a global practice leader driving equitable access to quality care, privacy, and protection through breakthrough technologies. As the founder of Disruptive RX Media, she brings awareness to practical applications of emerging technologies. Welcome to the stage, Maria Palombini. We will accept this award on your behalf, Maria. Congratulations. Our next recipient is an associate professional clinical counselor at Good Therapy San Diego with a focus on mindfulness, interpersonal effectiveness, emotional expression, and identifying maladaptive coping strategies. She strives to uncover individual barriers to connection and motivation, facilitating personal growth and healing. Welcome to the stage, Millicent Sykes.
Hey everyone, this is Millicent Sykes here. Wish I could be there, but life got in the way. I want to say thank you for this opportunity and recognition. I'm still new in my career, but it's been a long journey. I hope everyone's having a great time there. The classics, friend, family, experiences, former employees or employers. I want to thank everyone and thank you.
Congratulations, thank you. Our next recipient is the Director of Business Platforms and Healthcare at Advantasure, a UST health-proof company. With a focus on operational excellence and stability in healthcare operations, they guide business and IT executives in making strategic investment decisions. Please welcome to the stage, Mridul Dinesh Kumar
Good afternoon,
Gupta.
Las Vegas. Thank you so much for bestowing this prestigious award honoring outstanding contributions in US healthcare space. I know this is an individual award, but I really want to acknowledge through this forum that this could not have been possible without the immense support from teams, partners, and stakeholders who have worked with me all these years. I could not thank you enough, all the health conference team members, to have been continuously working with me to make sure that we have covered everything that is needed to present this award. I know I could not attend this in person, but maybe next year. I also would like to congratulate each and every other awardee as well who's sharing this forum today with me. You all deserve to be awarded. Thank you once again. Goodbye.
Congratulations, Mr. Gupta, and I do apologize for any mispronunciations. Our next recipient is the visionary CEO of Tidbit, a rapidly growing company in the health and education industries. Please welcome to the stage, Shubham Pandya.
Good afternoon, ladies and gentlemen. It is truly a privilege and an honor to receive this prestigious award today for outstanding leadership in healthcare as the CEO of Tidbit. The credit for this award is undoubtedly shared amongst all the leaders at the company. And so first and foremost, I want to recognize and thank my closest friends and co-founders, Dr. Sparsha and Nilay Shah. We co-founded Tidbit with the mission of simplifying medical research communication. And since then, Tidbit has changed how millions of researchers and doctors at leading universities and academic institutions now share and consume medical research. And it could not have been possible without the uncompromising dedication from the entire leadership team. So big thanks to both of you. And I also want to thank my parents for their ongoing support, sacrifices, and motivation. They've allowed me to pursue my dream, and I owe every ounce of gratitude to both of them for that. Thank you, Mommy, and thank you, Papa, for everything. And I also want to thank my partner, Rennie, for believing in me even in times where I doubted myself. She has been extremely supportive, understanding, and constantly drives me to push through new heights. So for all that, thank you, honey. And finally, I want to thank the Health 2.0 conference for providing recognition to me on a global platform for my contributions to the healthcare community. Now, while I'm extremely proud of this achievement, I'm even more excited to continue to take Tidbit to higher heights in the future and exponentially increase its impact to billions in the coming years. Thank you, everyone, for bearing with my long speech, but I'll be sure to have it summarized in a tidbit for you on the website. Have a fantastic conference and the rest of the evening.
Congratulations, and I do apologize for any mispronunciations. Our next recipient is the Chief Operating Officer at the Headworks Clinic, the only neurologist-led facility in Ontario. She administers TMS treatment for patients with neurological conditions while pursuing a master's in business. Please welcome to the stage, Tuka Jamil. We will accept this award on your behalf. Congratulations. Our next recipient is the Vice President of Medical Affairs at Cooper Surgical, a renowned market leader in women's healthcare devices. Please welcome to the stage, Vrunda B. Desai, MD. We will accept this award on your behalf. Congratulations. Our next recipient is a company specializing in developing clinical decision support products with a focus on improving care and reducing the workload of medical staff. This company continues to lead the way in transforming the healthcare industry. Please welcome to the stage Dr. Hisahiko Sato to accept the award on behalf of Precision Inc. We will accept this award on your behalf. Congratulations. Our next recipient is the founder of Makshivim Net Ltd, bringing over 20 years of experience in working with people with disabilities. He has served as the CEO of Makshivim Net from 2008 to 2017 and has been a sought-after lecturer at universities and international conferences. Please welcome to the stage, Aitin Ben Itzhak Kuch.
Okay. I want to thank about the award. I want to thank my wife that sent me along and my daughter. And we have the Makshivim Net. It's pronounced Makshivim Net. Okay.
Please,
Yeah.
let the world know your name.
And we are doing a digital solution for people with mental health and disability since 2008. And thank you very much.
Congratulations. Our next recipient is a co-founder of EMD and Beyond LLC, established in 2015 in West Des Moines, Iowa. As the director, they oversaw and managed the education, training, and consultation for clinicians and agencies. Please welcome to the stage, Bonnie Mickelson.
adult therapists be transformed by the positive client outcomes they now can achieve. We also are dedicated to mentoring and equipping expert mental health professionals throughout the Midwest to provide training and education to this generation of clinicians. Experts or not, we all need to know about the impact of trauma and stress on the productivity, emotional reactivity, and health of our people. Understanding our group's emotional intelligence is critical as well. We know so much we have yet to make use of, such as the ACEs study, which should have revolutionized medical treatment, but did not. So here's to all of you and your commitment to change. the culture around you. I'm honored to be included among you. Thank you.
Congratulations, Bonnie. Our next recipient is a senior finance executive who has achieved remarkable success in various business environments, ranging from global Fortune 100 companies to medium and small-size entities. Please welcome to the stage Marcel Conrad. We will accept this award on your behalf. Our next recipient is the CEO and founder of Field Talk Inc. and is a transformative figure in the field of mental health. Please welcome to the stage Dr. Ravshir Gill. I do believe Mr. Gill has a video. That would be Dr. Gill to me.
Hola. Thank you, Health 2.0, for honoring me as an outstanding leader this year in the Leadership Award category. I'm very privileged and honored to be receiving this award. My apologies, I couldn't be there in person. I'm currently the CEO and founder of Field Talk Inc., which is a mental health and education company, and we primarily focus on shedding light through workshops, educational mental health and wellness workshops, and we are able to spread the message of being able to bridge both clinical and holistic sides of medicine and structurally enhance the mental health system from the ground up. Now, leadership, as we know, does not start from the top. Leadership starts from the bottom. It actually starts with every single person that has impacted you on your journey. It starts from even the interactions sometimes at the coffee shop. In my opinion, leadership is the aspect and accumulation of experiences that you have on the journey of creating something great to impact the world. And that's what Field Talk has been. That has been my vision. And I just wanted to thank my team, every single person that has worked on Field Talk, directly or indirectly from the beginning. I wanted to thank them in this speech. And I wanted to also thank all the people in my personal life that have been such a great encouragement throughout this entire process of developing and really rising from the ashes this company. Right now we are delivering mental health and wellness workshops with non-for-profits across Ontario, Canada. Yes, I am Canadian, and we're looking to expand nationally and far beyond that. Structural change and health equity is something that is extremely important to me, something that I experienced personally myself. And with that being said, the system does need to change, and the change in the system can only come, in my opinion, from within. And being a physician myself and having that ground knowledge, I'm out here venturing into really changing the structural system of mental health care from the ground up. And that is not just the challenge of a leader, but is also the vision. So here at Field Talk, we want to spread the vision of hope, that no matter how difficult the situation might look, no matter how confusing the system might be, that there is hope and that your life matters.
Congratulations. For our final award of the evening, we are actually going to go backwards. We are going to show the video for a previous recipient that did not play earlier, and that's for Dr. Binny Kandekar. I'm going to reintroduce him real quick, and then we will play their video. I do apologize, Dr. Binny. Dr. Binny is the clinical fellow in GI liver pathology at Yale New Haven Hospital. She is a cancer researcher specializing in ovarian cancer, gastrointestinal tract, and liver cancers. Welcome to the screen, Dr. Bini Khandekar.
Hi, this is Dr. Bini Khandekar, and I would like to thank everybody and all the judges for selecting me for this award, Health 2.0 Leadership Award. A little bit about me. I am a research scientist and medical doctor from India. I graduated from All India Institute of Medical Sciences in New Delhi, and currently I'm pursuing my postdoctoral fellowship at Yale University under Yale New Haven Hospital, GI Pathology. I graduated from Mount Sinai Hospital and I completed my residency there. Thereafter, I did a year of oncologic surgical pathology at Memorial Sloan Kettering. My research focus is cancer of gastrointestinal tract diseases, and my goal in the future is to develop personalized medicine for treatment of cancer patients, and so that they live better life, longer life, and healthy life. And I would like to again thank you everybody for selecting me for this award, and I feel very fortunate. Thank you so much.
Congratulations, Doctor. Honorees, your contribution to this event has been invaluable, and our hearty applause goes out to all the esteemed awardees and honorees of the Health 2.0 Conference's Summer Edition. As we prepare to close the curtains on this year's Health 2.0 Conference, we're filled with a sense of fulfillment and anticipation for what lies ahead. Our heartfelt appreciation goes out to our media partners and exhibitors who have made this event dynamic and engaging. Here's a special shout out to our gold sponsor, Nemours Children's Health, and silver sponsor, BrainTap Inc. We could not have done this without your steadfast support. Thank you to our sponsors. Having had the privilege to MC for such a vibrant audience, this has been a unique and gratifying experience for myself. I've been your host this evening, Julian Lucas, and I'm bidding you adieu, and we eagerly await your return for our next year's editions. Until then, stay safe and keep on innovating. Thank you, and good evening.